this. They're angry, they're ticked off, they don't want to have anything to do with mental health. But there are markers and building blocks that build upon one another. Similarly, anger about certain circumstances, being fired or their employer in Odessa and Sutherland Springs, hatred against culture or race, obsession with a particular culture like El Paso and Charleston, South Carolina. There was a detailed FBI study that looked at 160 active shooters. The FBI is not looking for someone that has mental health problems, and they're not looking for someone who's a loner. What they're doing is they're looking for atypical behavior, someone who's changed in their functioning, their activities of daily living. In other words, they're moving on this trajectory towards violence. They may have a grievance that's real or perceived against their spouse, their boss, their employer. They think they're shunned or spurned, and they get more obsessed about it. So looking for planning, preparing, purchasing guns, stockpiling guns, ammunition, clothing, ballistic vests. I would add to that, as a psychiatrist, what they're posting on social media, what they say to family members, sometimes just offhand comments to people that they say as they're going from point A to point B. They might say something to the gas station attendant about, I'm going to shoot up some people, or people are going to die today. So indirect or direct comments to peers, family members, or support. So those are behaviors that need to be reported, and reported right away. Number 3, I'd like to change points here and talk a little bit about a novel concept. I trained in forensic psychiatry, and that's for the attorneys here. Those are individuals that do competency to stand trial evaluations, not guilty by reason of insanity evaluations, work in state prisons or forensic units. We have a shortage in Texas. We have one forensic psychiatry fellowship training program in the whole state of Texas, and they have one fellow. Where I train at Yale in Connecticut, we turn out 4 fellows a year. Our state hospitals were well-staffed. Our correctional facilities up in Connecticut were well-staffed. We had folks that could do risk assessment. So really need staff that are trained up. So we're TSPP, we're exploring the proposed expansion and funding of additional fellowship programs in forensic psychiatry because it's really an underserved area. We think that this will help our county jails when you have a wait list of 6 months to a year to get somebody from your county jail to the state hospital for competency restoration. Having forensic psychiatrists that could work evaluating individuals for their competency to stand trial and then helping restore their competency and cut down on that delay and excess time, and that's very frustrating for a lot of folks. So we proposed through the Texas Medical Association and Texas Health and Human Services a request for additional funding, and not only for forensic psychiatry, but we really need to educate our workforce, psychologists, psychiatrists, general family physicians, family doctors, surgeons, ER doctors, licensed professional counselors, social workers, school psychologists. Everyone needs to increase their knowledge of how to identify somebody who might be at risk and what to do about it. One of the biggest challenges we deal with in healthcare is our whole thing about HIPAA and protected health information. So we're very leery of doing a terrorist-off warning. That's a landmark case from California, and it involved a shooting on a school campus, and duty to warn and duty to protect. And a lot of times healthcare professionals, be they medical, surgical, or mental health, are worried about, if I violate this patient's confidentiality, are they going to sue me, or am I going to get in trouble, or disciplined, or what have you. So we really need to work on ways of sharing of privacy and healthcare information between agencies, across agencies and entities. It needs to be worked on, and I do have a specific recommendation about that. Point 4, and this one probably will hit some nerves, but psychotropic meds, psych meds, do not cause individual or mass violence. I'd like to repeat that. Psych meds do not cause people to go and shoot people or kill people. It's true that the use of psych meds has skyrocketed. There's a significant increase since the 1980s. The use of Ritalin has 4-fold increase. Use of antidepressants in teenagers has 4-fold increase. 75% increase in antidepressants over the last 10 years. There's no question that over the last 25 years, more psychotropic meds are being prescribed, not just by psychiatrists, family doctors, pediatricians, you name it. The issue is that there's no scientific data or evidence that psychotropic meds cause violence or aggression or shooting. And in fact, there's not been a corresponding increase in violence. Even though our psych med usage has gone up, our violence has not. Violence crime has actually decreased in spite of what happened here in El Paso. violent crime has decreased significantly in the United States. It declined 47%, excuse me, from 1991 through 2010, and the homicide rate across all ages decreased 51% from 91 through 2010. And in kids between 10 and 24, that's a population that has a fourfold increase in psych med use. Their male homicide rate decreased 40% and female homicide rate decreased 51%. So take-home point is there's no scientific data or evidence that use of psych meds is just not supported by data. Sometimes people will ask me, well, what about the shooters that were on meds or the meds were stopped? Maybe they went through some withdrawal and it made them aggressive or violent. According to school shootings, according to the research we have, only out of the 24 secondary school shooters, only 2 were on psych meds and only 1 had stopped them prior to the attack. So 12% were taking meds, but 87% were not on psych meds. And same thing for college and adult shooters. Only of 24, only 2 were on psych meds and only 1 had recently stopped taking his meds. And so there's no evidence, take home point, there's no evidence that psych meds made them manic, agitated, or violent, or psychotic, or that sort of thing. In the interest of time, I think I'm just going to move on, and point number 5 is that, and we've sat through this, and the testimony of our witnesses was particularly powerful. The impact, I can't even begin to imagine our first responders, our law enforcement, our physicians, nurses, and healthcare staff that were in the ER dealing with that. There's a ripple effect, not just the first responders, but the community, the sense of safety, normality for kids growing up, the sense of the world's a safe place, it's a predictable place. You go about your routines and now somebody comes in and does something horrific like this. So it's not uncommon that a lot of folks develop depression, PTSD, acute trauma, acute stress disorder, adjustment disorder, drug and alcohol issues, and that it has a societal effect, that funding for their medical and surgical care, I can't even begin to imagine their insurance bills, who's paying these bills. So there's a huge ripple effect. So let me move on in the interest of time to my final recommendation. So again, disclaimer, these are reflective professional and not my position or my employer, UT, University of Texas. Several studies, and I have the links to this, that link a prevalence of firearms to homicide and suicide rates. And I know we're not focused on suicide today, but that's a biggie too. Specific research on gun violence by the Consortium on Risk-Based Firearm Policy, which includes kind of our nation's leaders and researchers and think tank, if you will, on gun violence and mental health, has led to some recommendations that our great state of Texas might consider. 1, strengthen state law to temporarily restrict individuals from purchasing or possessing firearms after involuntary hospitalization. So we're not talking about you can't go, shooting, deer hunting. I mean, that's not the issue. The issue is when somebody's civilly committed to a psychiatric hospital and it's been clarified that they are imminent risk of harm to self or others, that's the individuals that perhaps temporarily restrict guns from them. And there would be a due process proceeding, and it'd have to be predicated on a clinical finding that they're in imminent danger of harm to self or others. And then after the fact, once they've been treated and healed and improved, the restoration of rights would be based on clinical evaluation by a qualified healthcare professional that the petitioner is unlikely to relapse. Number 2, considering restrictions on the ability to purchase or possess firearms that reflect evidence-based risks of danger. So convictions of violent misdemeanors, 2 or more DWIs in the last 5 years, 2 or more convictions of crimes involving a controlled substance within the 5 years. So those are based on the Consortium of Risk-Based Firearm Policy nationally. TSPP, the Texas Society of Psychiatric Physicians, we have these specific recommendations. Developing a mechanism for our law enforcement personnel to remove firearms when they identify someone who poses an immediate threat of harm, as well as a means to request a warrant for gun removal when the threat of harm is credible but not imminent. And family members and partners should have a means to petition the court to authorize the removal of firearms based, again, on a credible risk of physical harm to others. Again, there would need to be due process protections, legal protections and that sort of thing, and a hearing after the gun removal and a way to ensure processes are in place to remove any removed guns after the temporary prohibition. Lastly, clarify Texas law on disclosing patient information for safety. We need to have a way for professionals such as physicians, mental health professionals, to disclose confidential patient information to medical or law enforcement if we identify that there's a probability of imminent physical injury by the patient to the patient or to others, imminent risk of harm to self or others, and that there's a probability of immediate mental or emotional injury. I know that in the last session, a bill was filed related to this. It was House Bill 3519, but it didn't pass. Thank you so much for allowing me to be here. Es un honor y un placer estar aquí con ustedes. Muchísimas gracias. I'm available to the committee if you have any questions or need any additional information. I'm happy to take questions at the end of the panel. Thank you.
Thank you, Dr. Boone. Dr. Tyrod.
Good morning. Welcome to El Paso. I want to thank you for allowing us to tell our story to you, and thank you, Congressman Blanco and Congressman Moody, for representing El Paso on this committee, and happy birthday. My name is Alan Tarek. I'm the Chair of Surgery at Texas Tech Health Sciences Center here in El Paso. I'm also the Trauma Medical Director at UMC El Paso, which is the Level 1 Trauma Center for the region. I'm also the Vice Chair of the Governor's EMS and Trauma Council. I was appointed by Governor Perry and then reappointed by Governor Abbott last year. Today I'm actually speaking on behalf of the Texas Medical Association and the over 53,000 physician representatives. What happened on August 3rd was horrific. El Paso was terribly impacted, as you heard earlier today. It's still hard to come to grasp as to what happened. 22 people died. 25 others were injured. This does not count all the after effects to people that are suffering from PTSD and depression, as well as the healthcare providers, fire, EMS, and police. It does impact us. There's actually literature that shows that 30% of residents that experience this, like in Orlando that time, they did some studies, 7 months later, over a third of these residents still suffered PTSD that were involved that day in Orlando. What happened was terrible. UMC that day received 14 victims within 34 minutes. 6 patients went immediately to the OR. We did 7 surgeries that day as well as multiple other procedures. Unfortunately, one lady did pass away from lethal injuries in the trauma bay, but 14 others survived. Their ages ranged from 5 months of age to 87 years of age. One patient stayed 62 days in our hospital, and some are still requiring surgery, and obviously they have emotional baggage that they still need to deal with. I understand as a few days ago still at the Level 2 Trauma Center in town that received 11 victims, one patient is still in their hospital suffering from his injuries. I want to emphasize that El Paso is a safe community. We're a tight-knit community. What was done that day was done by an outsider. I must say that I'm a firm believer in the Second Amendment, but I do believe in responsible gun ownership. For full disclosure, I don't even own a gun, unless you want to count a BB gun that I bought for my kids. But I grew up in Central Texas shooting guns, went deer hunting every year with my parents, went dove hunting every summer. That was just what we did. My brother goes hunting every day if he's not going fishing. He has a farm in East Bell County, which is my great-grandfather's farm. My mom, to the day she died at the age of 89, she had a shotgun behind her front door out in the country. And the reason she did that was to protect herself. I can guarantee you not a single possum, skunk, or snake survived her yard because she was pretty good at shooting them. So that was the culture I grew up with. I mean, when we went to school, I went to a 1A school, which means I had 50 kids in my graduating class. The guys, we all carried guns in our gun rack because we went shooting afterwards. Nobody thought twice. Oh my God, this guy has a shotgun in his pickup. Can you imagine now some kid brought a gun to school? It'd be crazy. So, but as a surgeon and as a physician, I need to rely on facts and data to make my clinical decisions in the OR or in the trauma bay. So please bear with me for the next few minutes. I'm going to give you some data. What I say may actually upset some people in the audience and surprise some people. I also try not to use the word or phrase gun control because I think it stirs up a visceral response from many people. I like to begin my conversation when I discuss this topic on how can we reduce firearm-related violence, or in other words, how to reduce death and disability from guns. I do think firearm violence is a public health issue, and that's how we should approach it. And that's exactly what I told President Trump when he came and saw us on August 7th, and I told the same thing to Senator Cruz. It really is. Think what we did in the 1960s. There was more people dying in the 1960s from car crashes than now. we approach car wrecks as a public health issue. Now we have seat belts and we have airbags, on and on. Roads are safer. What did we do with cancer? We fought the battle on cancer, smoking, HIV. We treated those as public health issues. Firearm violence is a public health problem. So here's some data to make it a little dry here. There were nearly 40,000 gun-related deaths in 2017. This is CDC data. 60% were due to suicide, and 37% were due to homicide. For comparison's sake, we always hear about the opiate-related problems, and it's a big issue. It's a crisis. That same year, there were 70,000 people that died due to opiate overdose. And about 33,000 people died on our nation's highways and roads from car crashes versus almost 40,000 from gunshots. On the other hand, the rate of gun-related deaths has actually declined. In the 70s and 80s, there was about 16 deaths per 100,000 population. It's actually reduced by 12 deaths per 100,000, from 16 to 12. So it's actually gone down. Violence has gone down in the society. Not El Paso, but Texas it's fairly safe. When you look at the 50 states, we are ranked the 24th safest state in the country based on gun violence. The worst is Alaska, for whatever reason. It's probably being colder and dark all the time. And Hawaii is the safest. From a statistical perspective, when we look at mass shootings or active shooters, so what is an active shooter, first of all? The FBI defines that as a shooter or shooters that have killed 3 or more victims, not including the person themselves, because 80% of these people will shoot themselves or the law enforcement will kill them afterwards. Less than 1% of all gun-related deaths are due to mass shootings, less than 1%. But what is concerning, they are becoming more frequent and they are becoming larger in scale. Let's think about Orlando, 2016, 49 people lost their lives. Think about Vegas in 2017, 58 deaths. Not to mention there was hundreds of people that were injured. I could not even imagine trying to take care of that many injured people. There were 3 trauma centers in Vegas. I heard all 3 trauma directors speak, and they talked to how they dealt with that. I'm actually going to be speaking with that panel in April to see lessons learned about that. But it is becoming worse. What's also concerning in the last 10 years, when you look at the 10 top mass shootings in this country, the 10 top, Texas has 3 of them. Sutherland Springs, 2017, 26 deaths in a church. El Paso, 22 deaths. Fort Hood, a military base, 13 deaths. That was 10 years ago. We have 3 of the top 10. This does not include these other mass shootings. Killeen in 1991, Luby's. That was close to where I grew up. 23 people lost their lives that day. And that definitely was some spousal-related stuff. He was out to kill, he hated women. One of my best friends, his sister, he personally used her name because she worked for Bell County and said, I want to kill the Bell County women. So there is some trend there. The Santa Fe school shooting, 10 deaths. The Dallas police officers, 5 deaths. The UT Tower, I was only 5 or 6 years old at that time. There was 18 people died. I remember hearing about that as a kid. We thought that was just an anomaly. Now, unfortunately, we see it too often. The Odessa shooting occurred only 4 weeks after the El Paso shooting. We thought we were going to actually get victims from there because West Texas, 100 miles away, is really not very far for us. There were 7 people died that day. Then also that same day, a few hours later in Dayton, Ohio, 7 people lost their lives. A few days before El Paso, Gilroy, California, those people. But we also, I gave you some data about firearm violence. We also need to be realistic with our facts. 30% of Americans own a gun. Another 11% live with somebody that own a gun. That means 41% of our households, people have guns. 48% of us grew up in a household with guns. 55% of us, or half of us, know someone personally or close that owns a gun. 72% of us have fired a gun at least once in our life. Most of us have been hunters as kids. 66% of us that own a gun, and I don't own a gun now, except for a BB gun, have more than one gun. So 2/3 of people that own one gun have more than one. 29% of those have at least 5 guns in their house or the household. So that's a lot of guns to confiscate or to buy back. That's really not practical. That's not going to happen. It's probably not the right thing to do anyway. We know this topic is extremely divisive and very political. It became very political in El Paso on August 3rd, that same afternoon, and it got worse from the 3rd through the 7th. We need to pull back from this rhetoric, the political, arguing back and forth, and just treat it as a public health initiative. There's also no easy fix or one solution to this. Because such, sorry for my, it's a little hard to grab this thing here. Because such senseless tragedies continue to happen across our state, the Texas Medical Association actually established some strong policy in 2019, and this actually occurred even before the El Paso and the Odessa events, how to address violence and firearm injury in the state. We must embrace this topic no longer as just a safety concern, but a public health crisis. We, as TMA, provide the following recommendations, and these are very similar to what I just heard from the panel. I should also mention that I sit on the American College of Surgeons Committee on Trauma, and we debated this since the last 5 years, and a lot of what I'm saying for the TMA, the Committee of Trauma will say the same thing, and I brought this topic up to the senators when they came here in October. So here's number one from the TMA. Prioritize the prevention of firearm injuries and death by educating Texans about firearm safety as well as the potential hazards of ownership of guns. Number two, promote the Texas Hunter Education and Certification Program developed by the Texas Department of Parks and Wildlife. Number three, ensure that the patient-physician communication is protected so we as physicians can provide guidance on the dangers of firearm ownership in the clinical setting in an informational, non-judgmental manner, just like we do about smoking cessation, or you're drinking too much alcohol, or you're eating too much, you need to lose some weight. It's the same problem, people. As physicians who care for patients, we should be able to encourage firearm owners to adhere to the best practices for reducing the risk of injury and death. This includes ensuring firearms are not accessible to children or people with mental, behavioral, or substance use disorders. They were very correct. Most people that are involved in mass violence don't have mental issues, as they talked about. And on the other hand, many of these people are actually victims of this. Number four, strictly enforce the federal and state gun control laws that are already in place. We need to enforce those, as well as for the penalties that are in place for the crimes committed with a firearm, including the illegal possession of firearms. Number five, promote the use of trigger locks and locked gun cabinets to help prevent unintentional discharge. We can make guns smarter. We can make guns safer. We should be doing that. We're not doing that. Number six, equip and empower the Texas Department of State Health Services to perform unfettered study of issues involving firearm and public health. Texas should participate in national surveillance studies in violence in the U.S., ensuring that the state has timely, accurate data on firearm-related mortality and morbidity to guide the Texas's public health prevention activities. I can tell you that there's very minimal research, especially on a federal level, on gun safety. We don't know if video games actually even cause people to do this. Some people say, yeah. We don't know that. Some of the injury prevention initiatives that we do in our trauma centers, that's a mandate that we have by the Committee of Trauma, the ACS. We try to do these things. We think they work. We don't have any data to do that. We really need to get more research into firearm violence. Number seven, develop an effective process for implementing protective orders to respond to individuals reported to be at high risk of violence to themselves or others at that time. Number eight, align the Texas laws with federal HIPAA, which is patient confidentiality, allowances to disclose patient information for safety. The state should give physicians the ability to disclose confidential patient information to the medical or law enforcement personnel if a person, meaning the healthcare provider, determines that there is a probability of imminent physical injury by the patient to himself or others, or if there's a probability of immediate mental or emotional injury to the patient. I think this is sort of like the red flag laws, which we can do this. I think the senator's back there, he had a good proposal. He tried to get through the various legislative sessions. I think a couple of House members also tried this unsuccessfully. The TMA applauds the efforts of this select committee to help prevent the tragedy we saw here in El Paso, and we want to prevent this from happening to other Texas communities. We recognize as a TMA that gun ownership is associated with the individual's personal freedom and protection is a key reason why many people own firearms. Let's just think back a few weeks ago in Fort Worth, Texas. The perpetrator was killed by an individual who had a gun. They actually were doing it for their own protection. I think back in East Bell County, we live out in a rural area. Somebody could go in that church and just kill every person in that church, but that's what they did in Fort Worth to prevent that. So there are things we can do. In the same vein of protection, our members remain focused on proven prevention and harm reduction methods in all areas of public and population health. Physicians accept their role in addressing mass violence and firearm safety, and we are compelled to do all that we can help protect our patients and their families. Lastly, I want to emphasize that the EMS and trauma system in El Paso worked that Saturday. We did a great job. We prepared. We practiced. The HCA hospital system, the Tenet hospital system, and the El Paso County Hospital District, meaning the Level 1 Trauma Center, we all worked together. We actually did an active shooter event in October at the El Paso airport where we had, quote, 100 victims that we practiced on. So we work as a regional advisory council in a trauma service area. This includes the first responders, which is the paramedics, EMS, police, and fire. And also I want to acknowledge the immediate responders, which is the public, who did an incredible job that Saturday. There were a lot of leaders that stood up. There was a lot of heroes that day. And lastly, I do want to thank the committee and the Texas legislature for all the work you guys and ladies have done over the decades to make the Texas trauma system what it is today. This thing started out in 1989 with no funding from the legislature for that. And then the Tobacco Fund came and supported it. And then we had the Driver Responsibility Act, which had those issues. And then we also had the secret money that we had that went away. But that being said, the Texas trauma system is a model for this country, and you people helped make that happen. And I thank you for that. In addition to representing, or to respect the Second Amendment, which I said earlier, I really do. I cherish the First Amendment. I thank you for giving me the opportunity to speak to you today. Thank you for coming here. Texas is an action-oriented state. We as Texans want to make things happen. Let's make this thing work. Let's fix the problem. Thank you for your time. El Paso strong.
Thank you to the panel, very powerful. To all the panelists, I would say that each committee member is very intently listening to what you're saying. Our capacity to retain that is limited. So would I impose on each one of you to submit your testimony in writing? I know we have a audio recording of it, but I'd like to disseminate that to the members of the panel. Dr. Loudon, have you published your work with regard to these mental health issues?
I have published some work on the link between mental illness and crime and violence more generally. I've not published specifically on mass violence, but there are some very excellent resources that I can refer you to.
Well, I would appreciate, and I think the committee would also, links, if you will. Dr. Penn, you had some links too that will be available to the committee. At this time, I'll open it up to questions. Representative Blanco.
Thank you, Mr. Chairman. This question is for Dr. Penn. Part of what we're looking at today are protocols for threat assessment. And in your testimony, you had mentioned that social media behavior must be looked at. We've had previous hearings where social media platforms have been inactive and unwilling to be responsible citizens, so to speak, in the detection, in the risk assessment. So my question to you is, are there any recommendations through the, either through the Texas Society of Psychiatric Physicians or a national organization that is similar, that is working with social media platforms to implement risk assessment protocols, whether it be through forensic psychiatry protocols? What can you tell us on that front so we can look into this a little further?
Thank you, Representative Blanco. So I think the concept, first of all, I'll answer in twofold. One, the issue of threat assessment, it's really a complicated issue, but it's a multidisciplinary approach, working together with law enforcement, emergency rooms, trying to figure out, is someone intoxicated? Is their blood alcohol level too high? And maybe if they sober up or their BAL's low, they won't be that dangerous, getting guns out of the house, that sort of thing. Figuring out the acute crisis, is there some domestic violence issue going on at that moment in time? How to keep the family or the kids safe, what to do about that individual. Do they need to be held against their will in the emergency room and or sent to a psychiatric facility? I think the issue of social media, I'll be very frank, we're physicians and I'm old school. Like my kids they can teach me about social media. So we have a long way to go to learn what social media is and what it's not. And I think I was at the Senate committee where the video game folks testified, and they were kind of like, look, they washed their hands, kind of just like Pontius Pilate, if you will. They said, we're in the media video game business. That's what we're here to make money. And they had no accountability. And so, again, I don't want to cast stones and say that LinkedIn or Facebook or Instagram or whatever those social media or should be on the hook and should be civilly liable for whatever they do or don't do, because then I think it'll dry up and people won't post things. But I think we and I'll speak not just for psychiatry, but pediatricians, primary care doctors, we probably don't do a good enough social media history. We don't know what questions to ask when we see a kid or an adolescent or an adult. What are you posting? And is it violent? Is it suicide related? So I think we have a lot of education to do. And I think psychology, psychiatry, mental health, we really need to lead this charge and help all of our colleagues. So that's how I would address your question. I hope I answered your questions, Representative Blanco.
First of all, the chair needs to recognize Representative Cole from Austin. Cheryl Cole, thank you for being here. Love your red boots, by the way. Okay. Representative Gonzalez, I think, has some questions.
Thank you, Chairman. And Representative Blanco, Dr. Jeff Temple has some research on social media and mass violence, and I'm happy to share that with you. Panel, and mostly, I think, for the first three panelists, I really appreciated your comments on mass violence being multifaceted. And I think one of the things that we've been talking about, particularly in El Paso, is how hate and anger were very central components to what happened. One of the things I think when we talk to my colleagues, they might be hesitant to say, or I think I could hear comments being said like, well, we can't legislate away hate. I don't necessarily think that's true, and I think you gave a really great example about school prevention policies, i.e. healthy relationships, and for the committee, HB 366, which happens to be my bill, but there are some ideas about hate and anger and public policy solutions, and I don't want that to get lost in the conversation. If you were to give us recommendations specifically on those two components, what recommendations would you give us for public policy solutions?
I think that issue ties in directly to the social media issue. And the El Paso event is a prime example of that. He posted a manifesto on the internet before the attack occurred. So I think that that could be a potential avenue that someone could be looking into. I don't know the answer of whether that needs to be the social media sites themselves or law enforcement or who would look into that. But I think when we're seeing really problematic ideas, especially when they kind of cross the line into intent for violence on the internet, then we need to look into doing something about that. I think it might be a little bit of looking for a needle in a haystack, because for every El Paso shooter, there's thousands of other people posting the same kind of hate and vitriol online. But I think if we could maybe study those postings to see, is there something different about the people who actually act on their hate versus those who are just saying a bunch of things.
And maybe there's a more proactive response, like preventative, a digital citizenship type of curriculum to help young people navigate some of these things as well. So I appreciate your comment.
Thank you for bringing up Dr. Temple. That's brand new down in Galveston. It's a brand new center on violence and violence prevention, Dr. Jeff Temple. I have not had the fortune of touring it or learning more, but it's available. And I think to the point of domestic violence, that really, I mean, kids that are exposed to domestic violence, seeing their parent or loved one hit or hurt or damaged, the world should be a safe place. When a kid sees a parent can't even keep themselves safe, how are they going to keep me safe? And not to blame anyone, it's very traumatizing. I just want to add, I think at the end of the day, the biggest issue is stigma. People don't want to seek mental health treatment if they think it's going to affect my employment. I have colleagues that are in the military. They worry about, am I going to be eligible to be in the military or fly planes? And we have a lot of folks in Houston that fly or professional pilots. So the issue is, at the end of the day, we need to address stigma, and it can start in our schools and it can start in our community. But people have to be willing to access and want to have mental health evaluation and treatment. And we're not trying to put everyone in the state hospital. I think that's a take-home point. We can help, bless you. Some of these folks just need some individual or family counseling. They perhaps may not need to be on medication. So we're not chomping at the bit to put everyone on meds. It's more counseling and therapy to kind of get them through the stressor and the cooling off period, if you will. And that's what we're all about in mental health.
Representative Gervin Hawkins, I think.
Thank you. Thank you. First of all, I want to say, panel, y'all gave some great recommendations. Thank you. And I think y'all cleared up some issues. One of the questions, well, I have two questions. One is, has there been a profile done on some of the mass shooters? And did they have any college, is one of the questions that I have. Did they have any post-secondary? Don't know? Okay. Is there any studies out there that is looking at the profiles of the mass shooters? From a layman's point of view, it appears to be a young Anglo male who's having recent trauma. But is there anything that's digging a little deeper into that y'all are aware of?
I think what you just said kind of, hits the nail on the head. It's really challenging to get reliable information about these perpetrators because, as has been mentioned, most of them die over the course of the event. So it's different from other types of offenses where we can go and talk to the person and learn more about what their reasoning was for committing this act, what differentiates them from someone who might be a young white male who's angry, who doesn't commit an act like that. Some of the things that do come up over and over again are some of the things that have been mentioned here that are risk factors for violence more generally: antisocial personality traits, anger, resentment. More specifically, the feeling that they are being targeted or they have some sort of grudge against other people. They feel like the world is treating them unfairly. Those are some common things, but what's difficult about it is that there are lots of people who feel that way, again, who don't commit acts of mass violence. So it's really challenging for us because there isn't one easy thing that we can point to say, aha, this is the person who's going to commit mass violence. But we can look at these risk factors for violence, and we might be able to prevent acts of mass violence specifically, but by doing so and looking into these risk factors, we potentially could prevent general violence because the risk factors are shared a lot of the time.
Would it be appropriate, when I think of massive violence, I think of multiple killings, right? And I think as a society, we look at multiple killings at one time. But I go back into history and I think of someone like Jeffrey Dahmer. Would he be classified?
No, he would be classified as a serial killer, right? So there are different designations that the FBI has in place based on the number of victims and the amount of time that elapses in between the events and whether there's a cooling off period. So Jeffrey Dahmer, people like that, Ted Bundy, those are serial killers because their victims happened over a long period of time versus mass violence, which happens during a short period of time like what happened here.
And finally, in what venue do you think would be appropriate to start educating the public so we can start categorizing? You know, when I look at, you know, the autism and the spectrums, and I look at, because, doctor, when you talked about people concerned about being identified, so, you know, I may have a cousin who's a little crazy, but then, you know, there's a neighbor who's really crazy, you know, who's really got some problems. And how do we begin to start those conversations in a coherent manner so people aren't afraid, but can begin to start identifying and appropriately referring? Because I think that's the big challenge we have as legislators. People think if you do this, well, what if you got a mad girlfriend who's just telling some lies, or a mad boyfriend? And that's the the uh, the big divide between trying to look at legislations that don't have those unintentional consequences. And that's a piece that we've got to look at.
So first of all, thank you, Representative. The issue with autism and autistic spectrum disorders, the big case was the one in Sandy Hook in Connecticut. It was pretty clear, and I was not involved in that case in any way. And I used to do insanity evaluations. So if somebody kills somebody, were they not guilty by reason of insanity at the time they killed one or more people? So with him, he had pretty clearly defined autistic spectrum disorder. And the issue is those individuals are not more violent than anyone else, and they tend to not be social. They struggle, and so this would be a very challenging room with all this noise and stimulation and lights and that sort of thing. So they tend to, but the issue, and again, I'm not pointing the finger, but he was obsessed with violence and shooting and guns. And so again, not to blame his family, but probably letting him do target practicing with assault rifles, probably not a good idea. But the issue is kids with autism and autistic spectrum disorders, it's a spectrum. Some kids are nonverbal, they don't talk, and others are very high functioning, can go on and be, you know, successful attorneys, physicians, you name it, they do very well. So it's a spectrum, but I think the take home is they get stuck on areas of interest, and they have, you know, they can tell you every single part of a vacuum cleaner, or they get stuck on birthdays. They could tell you every one of your birthdays. If you told them once, they would be able to recite it. So, but the bottom line, folks with autism are not any more violent than anyone else. I think that was kind of a fluke with him. Back to your question, though, about profiling, I've included some links to the FBI studies. They've done a tremendous job, but the issue is it a static risk factor, or is it a dynamic risk factor? So you can't change, like being male, being Caucasian, that's static. But issues of alcohol, clinical depression, frustration, drug and alcohol usage, K2 spice, name your drug, those are dynamic. So those are all things that can be addressed or changed. But I think the problem is it's kind of like a psychological autopsy. You're looking at data after the fact and trying to piece what that person was all about. And they look at medical records, hospital records, they may look at their postings on the web. So anyways, we have a long way to go to work together with law enforcement to identify these folks and give empirically validated data that suggests, but that way it doesn't like, well, she's at risk and we should lock her up if she hasn't done anything. So we have to be very careful about public safety without taking away people's civil liberties.
Representative Karen.
Thank you, panel. One of the things that y'all brought up is you can look at me and tell if I'm eating too much. You can test my blood and see if I've got a drinking problem. How would you determine or want to counsel a patient? How would you determine that they have a gun issue? That was one of the things that y'all brought up, being able to counsel your patients about that. But I mean, how do you determine? I mean, yeah, I own some guns. I own a bunch of them, and I just got through selling a bunch of them. But
It definitely ain't easy. I think it's, first of all, the PCP, the primary care provider, really needs to know that patient. And you get that information by spending some time with them, especially the pediatricians with their younger children, and not feeling like they're being prevented from actually asking the questions, do you own guns in your family? Does your family own guns? Okay, well, that's fine. Do you like to hunt? That's great. How does your dad store the guns and things like that? And then see how the conversation progresses. It won't be easy, But I can tell you, we also have a mental health crisis in the state. I mean, we all know that. I mean, y'all know that too. I mean, I see that every day in our county hospital. Every hospital, we're just sitting there for days with patients trying to get into a psychiatric facility. But once again, I don't want to stigmatize people with mental disorders because they're not at the tip of this issue. But we do have an issue with that. Me in the Sutherland Springs, that guy shouldn't have been having guns. The government knew that. The military knew that. The guy in Odessa, there was things being sent to law enforcement from his own mom. How do we stop that? I don't know the answer. It just bothers me that we see that popping up again. But as I said earlier, it's not one size fits all. That's what's so difficult with this. It really is.
The same model for somebody who's suicidal, when I'm seeing a youth or an adult or an adolescent that has depression and they're talking about suicide, one of the things I'm going to do is ask about means, access to means. Are there pills in the house? Are there pills that could be used for an overdose that could be lethal? Are there guns in the house? So again, for time-limited purposes, I would recommend let's get the guns to Uncle Johnny and just get him out of the house. And so it's the same kind of model of let's deal with the problem we have here and now clinically. And doesn't mean they can never shoot guns, but just for here and now, let's, a couple of weeks, couple of months, let's deal with the problem and work together collaboratively and figure out what works and what doesn't work. So that's how I would recommend that, sir.
And y'all referenced the HIPAA statutes. Are you, as a physician, can you go to law enforcement with a medical issue that you think is about to be an imminent threat, or do you have to maintain silence?
It's very thorny. So in the old days, when Tarasoff first came out, Tarasoff is duty to warn. So someone came into the therapist at the college, like UT El Paso, and said, I'm going to kill her. And the therapist notified the campus police, and they went up to the perpetrator and said, hey, are you thinking about killing her? And he said, no. And then they said, okay, have a nice day. And then what did he do? He ended up killing her. So that's where it gets really thorny of who is going to take them into custody and do an evaluation and ask them the critical questions. So, but again, it's a partnership between mental health and custody. But you're right, sir. It's absolutely, you have to have a reasonable suspicion and perhaps an emergency hold someone against their will in an emergency room, which are already overbogged with mental health folks. And it's the have and the have-nots. If you have a credit card and you can pay out of pocket, you can see any therapist or counselor or psychiatrist. If you're uninsured and you don't have one of the big 3 diagnoses, good luck. It's probably going to be a wait list to get in to see somebody. So, but anyway, so the issue is, I lost my train of thought. Sorry. It has to do with HIPAA. The problem is we need to work together, TMA, TSPP, and law enforcement and the legislature to come up with something that we can help identify who's potentially at risk. Texas is not a terror-soft state. There are 20 or 30 states in the country that are terror-soft states where a psychotherapist, by duty of the nature of the relationship, if they identify a patient to be at risk of threatening or killing someone else, they have a duty to warn or duty to protect. And so that person can be taken into custody or committed to a psychiatric hospital. So those are some things we can work together. We'd be happy to assist any way we can.
Let me give you an example that I experienced with a patient a few years back. This guy shot himself in the thigh with a shotgun, massive injury. It didn't smell right to me. I questioned the guy. The guy wasn't going to give me answers. I could tell. He was very rigid. And I tried to get psychiatrists to see him. Can't find a psychiatrist. We finally got one to see him. And the psychiatrist, I think he's probably okay to go home. I was like, I don't know. This doesn't sound right. His dad came and said, this guy's going to kill himself, or he's going to kill one of us. I can guarantee you that. So I went before the judge to try to get the guy taken care of. The judge said no. And I sort of stalled a little bit more. I finally got the judge convinced to put the guy in the psychiatric center in El Paso, which is always overburdened. The guy stayed 3 days. 2 days later, he shot himself in the head, killed himself. So we do face this.
Yes. My best friend killed himself 2 years ago on Valentine's Day, and we got him committed, and he stayed in the facility for a week, and the facility kicked him out because he wouldn't cooperate. All he'd do is stay in his room. He accept any of the therapy or anything, and then he got out, and about a month later, he shot himself. And we were reaching out to him from the time he was out until the day he killed himself. In fact, I was with him the day before. But I don't know how you, I guess some of it you're not gonna stop, I guess.
No, you're correct. As I said earlier, there's about 40,000 deaths each year from guns. 60% of those are due to suicides. Yeah, we have Fort Bliss here. I see probably one victim a month, if not more, that's a soldier that's committed suicide or attempted to commit suicide. And we see that. I know our topic today is really mass violence, but, suicide is a big part of this problem.
I think some of the shooters actually use it as a way to commit suicide.
Representative Capriglione.
Thank you, Mr. Chairman. Something that I've been thinking about a lot lately is maybe not directly related to the episode of violence itself, but maybe trauma afterwards. I put that in kind of two buckets. Obviously, in a place like El Paso, which is still struggling with what had happened in August. So if you could talk to some extent about, hey, what do you all see in terms of stress and anxiety or potential depression after something like that? And then secondly, something that we're seeing, I have 3 girls in school, and there are a lot of worried people, right? You have the children, you have the teachers, and what we do a lot now is lockdowns, right? So you'll have usually over something that has nothing to do with violence, but it kind of creates a lot of panic. Emails now go out to the parents who then start texting, start trying to come to the schools. I was just in a school over the weekend, and now there's these little red bags, I guess, for mass wounds at every door. And I guess in that case, I wonder if sometimes the preparedness and the education maybe is causing a lot of anxiety as well. So I don't know if any of you had
So
conversation on that.
these little bags, that's the Stop the Bleed campaign. That came out from the Sandy Hook, because once they did the autopsies of these poor kids, so many of these kids would have preventable deaths if somebody would put a tourniquet or just put direct pressure. And thanks to the legislature now, it's mandated in all the school systems. And I think so far in El Paso, we've done almost 4,000 trainings of people. So that it's sort of like the old Red Cross, ABC's airway, breathing, CPR. And that's unfortunately the nature of the beast. I can tell you, every hospital you go to now, you're going to see Stop the Bleed kits right by the defibrillators in the hallways. It's sort of a sad statement on society. But there is the anxiety, as you mentioned, the stress and stuff like that. So every time I sit on the disaster committee at our hospital, and I sit on the board of RAC, the Regional Trauma Council, I go, when we do these disaster drills, we need to focus on the aftermath. We got to focus on that, because every time I heard these mass shooting events discussed by trauma directors from Orlando, from the Fort Hood, 2 events actually were at Fort Hood, when I heard about it in Dallas, when I heard about it at Vegas, you got to deal with the after effects, and it will linger. We are now about, 5 months from this? We are still in a prime time for people, meaning healthcare providers, or just people that were at Walmart or at the Sam's Club next door, that could be impacted by that. And it may just hit that person out of the blue. I think we as a city did a very good job. I was very worried about that we weren't going to. And that's the first thing I said to the president of the medical school or the health science center and the CEO of the hospital on that Sunday morning. I said, we got to take care of our own. It's so important we do that. And not because of me, but people put things into place. I thought Emergence Health did a good job. Everybody did that with the schools and the fire and medical services. They did a very good job with it, and they're still doing that. So that can impact us still. As I said earlier, the Orlando Pulse shooting, 30% of the residents that were involved in the trauma center were impacted 2 weeks later when they did testing. 7 months later, over 30% still had PTSD. So that tells me these are people that are young, that think they're tough, they can own the world. It's going to happen to them. It could happen to me. I can tell you it happened to me on Sunday afternoon when I was driving home. After being exhausted from Saturday and Sunday, I drove home, I saw Paso Strong. It hit me out of the blue. Like, oh my gosh. So I was like, I thought I was tough. I didn't handle anything. But it hit me and it hit some other people. I had people come to me confidentially, I need help. And I was thinking, man, this is a pretty tough person, but they came to me needing help. It's a problem, and I think El Paso has done a very good job. We are not anywhere close out of the woods on that.
Sorry. In medicine and surgery, we have this adage, and it goes, do no harm. So before we put somebody on medicines, be it an antibiotic or ADHD med or whatever, it's do no harm. And I think, I don't want to sound disrespectful in any way, but I think we're doing these interventions. We don't really know, is it the right thing to do? I do have some concerns, and I have seen a couple of articles, and I'd be happy to forward these to your officer, a representative, about school preparedness drills from the American Academy of Pediatrics. They are raising concerns. Perhaps most kids, it's not a big deal. They just kind of go through it. I was driving to a prison unit yesterday in Sugar Land, Texas, and all the kids were lined up outside the school. And I'm like, yep, they're doing a drill. But what about a kid who's socially anxious or has panic attacks or some, separation anxiety from their mom or dad? Absolutely. So they're temperamentally more anxious or vulnerable. Those kids might be at higher risk. So I think we need to look at the intervention and does it cause more harm than good? And absolutely, we got to do it if it's the right thing to do, but we just need to be very careful. So we need to look at the evidence supporting the intervention. That's my recommendation.
I agree with that, and I would just add on to the issue with the drills in schools is that for school shootings in particular, 90% of the perpetrators are current or former students of that school. So if we're going through these elaborate drills of what's going to happen if there's a mass shooting, you're training the perpetrator what's going to happen in that event. So it seems really counterproductive. So in addition to increasing anxiety for all of these school children, there's a strong likelihood that that drill might not be effective anyway.
All I can say to that is wow. Members, any other questions? Representative Landry.
Thank you, Mr. Chairman. I appreciate the testimony that all four of you have provided. It's been very insightful, but I did want to get some clarification, mainly from Dr. Penn, Dr. Loudon, about the role that mental health deficiencies are playing in these episodes of violence. I think you went out of your way in a very good way to make sure that we don't do anything to further stigmatize mental health. And so when you're talking about, most individuals who do suffer from any sort of mental deficiency are not violent. And I think that the data certainly bear that out. I do want to make a distinction, though, and get some clarification between non-mass violent episodes and episodes of mass violence. And even when you're talking about mass violence, I think it's clear from what you all have testified about and what others have concluded that there is a confluence of events, whether it's there's a mental health component, whether there's a history of violence, whether there's a racial component. Do we see a different role in episodes of mass violence when it comes to mental health defects versus non-mass violence episodes?
So the answer is not straightforward, as we probably would not prefer. If we are comparing general violence, meaning any kind of violence from, firearm violence, assault, mass violence all together, the effect of mental illness is really small. It's not a strong predictor of any kind of violence. If we look at mass violence specifically, according to the FBI definition with the 3 or more victims, again, it's not a strong predictor there. The only subcategory of a subcategory where we do see mental health playing more of a role is in instances of public mass violence. So if we're not including the domestic violence shootings or the shootings that happen over the course of committing another felony, such as a robbery or turf wars with gang members, we need to keep in mind that these public mass shootings, like the one in El Paso, only account for about 12% of mass violence overall. So it's a subset of a subset. There is a higher rate of mental illness in those perpetrators. It's still not all of them. we still need to keep in mind that, as you said, there's a confluence of events. We can think about it as like a plane crash, right? It's not one thing that went wrong. It's a series of worst case scenarios that added up to lead to disaster, right? So one of the things that we see, if we want to get real specific, it's not just mental illness as a label, right? There are specific types of symptoms that we want to be more on the lookout for. So depression is a huge one. As we've talked about, a lot of these events happen as part of a suicide, right? So suicidal ideation and depression, um, paranoia, thinking that people are out to get you, you have a grudge, and maybe taking that to an extreme, coupled with other risk factors. And the biggest one is substance abuse. So when we take someone who's having these serious mental health concerns, they're maybe already either out of touch with reality or they're thinking about ending their own life, and then they're taking a substance that changes their judgment or their perception of reality, then we're starting to get into this chain of events of the worst case scenarios. Add on top of that a crisis situation or any of these other things that we've talked about, that's where mental health can play a role.
I would totally agree with everything. I think the challenge is, let me just give you an example. So the Aurora school shooter, the theater shooter in Aurora, Colorado, she stepped out, but her question about how many of them had college degrees, he was working on a doctorate in neurosciences. I don't think the other shooters were that educated or that high level of education, but he planned and he collected the material, and then he was blaring music for weeks at a time. You know, what do his neighbors do? What does his family do? I think that's the problem, is when we have folks that are disconnected from their families or relatives or supports, and they're loners, those are the ones those can be really hard to identify. But I think when we see a family member, a loved one struggling with something, and their activities of daily living, they're losing weight, they're not going to the gym, they're whatever, they're just not functioning how they normally were at work or with their families, or they're becoming more isolative or reclusive, those are the ones we need to intervene and get them into counseling and therapy and not view it as a stigma. So that's the biggest challenge. Again, then you have to play the Russian roulette with, well, what insurance company takes you and who is taking patient. I mean, that's a mess. So, and unfortunately, our ERs have become our mental health sites. You just go to the local ER or call 911. So I think we need to work more, and you guys have done a tremendous job, and we applaud you for all your funding of mental health services. And to be frank with all of you, the reason I'm here today is because if we don't do something now, they're gonna end up in the prison system or dead, and more victims. So that's why I'm here, because a lot of these folks end up in our state or federal prison system, serving life sentences, death penalty sentences. So that's why I'm here today.
Well, appreciate your comments. I think we all agree we have a little bit more work that we can do on that. Just very quickly, I wanted to follow up on two items. Since we were talking about the stigma, and then we do use this, and I'm as guilty as anybody of it, of just using a blanket term like mental health, when clearly, a lot of the perpetrators of these acts of violence, where there is a mental health component, we're talking about a very specific diagnosis, whether it's, in the DSM or otherwise. But do you think it would be more helpful for us as policymakers? I'm from Odessa, and we've obviously been having a lot of conversations about this in our community since August as well. Do we need to specify a little bit more what we're talking about when it comes to particular disorders, so that we're not just talking about mental health generally and then potentially further adding to that stigma?
I think that can be helpful, and I think it would be helpful if the community more generally got some more education about what is mental illness and what is not mental illness, how to distinguish just mental distress from mental illness. But I also think we can, if we start using specific terms, if we talk about schizophrenia, well, again, most people with schizophrenia are not violent, don't commit mass violence. I think it might be more helpful if we start talking about these indicators that have been discussed. So, for example, the criteria for being civilly committed is danger to self or others. I think that's a much more concrete and potentially less stigmatizing way of describing the individual or the situation that doesn't spill over the stigma into other people who have similar mental health concerns.
And Mr. Chairman, if you can indulge me one last question, I appreciate you. And thank you for that response. The last thing's not quite related to your testimony, but I think it is in your wheelhouses. As far as the psychotropic drugs are concerned, is there anything that we can do at the state level or anything that can be done to help for and I'm only talking about patients who need those types of psychotropic drugs, but is there a better delivery mechanism or a better long-term dose, like a 90-day dose that where you run less of a risk of noncompliance for the patient and their medication? Is there anything that we can do on that front to help?
Okay, certainly. So for individuals with serious mental illness, schizophrenia, schizoaffective disorder, other psychotic disorders, and severe bipolar disorder, other things like that, there are some long-acting injectable medications that work. The issue is the side effect profile. So all of you all probably remember the old days of Haldol and Prolixin. Those are wonderful medicines, but they make people stiff. They cause side effects. Now we have new medicines we use, but the problem is they can cause diabetes and metabolic syndrome and weight gain. So it's kind of you're damned if you do, you're damned if you don't. So we really try to minimize side effects both short and long term, because if a medicine gives somebody side effects, what are they going to do? They're going to stop taking it. So that's probably the biggest thing is once you stabilize somebody who's psychotic, you take away or turn off the volume on their voices and the paranoia and suspiciousness, their insight kind of goes away of, oh, I'm fine, I don't really need these meds, and plus they make me gain weight and they slow me down. So it's kind of a natural thing that absolutely probably 50%, 60% stop their meds even when they're stable. So I think the big thing that we would ask for, and we can come up with some recommendations, Representative, that would help guide you, but I think the big thing is access to care and continuity of care and setting up crisis services for individuals. I think right now, unfortunately, it's all state hospitalization or civil commitment. We really need to have emergency services. Like when I was in Rhode Island, we had an emergency psychiatry service where people could go there, cool their jets for a couple of days, and it was less stigmatizing. A day hospital treatment where they can go home at the end of the day.
Like an outpatient model, something like that.
Correct, absolutely. As opposed to, oh, you got to go to the state hospital and good luck because there's like a 90-day wait. So, and they sit in the ER for a week or 2 weeks. So we need to improve our access to care at the end of the day.
Thank you. Thank you, Chairman.
Thank you. We would want to thank Barbara Grover and Hawkins for the legislation that created the opportunity to put these packs in all these schools. So thank you for that piece of legislation.
Well, Mr. Chair, and I do have one question because I'm concerned about Representative Cabrigliani brought up. We don't want to scare kids to death, but we want to prepare kids. And because one of the things that for me that propelled me to move forward that legislation was that when I heard about the kids that were bleeding out because folks didn't know what to do. So that was one issue. The other thing I'm looking at is a firearm prevention month so we can educate. Is there any literature that speaks to too much information or scaring kids to death so that as we're looking at it, part of the piece of legislation possibly need to address messaging? Because for me, the bleeding control is not just for mass violence, but you can help Grandma Joe when she falls out at the house or if a friend gets hurt. My son fell on a park playing basketball and needed 16 stitches in his leg. But because those kids knew what to do, they saved his life. So is there any research or studies that shows that we can refer to when we're developing these things so it doesn't become a scared to death type, but it becomes a preparedness movement? Thank you.
So with the Stop the Bleed, one of the first thoughts was it's too sophisticated for high school students. And once they started teaching it in the high schools, it really wasn't. So then they brought it down to middle school level, Boy Scouts, Cub Scouts, and the emphasis isn't really, well, we got a mass shooting and we're going to, everybody needs to go tourniquet all these people. Actually, in the El Paso shooting, only 2 people required tourniquets. None came to my house, but I think they went to the other one, but, we didn't have any. But it does other things than that. It's, the direct pressure and all these kind of things. But like, as you said, it's extremely important because grandma may fall and she's on a blood thinner and she's bleeding out and you can just put pressure on that. Or, somebody's, I don't know, doing something and a car wreck. So that's really was the emphasis. Obviously it came out of Sandy Hook, but the emphasis is to not just mass shootings, but to other traumatic events that we could, because 40% of all preventable deaths from trauma is bleeding out, meaning hemorrhage. So, yeah.
But my question is there any studies that talk about the messaging that we give kids and the way we give it so that we're looking at it the right way?
I don't know. I'm sure there is, but I've not seen any. I don't know if the panel has.
Sorry, I'm not aware of any, but I'm sure we could get you some either through TMA or TSPP. I think the big thing is making it kid-friendly and kid-sensitive and in their language and their terms. And also, as we know, we have a lot of kids of bilingual families and, we have kids with learning disabilities, learning disorders. So being sensitive to those sort of issues, I think would be really useful. But absolutely, to his point, we shouldn't be scaring our kids, or our vulnerable kids.
Well, thank you, panel. I will say that before you leave, this has been a very informative and powerful panel, and we want to talk further about it. But I can't let it go because one of our duties is to talk about extreme risk indicators, and I think Dr. Loud, you talked about that. And I think, interestingly enough, the New Mexico governor yesterday in Las Cruces talked about projected legislation that would codify a procedure whereby these extreme risk indicators could be put forth by a loved one, a family member, a friend, law enforcement, through a sworn affidavit presented to a judge. Judge would read that sworn affidavit, decide to act or not act, but then have a hearing within 15 days, and that order could be extended. But I would talk a little bit about the criteria that we could all coalesce around that would clarify what these indicators are and the importance of them, so that we don't, and the courts arbitrarily deny people their due process and constitutional rights. And so that's the struggle as part of our task here, is to look at these things, and particularly with this panel and your background, your expertise, I would love your thoughts on, are we to a point, and I know we're going to hear from DPS and Colonel McCraw on his fusion centers and, questions that they are proposing that law enforcement could ask. But are we to the point where we can generally agree on some things that are working in a young person or in a person's life that would indicate an extreme risk to harm to themselves or to somebody else? I'd love your comments.
I think it's really challenging because, as I mentioned, it's really hard to do research on these issues. I think if we're focusing on incidents of public mass violence, the biggest thing that we have is what I refer to as leakage, right? So if someone is saying something to anyone, a mental health professional, a friend, a family member, about an intention, and it happens in a lot of these cases that they're making a statement specifically about violence, that would be a huge indicator. I think we need to look beyond that as well, because as we've heard, a lot of these instances are a result of domestic violence. So looking at situations where there's conflict in the home, maybe there's violence, a threat of violence, and having a mechanism for the person who's the victim of that or the target to be able to call someone to have some sort of intervention being done. I think beyond this, I think we need to look at just actions in general that kind of indicate that something is different. We heard about, when someone starts acting differently than their normal way of acting, right? When someone is thinking about committing violence, they're going to do things that coincide with that. So, for example, the shooter in Las Vegas purchased, I think I read, 55 firearms in the year leading up to that event. So, if we see someone suddenly accumulating a large number of firearms and that's unusual, that might be a cause for concern. So, I think behaviors in terms of what people are doing, statements that they're making about plans, changes in behavior, I think again, the case in Odessa where the mother said, hey, I'm concerned that my son has access to firearms. He's not capable of operating them. He wasn't legally allowed to have them. And having mechanisms in place for people to report that and for there to be follow-up.
I would agree. I think the issue is false positives and false negatives. So I think we, TSPP, are committed. We'll help you in any way we can, consulting with you and law enforcement and such to draft legislation or create new things. I'm sure, I don't want to speak for TMA, but I would assume they would be also in pediatric groups and psychology groups. We're ready, willing, and able, anything we can. I think the issue is when it's a direct threat. If I threaten to blow up a school or go shoot somebody or do something, that's easy, or it's easier rather. But when somebody doesn't verbalize it and then they post something in the media or they say something kind of very vague, that's where it gets really thorny. Those are the challenging cases.
One thing I would hope that the committee and the legislators could coalesce around is, once we've identified what those behaviors are, do we have systems in place across the state, across multiple departments, multiple channels, multiple counties and cities that shares information? I think that's going to be a critical point in some legislation, I think, that was addressed in this past legislature on bond conditions, where gun access for a bond condition might not be, information is not shared with the county sheriffs who don't have it. So we want to make sure, I would hope that the committee would agree that that is one area that you could coalesce around, is that every department has the information it needs to make those decisions.
It is a difficult challenge, and we have been tasked with talking to experts and others about options. Obviously, New Mexico is considering one that 17 other states are using. But again, the dilemma arises on what kind of extreme risks are there, how we can rely upon them, and what are the effects of that, and at what stage do we deprive somebody of their constitutional rights without the benefit of counsel or opportunity for hearing. And so I just wanted your thoughts while we had you here. This has been a very informative panel, and we thank you for your expertise and your involvement. I would ask to impose that we get your written testimony and then any links that you might have that we've talked about. I think that would be important to the committee in our deliberation. Thank you again. Oh, I'm sorry, Representative Moody, did you have something?
It wasn't a question, a comment, but seeking, we've covered this topic a little bit, I think, in North Texas when we had a hearing there, but talking about the conduct that we're trying to figure out. There's this broad consensus that I've heard, going back from the roundtables to these committee hearings, which is figure out who are the dangerous folks that we don't want to have access to weapons for whatever period of time, however you want to do that. And the challenge has been, how do we identify them, and then how do you do that? Well, we can start with, this is my thought, which I thought was a fairly agreed upon principle, was looking at the laws we have on the books today and understanding how to enforce them correctly and efficiently. So today, and I'm sure this is actually a good pivot to the next panel, today, we have a protective order system in existence for domestic violence specifically. The bulk majority of those protective orders are domestic violence protective orders. You have stalking. This can be closely related to that. And the conduct there, I think most people would agree, is, these are conduct that should be flagged, right? So you have stalking, you have sexual assault, and you have human trafficking as the newest one that's been added to the protective order regime. The judges in those cases have the option not in all cases, but in those cases, they have the option to say, this individual, based on the facts presented to me, should not have access to firearms while this protective order is pending. They have the immediate piece of that, and then they have the permanent protective order. And so the due process is in place for those 4 circumstances. So I think step 1 is, let's get our arms around, and then we have those that are convicted of these things, and we're not doing a good job of actually taking care of them. So let's start there, and then let's get these protective order laws that are in our books now. We agree that the conduct in those 4 categories, that the judge should consider whether that person should have access to a weapon. And then let's look at maybe other offenses to lift into a protective order system. So terroristic threat, is that something that we should add to the protective order regime? I would argue yes. There was a prosecutor that we heard from in North Texas that agreed with that. And so I think we need to get our arms around the system we have today, which is not being enforced efficiently or consistently across the state. In fact, I want to thank DPS, and I'm going to provide to the rest of the committee. They gave me information about individuals who are under protective order, where the judge had checked that box saying this person should not have access to a weapon based on the evidence that's been presented to me, who then committed a violent act with a weapon. And that data is available in terms of aggravated assault with a deadly weapon after they were having a protective order. The district attorney is here. I know he's going to testify. He can tell you about a case here in El Paso where protective order was entered, and he's more than one, but protective order was entered. We weren't enforcing it, and that person then committed an act with a violent act with a weapon to a deadly impact. And so let's enforce those laws we have on the books now, and then figure out, are there other indicators, Chairman, to your point, that we can lift into a regime that we already have in our law today? And let's do it right, and let's do right by those victims of crime. And I think domestic violence is the place to start. You know, the data shows there is overlap in these populations. So we have these laws. Let's be smart about the way we enforce them. And if we want to expand into that arena, let's figure out how to do it right.
Thank you, panelists. We again appreciate your being here. I will state for the benefit of the public that this is being live streamed, and we've had a report from several of the viewers that there's some ambient noise in the room. I would just ask that you would carry your conversations outside the room, and so that the people viewing this can hear clearly what's being offered. I see the mayor is wandering up, so we probably need to take care of him, former colleague of mine. We'll call Jaime Esparza, Mayor DeMargo, and Selena Sainz. Welcome, Mayor. Good to see you. Well, let's always start with the mayor, okay? Hold it and keep it down.
Thank you. It's good to see a lot of my former colleagues and friends. I'm trying to think how to characterize my remarks. 2019 was an interesting year for El Paso. It actually began in October of 2018 when we started having the migration crisis. And so we became what the national and international media referred to as ground zero for migration crisis. And then August the 3rd. And I want to characterize the specifics of what happened on August the 3rd. At 10:39, a call went out, 9/11 call went out, and at 10:45, 2 El Paso police officers, without hesitation, entered the Walmart. One was a 6-year veteran, the other was a rookie, 1 day off his probation. They did not hesitate. They entered not knowing that the shooter had left. At 11:06, the shooter was apprehended. Apparently got lost, whatever, by 2 motorcycle policemen and 2 DPS. He surrendered. A white supremacist, evil coward who came from 700 miles away. I've stated on numerous occasions that I do not believe that individual would have ever come from our region. And by that I mean, Well, also, let me back up. There were 46 victims. 22 passed away. There were 22 that were killed, but there were 46 individuals shot. And sometimes we lose sight of the fact that there's still one in the hospital who's had multiple surgeries. The biggest question I would get during the week following by the media was, were you surprised there were 8 Mexican nationals among the victims? And my response was, no, absolutely not. That's who we are. And to clarify, what most people don't realize is that our history goes back over 350 years as a region. The Mission Juarez was founded, it's now Juarez, back then it was just by the Rio Grande, was founded in 1659, actually 360 years ago. And until 1848, the majority of our population in our region was on the south side of the Rio Grande. In 1848, Fort Bliss came here, and we started having a migration of population north. In the 1880s, the railroads came. The point is that we have been one binational, bicultural, bilingual region for over 350 years, 100 years before the United States was ever even founded. And I don't believe the vast majority of people, Texans, especially in the United States, understand that we are a unique region that is not replicated anywhere else. We are totally unique for the Western Hemisphere. And that's what makes us separate. On a daily basis, families on both sides, culture both sides, commerce both sides. On our bridges, 35,000 vehicles cross north every day on an average. We have 22,000 pedestrians that cross north every day. And we have 4,000 container trucks that come north on an average day. That's who we are. We are one region. So it affected the entire region of what happened on August the 3rd. It wasn't just El Paso at all. You know, I think the most, to talk about who we are and what we're about as a people. I was in the hospital on that Sunday afterwards, visiting the family of the 10-week-old baby whose parents ultimately perished protecting that child. They'd been notified about the mother's passing, but we had to set up at one of our middle schools a place for families to go so that they could then be notified officially once everything had been identified. So I'm in there. We know the mother's passed away. She's been identified. And they get the call from the father, the grandfather, the father of the husband, of the father of the child gets notified. And then I leave and I go to United Blood Services. And there are El Pasoans standing in line for over 11 hours giving blood. And they will not leave until they've given the blood. And after everyone finishes giving blood, there's immediate applause by everyone there. That's who we are as a community and as a people. And I'm not sure people fully grasp that. Now, to talk about some specifics, our police, our first responders were well trained. In fact, as I told our police chief, you all have active shooter training. I just wish I had. They were prepared, trained, and responded. Every law enforcement organization in our community, from the CBP, BORTEC, which is their SWAT team, the Sheriff's Department, everyone responded. It was unbelievable. One of the things that we relied on, and the governor was most helpful to me in providing me with insight as to how to deal with this, and it's unfortunate that he's had 3 of these, or 4 now, to be able to deal with it. You all passed, I think after the Sutherland shooting, a bill for $5.1 million available through the governor's office for support and something like this happening. The majority of it would go ultimately to the county for prosecution. We received $1 million for overtime for our first responders. Our actual cost, for your information, was $1.7 million. That $700,000 plus has not been reimbursed to us at all, and that is something I would like you all to consider. I have said that this event will not define El Paso. Yes, it'll be part of our history, but I want to make darn sure I relegate it to an asterisk footnote as a part of our history. It will not define us. We've set up, our Office of Emergency Management has set up a resiliency center. We had it going 24/7 immediately after the shooting. My personal perspective is I think it'll take us about 3 years to get through all this and get it behind us. Right now, we have a United Family Resilience Center that's up continually for anyone that wants to go by and that feels they need any form of mental health support. We have a website, elpasostrong.org. Everything is there for people to reach out. And I don't know what the other panels are, but we had a fund drive with many contributors, and we recently, I think it was about $11.1 million that was raised and distributed to the victims and those impacted by that. So I think we've done all we can do. As far as specifics, I mean, I'll answer questions. You had the experts on mental health, et cetera, before. Personally, I'm in favor of background checks to the nth degree, and I don't care how long it takes. If you can't verify it, they shouldn't have a weapon. And with the red flag laws, the only concern is you've got to have some form of good Samaritan protection so that it can't be used as a weapon, and it also, for those who are doing it, who are reporting somebody with that they have concerns on, they don't get penalized with an honest concern over that particular individual. So with that, I'll stop.
Thank you, Mayor. Jaime?
Good morning. My name is Jaime Esparza. I'm the district attorney for the 34th Judicial District, which includes El Paso, Hudspeth, and Culberson counties. I've had the honor of having that job for 28 years. I was born and raised in El Paso, graduated high school here, went away to school, came back home. This is my home, and the mayor and I agree on a lot of things, but I would say that this mass shooting will define us. One reason I say that, and I totally respect the mayor's position, is that when we say, when we talk about how we move forward, I talk to, in my line of work, I talk to victims of crime every day. And it is, you just never forget, just never. It doesn't matter how good a job we're going to do, we will never forget. Part of my background is that I have done an increasing amount of work in domestic violence for the last 15 years. I'm really proud of that work. I'm the just recently past chair of the Texas Council on Family Violence. The work that we do in my office has been recognized not just within the state, but nationally for the programs that we do. At the end, I will address, both Representative Moody and I have had a long relationship, and his House Bill 3191 addressed the issue of enforcing the current laws that we have. That came out of the Texas Council on Family Violence. I was there visiting you on a regular basis. We didn't have success. Maybe this year we will have success. But I want to talk to you first about victims of crime, because my experience of August 3rd at 10:39 is I was home and my sister was at that Walmart. She wasn't hurt physically, and she's doing well, but she's also in treatment. and I hope most El Pasoans are. So I rushed over to the Walmart, and we did respond quickly. I've never seen so many law enforcement officers in my life, especially so many with weapons, and we did what we were supposed to do. And they walked in, and the first responders did exactly what we trained them to do, and probably we should pay them more, but what they're paid to do, and they did excellent work. Later that day, I went through the Walmart when those 19 people were still there. That's part of my job. It helps me do what I do. It helps make the decisions I make. You're probably aware that the state of Texas is seeking the death penalty in this case. So I've worked on that case since then. I've seen videos that you never want to see. I've seen how the shooter acted and how we responded. So I tell you all that to tell you I'm not going to tell you a whole lot of things I think you should do. I think House Bill 3191 is the #1 thing on my list. But I want to compliment you for having, instead of, and I thought the last panel was really excellent, but that you asked the victims to come. Now, you might be surprised that you only heard from a handful of victims. I am not. Victims come in all shapes and sizes. You have no idea what their life was like before they went to the Walmart. Just think of all the times you run to your nearest store to get the whatever, and you're going to be home in just a minute. And they all feel for it in different ways. My office, with the help of the governor's office, has been reaching out to the victims of crime in this crime, as others, but in this one specifically, and we made the phone calls for you all so that they would come and made it available. And I really respect you for doing that, because I think that's how this should start. And the other thing is, I hope that you remember that the first thing you did when you came to El Paso is that you came and asked victims, what did they think? How did they feel? How did it affect them? Because I've been to where you work. I've never done the job that you do, but I've seen from upstairs, as you all are at your desk, as you talk to each other and as you pass bills and you argue and all that. But when it comes to this issue, when it comes to what you're going to do about firearms, what you're going to do about mental health, what you're going to do about protecting us, I want you to remember that there are not just 22, those who we lost, the 26 who were injured, the 300 to 400 or so who were in the Walmart at the time, plus all of El Paso who was here who were affected when you have those discussions at your desk. I want you to remember us in that way. Certainly, I don't want you to forget what happened at Odessa or Sutherland Springs, and I recently talked to all of those district attorneys. But I think we get lost in the argument, and then we're going to argue over things that are probably relevant to some people, but not to where the rubber meets the road. Those victims aren't here today because, one, it's really hard to talk about. I can tell from the mayor's demeanor this morning that it's hard for him to talk about it. I do not like the fact that I have to come here and recall that event. As I talk to you about it, I am mentally walking through the Walmart when I walked through it that afternoon. But I am happy to do that and to stand here for those 22, the 26, the 300, and all of El Paso, so that you remember when you're discussing this so important issue, you remember us at your desks. So there are all sorts of reasons why I think we try to move forward, but in the end, it's really hard. The healing path isn't walked alone. And the mayor did a really great job of explaining what a great community this is. And until that shooting, we were one of the safest communities in the country. And the mayor tells me we still are. But that path to healing it's really hard. And if you talk to victims like I do on a regular basis, this is the kind of conversation I have to have with these people. I've got to tell them that the defendant has due process, and that there's criminal jurisprudence that keeps him and his rights protected from me, the government. They don't understand any of that. They don't know why they were going about their lives, doing the things that they do every day. And all of a sudden, they were pulled into a horrific, terrible incident that caused them now to come here. And all of the burden, loss, pain, and suffering that they have to deal with. They don't get it. And frankly, I never have a good answer. And in this case, there is really not a good answer. We're asking law enforcement to find a needle in a haystack, to predict that he would come from where he came to us to do the horrific things that he did it's really tough. There's no way. Right? I'm really proud to stand shoulder to shoulder with law enforcement. But to tell them, why didn't you protect us on that day, is an impossible question. It's just not going to happen. Which leads me to House Bill 3191. It's a simple little bill, in my opinion. I don't do all the work that you do, and I don't have all of the push and pull that you have when you sit at your desks. But all 3191 that was sponsored by Representative Moody, all it did was enforce the laws that we have. So there are incidents, there are times under protective orders or bond conditions, or when you're convicted of domestic violence, when we are allowed to take your weapon. And the only reason we're allowed to take that weapon is because you gave us that permission to do that. And all 3191 says is that each county on its own was going to organize and have protocols on how to retrieve those weapons. I'm embarrassed to tell you that in El Paso, and I tell you, I do a lot of work on domestic violence. I'd like to consider myself a leader in this area. I don't have a smart way to take that weapon from the person we just convicted. Even today, even after August 3rd, I don't have a smart way to do that. So if you're wondering, well, the question was asked, well, what are the indicators? All I know is if you're a bad guy in the past, you're a bad guy in the future. So if you've been convicted of domestic violence, my guess is you're going to do it in the future. And I have a lot of repeat offenders. But it is at least a clear sign that you, the defendant, the batterer, has chosen when they get caught in a corner for whatever reason, their alternative is not. It is not that they're going to step away, that there's a cooling off period, they're going to calmly walk away. That's not their alternative. Their alternative is to strike somebody. And they do that repeatedly. And I heard a question, I think, and I might have misinterpreted the question because I get this a lot, about domestic violence, and maybe you all have given us a little too much latitude on who we take to trial. So here's my really short response, because I have to do it every day, this response. It is true that some people complain about domestic violence and it didn't occur. It's rare, though. Most often, she, and it's usually a her, she has been struck and beat more than once before she even called us. And just because she's now telling me that it might not have happened, or that it wasn't as bad as she said it was, it's only because we still, as a society, haven't really given her the open door to talk to us about having been hurt in such a way. There are at least 100 different reasons why she should say no and not pursue that prosecution. That doesn't mean it didn't occur. House Bill 3191, all it says is, if we convicted you, if it's part of the protective order, if it's part of the bond conditions, there should be an orderly way for us to take your weapon. And when your weapon is supposed to be returned, then we can return it as well. So we have to have a way of how to confiscate it in a smart and thoughtful way so that we don't damage it, so that when your time comes and you get it back, we get to return it to you when you're supposed to get it back. But we don't really have that. And the Texas Council on Family Violence considered having a statewide protocol. And after talking with Representative Moody, we went back and forth over this, and we thought it was smarter, because each county is so different in this state, to let the counties decide which protocol works for them. How can they smartly retrieve a weapon? I would tell you that's a really good step. We know this, not in this case, but we know that over 50% of the mass shooters had some domestic violence history in their past. We know that. So what is a good indicator? You committed domestic violence. I'll leave you with this, because I don't do the job you do, and I think it's really hard. You've given prosecutors lots of tools to fight domestic violence. You've given me a lot of tools to fight the bad guys, and I truly appreciate that. In the area of domestic violence, you have been extraordinary. You have allowed us expansive tools to fight in that area. What I ask from you is just to keep up the fight. Keep doing what you're supposed to be doing, and that's protecting us. That bill, House Bill 3191, or something like that, isn't that hard. And just remember us when you're down at your desk and you're doing that push and pull that occurs for reasons I don't understand and you have a better understanding of. But protect us and do what's right. What happened here on August 3rd, I will never forget. Yeah, I will probably not have the opportunity to try him since I'm in my last year. And that's unfortunate. But I won't forget, this community will never forget. It is true that we are, as a city, we are El Paso strong. But there is a nuance there that we need to keep in mind. We are El Paso strong, but we have to keep taking care of ourselves. And the mayor he acknowledged the Resilience Center. That is one way El Pasoans can protect themselves. We don't really know. I was listening closely to your last panel. We don't really know how this is going to affect us. Are we going to start, is our crime rate going to start to go up because of the incident? Is our drinking going to go up? Are we going to get more DWIs? Are we going to have more domestic violence? How are we going to treat each other now? And I have to tell you, I'm the DA. I'm supposed to be pretty smart about these things. I walk into a store, I look around. I went into a Barnes & Noble the other day. I said this to the Senate panel, and I go there pretty often with my wife. We go there to read and drink coffee. And then these three individuals walked in. I didn't know who they were. They looked a little odd to me. One guy was carrying a duffel bag, which I thought was odd. They were young. I go, so the whole time I'm sitting at the cafe trying to drink my coffee and read my book, I cannot do that till those people left. Now, they probably were innocent. They didn't do anything, right? They were probably great guys. But that's more a reflection on me and August 3rd than it is on them. So I appreciate the opportunity to speak to you all. I'm happy to answer your questions. And once again, I thank you for putting the victims first.
Thank you, Ms. Sparza. I will say there is a lot of pushing and pulling going on the Texas House floor. Absolutely. I think the committee would agree wholeheartedly with that. Ms. Hines?
Good morning, Chairman, committee members. My name is Selena Sines. I am the trial team chief of the Protective Order Unit at the El Paso County Attorney's Office. I'd like to begin by thanking you all for inviting us to be here, especially on behalf of my boss, the El Paso County Attorney Joanne Bernal. We really appreciate the opportunity to testify for you. So a little bit about the Protective Order Unit here in El Paso County. We help victims of family violence, sexual assault, indecent assault, stalking, and human trafficking obtain civil orders of protection. On average, the Protective Order Unit sees about 2,400 people every year. We file about 1,000 protective order applications every year, and we obtain over 575 granted final protective orders every year. I'm gonna reiterate some of these domestic violence, family violence statistics, but since 2006, studies have shown that the presence of a firearm in the home increases the risk of fatal intimate partner violence by 500%. In 2018, the Texas Council on Family Violence released their report that says that 211 Texans were killed by their intimate partners, and 59% of those were shot and killed by a firearm. Here in El Paso County, we lost 6 of our citizens in 2018, and 5 of them were shot and killed by a firearm. Legally removing firearms from adjudicated perpetrators of family violence not only improves the safety of their individual victims, but it improves the safety for our entire community, because studies are now showing that there is a link between perpetration of family violence, domestic violence, and perpetration of mass violence. In the last 10 years, 54% of mass shooting incidents across the country were related to family violence in some way. Of the 22 mass shootings in Texas since 2009, 14 involved the shooting of a family member or an intimate partner, and at least 9 of the shooters had a history of committing family violence in the past. So today I'm going to focus on firearm surrender, storage, and return protocols in cases of family violence. And I'd like to talk to you about the protocols that that we have developed here in El Paso through collaboration with the 65th Judicial District Court and the Sheriff's Office and the County Attorney's Office for protective order cases. Ultimately, my goal is to convince you that this type of legislation needs to be passed across the state. And again, I really like Representative Moody's bill, HB 3191. I know we're kind of beating you over the head with that one. But I really think that it needs to get passed. His bill addresses the reality that one size does not fit all, and that Texas counties need that flexibility to be able to develop their own local protocols when it comes to this issue. And it also provides courts express authority to order firearm surrender across the spectrum of family violence cases, so including magistrates' orders of protective order, final protective orders after an arrest for family violence, bond conditions, and convictions after convictions for family violence. So before I get into the protocols, I would like to thank the 65th District Court Judge Yara Lisa Gutierrez, her associate judge, or her former associate judge Jose Gonzalez, and Sheriff Richard Wiles. There's a lot of moving parts when it comes to developing these types of protocols, even if it's just for protective order cases. And without their cooperation, we wouldn't be able to do this. It would have never gotten off the ground. And so I'd really like to thank them for their dedication to improving victim safety here in El Paso. So I'm going to go ahead and just kind of get into the process. I did provide electronic copies of my testimony, and I've got flow charts. I have the entire policy. I've got sample forms where I use Jane and John Doe as the respondent and the applicant in the protective order. And I just want to highlight that when we were developing the policies, we were very mindful of respondents' due process rights. And so we included throughout the policies provisions that require written notice and an opportunity for the respondents to be heard in court before any firearm surrender is ordered. So the process starts when Jane Doe comes into our office and is applying for a protective order. We will interview her. We usually, and I say her again, as Mr. Esparza said, because that's generally what I see in my work. And we will interview her, do an intake. We do a risk assessment, which includes a lethality assessment. And one of the biggest predictors for the lethality in a family violence case is the presence of a firearm in the home. And so we accept the case. We go ahead and file a Jane Doe's application for protective order. That application includes written notice to the respondent that if he is in possession of firearms, we are going to be requesting firearm surrender order from the court as part of the protective order. We get a hearing date that's 14 days out per the statute, and we prepare a citation that is then personally served on John Doe. The citation, again, includes written notice that if John Doe doesn't show up for his hearing, we're going to take a default judgment against him, and that default judgment can include a firearm surrender provision order, okay? On the date of the hearing, the assistant county attorney, if the respondent appears, if John Doe shows up, then we'll go ahead and talk to John Doe, see if we can come to some kind of an agreed protective order. That agreed protective order, if he has firearms, will include firearm surrender provisions. If John Doe wants to contest the hearing for any reason, then we'll have a contested hearing with the court. And then if John Doe was served but does not appear, then we'll take a default judgment, like I mentioned earlier. During any kind of hearing that we have on protective order, whether it be a default hearing, an agreed hearing, or a contested hearing, the assistant county attorney will go ahead and question Jane Doe, John Doe, if he's present, about the presence of firearms in the home. We want to get that evidence before the court on the record, so that the court can make the determination of whether they can order firearm surrender. If the court grants Jane Doe's protective order, then and finds that John Doe does possess firearms, then the court can order John Doe to surrender his firearms to the sheriff's office here in El Paso County within 48 hours of the conclusion of the hearing. And all of that is put in writing in the final protective order. The court also schedules a compliance hearing for 1 week out so that John Doe can come back to court and let the court know whether or not he's complied with the order and surrendered the firearms as he's been ordered to do. So under Texas laws, I'm sure you've heard it over and over, that persons who are subject to a protective order are prohibited from possession of firearms, ammunition, and their license to carry, if they have one, is suspended at the time of the protective order is granted. So to surrender, John Doe would show up to one of the sheriff office locations that's listed in the protective order, and the sheriff has gratefully let us send all these respondents to various different locations across the city, so they don't have to just go to headquarters, which may be a long way away from them, and they may not be able to get themselves all the way over there. So the sheriff has allowed us to send respondents to various different locations so that it is convenient for them to show up to the sheriff's office and surrender their firearms. Once they surrender their firearms or their ammunition or their license to carry, the sheriff's office will issue them a written receipt, and the sheriff's office will also create an informational report, which we at the county attorney's office can pull up on the law enforcement systems to double check whether the surrender has happened. John Doe is then required to file a copy of his receipt with the court to show that he's complied with the order. 1 week later, we have our compliance hearing, and if John Doe has filed his receipt, he surrendered the weapons, he doesn't even have to show up. We know that he's surrendered, we've got a copy of the receipt, or we've got that informational report, and we don't take any action at that hearing. If he has not surrendered the weapons, then he does need to go ahead and show up to the hearing, either provide a copy showing, look, I did surrender my weapons in time, or I have surrendered them since then, or provide some kind of an explanation to the court as to why he has not been able to comply with the order. At the end of the hearing, the protective order unit will determine whether or not we're going to ask the judge to hold John Doe in contempt of court for not surrendering the weapons. And the way that we do that is we file an additional motion, provide him again with citation, personal service of that motion for enforcement, asking for the judge to hold John Doe in contempt because he has not complied with the gun surrender order. So the sheriff's office has agreed to store the firearms for the duration of the protective order. A protective order can last anywhere from 90 days, however long the judge wants it to. Usually for family violence, we get protective orders for 2 years. There are some situations where we can ask for protective orders for longer than 2 years. If the case is a stalking or sexual assault, indecent assault, human trafficking case, then we can ask for protective orders on the initial application. We can ask for a protective order for the person's lifetime. And so the sheriff's office has agreed to store the protective orders, and usually it's going to be about 2 years, okay? Once the protective order has expired, then John Doe, we provide him notice in the final protective order of what the procedures are for getting his firearms back. So once that protective order expires, he can file a written request within 60 days to the sheriff's office to go ahead and request return of his firearms. The sheriff's office will then run a background check to determine if John Doe is legally able to possess firearms at that time. If the background check is not clear or shows that there are other legal prohibitions, maybe like a misdemeanor conviction for a crime of domestic violence, and the time frame from the conviction or serving out his sentence or whatever hasn't passed, then the sheriff's office will notify John Doe in writing that he's not allowed to have weapons. They're not going to return them. And they'll also let John Doe know that there's a review procedure that we have set up through the court. And they'll direct John Doe to the court's website, the Protective Order Court's website, where there's information and sample forms to file a motion requesting return or requesting review of the denial of the return from the sheriff's office through the court. Once John Doe files that motion with the court will hold a hearing. John Doe has the opportunity at that point to provide evidence to the court regarding any of the alleged prohibitions to his possession of firearms. And then the court will, after hearing all of the evidence, will determine whether or not it's going to grant or deny John Doe's motion to get his firearms back. And that's kind of the end of the process as we've seen it right now. Our protocols have been in effect since August 6th of 2019. That was the Tuesday after the Walmart incident. We had been working on them long before then, and it just so happened we had already determined that that was the date that we were going to enact our protocols. And since then, the courts have issued 15 orders to surrender, and the sheriff's office has accepted 14 surrendered firearms since August the 6th. We're able to get these orders to surrender from all of the courts that hear protective orders here in El Paso County, and so we've expanded them so that we're not just doing them in the 65th District Court anymore, but we're getting them from all of the other courts that are hearing protective orders. So personally, I've been doing this work since I was in law school. My sister is a survivor of family violence, and when I was in law school, I thought, you know, I got to do something about this. So I did the domestic violence clinic at UT, and I was able to get my first protective order as a third-year law student when I was at UT, and I was hooked. And so when I got out of law school, I went to go work for the Texas Rio Grande Legal Aid here in El Paso County, and did work on behalf of victims of family violence. I then got an opportunity to work as a staff attorney for the San Antonio Battered Women's Shelter, and I did that for 2 years, and that was a very eye-opening experience for me. Seeing it from that other side, being in the shelter and working with the women that were in the shelter at that point. And then I came back home and started working for the county attorney's office. And whenever I think about firearms or talk about firearms, I think of a specific client from San Antonio. And she was a woman, her husband had a firearm, and every single time that they would get into any kind of strife or argument or have any kind of heated discussion, he would pull his handgun out. And then repeatedly, and regularly, on a regular basis, several times over the course of their relationship, he would shove that firearm in her mouth and hold it there as he was belittling her and just terrorizing her. And to this day, I can still see the look of terror on her face when she had to describe these experiences, not just to me, but to the police, to the shelter, and then eventually to a judge in court when we were requesting the protective order and we were requesting custody, sole custody of the children and all of that. And I still remember that face to that day, the look on her face. And I've seen that look over and over and over in working with my clients. And I've seen the long-term trauma, not just to them, but to their children, to the community at large, when a perpetrator, an abuser, uses a firearm as a tool of power and control. And so that's why, again, I'd like to strongly urge you to revisit past Representative Moody's bill, HB 3191. As the district attorney was mentioned, it requires county commissioners courts to form task force to develop local protocols for firearm surrender, storage, and return. Just like we did here in El Paso County with regard to protective order cases, it amends various provisions of the Code of Criminal Procedure and the Family Code to give courts express authority to order firearm surrender. And another thing that I think is going to be important part of this process and these protocols is to develop and to provide some kind of funding for law enforcement agencies to get these storage programs off the ground. I know in Dallas County they have been doing a firearm surrender program for a while, and they've had to move the organization or the agency that was storing. They were doing it, I think, one place, and then they had to move it. Now a private range is doing it. And so I really think it's important that our law enforcement agencies have the funding and have the tools necessary in order to be accepting these firearms that are being surrendered in family violence cases. So again, I'd really like to thank you for the opportunity to be here, and I'm open to any questions you may have about our protocols here in El Paso County.
Representative Gonzalez.
Thank you, Chairman. I'm going to ask a question on behalf of Representative Capriglione and I, because we're over here trying to understand. And first and foremost, I want to say to all three of you is thank you for your leadership, your commitment to taking care of our community. You all have done so much. And to Jaime, well, you're my constituent, so I'm really grateful for you especially. But on the protective orders, you said surrender. So the judges said this person shouldn't have a gun because they have acted in violence. And Representative Capriglione and I were wondering, they have to make the choice to give you the gun, right? Or, I mean, I guess I'm wondering about that gap in between of the judge says something, does law enforcement then go with you? Or do you have to give law enforcement your gun? And what he's saying, well, why don't they just hide it under the bed? No one would know any different. Yes, did I paraphrase for you? Not under the bed, somewhere.
Somewhere. So in our protocols, they are being ordered to surrender. So they have to physically take the gun into the sheriff's office. We don't have anything in our protocols that say that the sheriff's office is going to go and collect the gun from anyone. We just don't have that ability to do that at this point. But if they do not surrender, then we do have enforcement mechanisms. So if the court finds the person in contempt for not surrendering the weapon, then the court can issue a capias, which is a warrant for arrest, and have the person brought to the court to say, I ordered you to do this, you haven't done it, you need to do it now. I'm giving you till the end of the day, or else I'm gonna issue another warrant to go and pick you up. And so if they don't surrender, and that's one of the failings of a lot of different gun surrender programs, is that the person there's an order to surrender, but then there's no follow-up, there's no compliance, nobody's checking to make sure that this person actually did what they were ordered to do. And so that's why we wanted to make sure that in our process, it might take a while, but there is somebody following up. We give them 48 hours to surrender. We give them a week to show up and let the court know that they have complied. And then if they don't, then there are other things that we can do to try and force them to comply. But again, it's not the sheriff is we're gonna send the order to the sheriff, and the sheriff is gonna go to that person's house and knock down their door and get the guns from them. Because
it's just the accountability infrastructure that
yes,
you're creating.
Yes.
So a follow-up question, Jaime or Mr. Esparza, you had mentioned that, and you are a rock star leader when it comes to domestic violence, and all over the state, you're an award-winning leader on this issue. But even you have said it, it's difficult to institutionalize the infrastructure necessary. Could you help us maybe understand, so when we go look at this next session, we can A, provide the resources like you talked about, or B, maybe create other systems of support so that people who genuinely want to do this aren't struggling through the barriers?
Well, first I wanted to address your first question. I'm not surprised that you asked us to explain what the status of the law is regarding the surrender. Like, does he have to give it to us? The, I mean, what is the manner in which he gives us the weapon? A judge has ordered him that he can no longer possess the weapon. All we're asking in this legislation is to enforce what you have told us we can do and what the judge can do. And because there's a judge involved, I'd like to believe that there's been due process, and whatever the current jurisprudence is at the time, we followed that, and then the judge ordered that he had to surrender the weapon. Right? What we notice now about implementing something like this, Dallas did have, they've been doing it a while, they have some issues. Most of the issues has to do with storage of the weapon. So in some communities, storage may not be a big issue, but in larger communities, they might. It's also whether or not, are you gonna store it in an evidence locker room, right? But are you gonna store that weapon with all the other, if you ever been into an evidence room, there's tons of stuff there. It's probably not the smartest thing to do. So you have a separate area to store the weapon because we have an obligation to return it. And so when his ability, or he's retained the ability to own a weapon, he has a right to come get it. And so we should be able to return it to him in the way he gave it to us. So we have looked at that. I do think that some jurisdictions are going to require funding, some funding to help them move that along. But the very first thing they'd have to do is just get within them, to get in their county a task force so that they could figure out what are the parameters and what is it that they need. And so, and everyone's different. I mean, as I tell you, the Texas Council considered having a statewide protocol, but it didn't make sense because every county's different, especially very smaller counties. How are you going to do that? And how are you going to enforce it? And in areas where I totally understood the doctor to say, well, he grew up with weapons, and I get that, but there still should be a way for us to retrieve the weapons in an orderly way. And so we're still working on those issues, but I can tell you that I'd certainly be happy to help you in this area, but the Texas Council, we are in touch with not just Joe Moody, but the rest of you all on how to move forward.
Representative Ortega, I think.
Okay. I want to thank you for bringing the committee to El Paso because this is very important to our community, and it also helps with the healing process. And I have to agree with our district attorney, it's not something that is ever going to go away. But I have a follow-up question to the county attorney's office and to our district attorney. It sounds like the protocol, the process that you have established is something that is working. Do you know whether or not other communities are doing the same?
I know for sure that Dallas County has a protocol in place. I've seen orders to surrender in protective orders in Fort Bend County, but it is unclear whether there's any follow-up or the firearms are actually being surrendered. I know for sure Dallas County is doing it. We just started doing it in August, and I've seen protective orders that include an order saying that the respondent should surrender their weapon within so much time to a law enforcement agency or something, but it's unclear whether the process is, there's actual protocols, or if it's just one judge wanting to make sure that somebody who has been prohibited from possessing a firearm is ordered to then get rid of that firearm.
So it sounds like it's inadequate in that many other counties have not developed protocols. And it also appears that because it's necessary to have follow-up, that should be something that somehow is through policy or mandated. Would you agree with me?
I think there absolutely has to be some accountability for the person who is ordered to surrender. If it is going to be an order to surrender and not an order to the sheriff's office to go and retrieve, like some people think that that's a better way of doing it. But I think that if there's an order to surrender a firearm, there has to be some kind of follow-up, some accountability, and somebody needs to hold that person responsible for complying with that order. And so for us in El Paso County in the protective order system, we are those people that are following up and making sure, and the courts are assisting us with that, in that we file those motions for enforcement. But I absolutely think that there does have to be accountability and follow-up to make sure that the firearms are actually surrendered or retrieved or taken from the respondent.
Thank you.
Representative Blanco.
Just if I could just follow up, I think it's very clear that only really El Paso in this instance and Dallas do it. So that tells me that the law was available. So it's not like we weren't able to do it. But why aren't we doing it? It's going to take a community effort. This is not an easy issue. I clearly understand that. I understood the struggles of House Bill 3191. I get that. But it's going to take an effort, like some direction from the state to mandate that we have protocols so that the communities come together on an organized way to retrieve these weapons.
Representative Fierro.
Thank you, Mr. Chairman. First, I'd like to thank the mayor and Mr. Esparza for their leadership. You all have been pillars in this community. Thank you very much. My question is for the county attorney. Is there a fee, a storage fee, when someone turns in their guns to the sheriff department and when they're returned?
The sheriff's department at this time has not been charging a fee. I don't know if that is something that is going to be looked into in the future. We hadn't really discussed it at this point, but I would imagine that if the protocols go countywide to family violence cases, criminal cases, that they would be accepting more and more and storing more and more weapons. And I know Commander Flores is on the agenda for later, and he was one of the sheriff's officers who was helping us develop the protocols. And so that might be a better question for him to see if they are thinking about charging any kind of a fee for storage.
Second part is, out of the 14 firearms that have been collected by the sheriff's department, have any of them been returned yet?
No, not yet.
Thank you, Mr. Chairman.
Representative Blanco.
Thank you, Mr. Chairman, and thank you to all for your leadership. You all have been very strong for our community. Question for the county attorney's office related to the storage program. So what can you tell us regarding the status of El Paso County's gun storage? We heard the data on how many have been claimed or retrieved rather, but you had mentioned funding. So is El Paso County Sheriff's Office the only entity that does or administers the safe storage program? And then for those weapons that aren't claimed, what happens to those weapons?
So to the first question, I might be able to answer the second question faster first. The sheriff's office has not, is the only entity right now that we are working with, and we're referring respondents to go and surrender firearms. Since we are part of the county attorney's office, it was a lot easier, and we have a better relationship with the sheriff to be able to ask the sheriff to assist us with this program and this pilot program. I don't know if at some point then we will reach out to the police department to see if they would be willing to accept firearms as well. But being within both part of the county, we went ahead and collaborated with the sheriff's office, and they've been very receptive in helping us with this process. And then the status of the actual storage program, again, I don't know. I think that I know Commander Flores, was invited to be here, and I think that you might want to ask him. I know that they said that they didn't anticipate any issues so far, but again, as the program continues to collect weapons, then I don't know what we're going to do at that point. But I think that that's probably a better question to address with the sheriff's department.
And you had mentioned Dallas. Are there communities that have model programs that we should be looking into?
So I know Dallas has a program, and their program has been publicized and used throughout the state. And then there are also programs that are in place that I've read about in California. There's one in Wisconsin, and I have a report from that SMU did a few years back about the Dallas program, and it compared it to different programs across the country and provided recommendations. And if you'd like, I could go ahead and forward that to you as well.
And final question, is the state doing enough to help counties, cities with these storage programs?
Well, since they're not really in place yet, I can't really answer that. I think that again, I think that if you are going to pass legislation like Representative Moody's 3191, I think that you are going to have to go ahead and assist, provide some kind of funding source for law enforcement agencies to get this program going.
Okay, my question is to the district attorney. We have heard from several district attorneys in this process. And although it's not the subject matter of today's committee hearing, we are perplexed as to how we can get a hold of the 4473, which is the form that people lie on. When you apply for a weapon, they do a background check and they go through the process of determining whether or not you're eligible. And there are millions of applications, as you might suspect, and there are over 112,000 rejections. People have lied, but yet there's only been 8 prosecutions of those forms. And, you know, one of the things we're looking at is how does the state, through our district attorneys, have an opportunity to prosecute those who lie on those applications for weapons. Do you have any thoughts on that? I mean, I'd like to hear them if you do.
That's actually a really good question. I get that question not in other areas as well, where there is a law that's being violated, and well, why aren't you prosecuting? Generally, it requires someone to put the case together. So if it becomes a priority within either DPS, the Sheriff's Department, the Police Department, the Rangers, whoever it is, and they start bringing those cases to prosecutors' offices, I think you'd see more prosecution. It would be interesting to see how that evolves. I'm not going to tell you that you would see prosecutions rise dramatically. It would depend on, every fact situation and who's filling out the form and all of that. But in 28 years, I can't remember one of those cases coming to my desk.
Well, the reality is you don't have the form. Those forms are being held by the dealers. And so,
just to be perfectly honest with you, I'd actually have to go look at the penal code right now if to find that violation. I've never even thought of that. I always considered, just in my experience, the firearm violations as being federal. And usually, ATF moves in on firearms issues and that licensing process. And so I've always relied on that. I'd actually have to go back and look, because it's not something I've seen.
this is an issue that's important to Chairman Guerin. I think Chairman Guerin has a question.
No, I believe the reason you haven't seen it to prosecute it because it's a federal law, and we need to make changes in state law so that we can prosecute lying on a federal firearm.
And that sounds exactly right to me, because as I tell you, it's always been a federal issue as far as that's how I have always dealt with that issue.
By the way, with regard, I think there has been an incident of violence when the weapons were being secured by law enforcement under a protective order. And I think there's an incident, I'm not totally familiar with the facts, but I think their law enforcement officer was killed or hurt, and certainly the perpetrator was killed, I think, with regard to that. Are you aware of that? And is that, we'll ask Sheriff Flores on that later, but Is that come to mind?
Yes, and I have read of various different incidents where a sheriff office is gone in to retrieve a firearm that the person is prohibited from possessing, and the law enforcement officer has been uh, injured or shot or killed. And I think that that is one of the reasons why in our protocols we said we are ordering the respondent. It is his responsibility to surrender that firearm. He's being ordered to surrender the firearm. It is on him to comply with the law, and we are putting the onus and the responsibility on that respondent to do what he's been ordered to do. And so we don't want to put any of our law enforcement officers in any kind of danger by having them go and try and knowingly know that this person is dangerous and that they have firearms in the home, and to try and take those firearms from them. And so that is why we've put the onus and the responsibility on the respondents in the protective order cases to comply with the order and to surrender the firearms themselves to the sheriff's office.
And you think they're being honest about the disclosure of their possession of those weapons?
And that is one thing that we have had some issues with, not issues, but we've had some concerns about in our cases, because yes, we do just ask them on the stand. They are under oath, and we ask them on the stand, do you do you own any firearms? Do you have any firearms in your home? Do you have any ammunition? Do you have a license to carry? We have no way of verifying, but we do ask both the applicant for the protective order, and we ask the respondent in the protective order case. And we've had a couple of cases thus far where the applicant is saying he has guns. He has 3 guns. They're in the home. They're above the closet. They're locked in the safe. They're wherever they are. And he used a firearm. We had a couple of cases where the person used a firearm, actually shot at the car of the victim, and the respondent showed up to the compliance hearing or an enforcement hearing and said, I don't have any guns. They're not mine. They're somebody else's. And there's really no way for us to prove that he doesn't possess weapons. And so we really have to, that's one of the discretionary functions of the court is determining at that point, does the court have enough evidence? Does the court believe that this person does have weapons in their possession or in their home? And then we've had a couple of instances where the court has ordered firearm surrender because they have made a finding. I do believe that you have firearms in your home, so I am ordering the surrender. But again, if the person continues to say, I don't have any firearms, we're kind of at a loss there. And so that has been a concern of ours.
Members, any questions, or would you have something else to say? Yes.
In regards to the issue that just came up, you could change the law, but currently the penal code, if being not truthful on a government form is not a state violation. Just so you know. On a federal form.
Mayor Margot.
One thing I wanted to add, your previous panel on mental health, one of the things we instituted right after I became mayor was the beginning of a crisis intervention team with our police. So we trained 14 in our first police academy in 17, 18, and we're beginning the training across the entire force to deal with mental health issue and hopefully de-escalate before it happens. Representative Price's bill providing grant funds for us has been very helpful. But let me just tell you, it's costing us more and more. And so to the extent that you all want to look at things, we need more help in that area. And since SB 2, we dramatically need more help.
Members, any questions? Thank you again, panelists, for your testimony. We appreciate all of you coming. Good to see you, Mayor, and give my regards to Mrs. Margot. This time the chair will call David Burton, Robert Flores, Jeff Williams, and Steve McCraw, Colonel McCraw. Welcome, gentlemen. I think we'll begin with David Burton.
Good afternoon, Mr. Chairman and committee members and members of the audience. My name is David Burton. I am the Chief of Police for the City of Socorro. I'm a recent transplant to El Paso, haven't been here 11 months. My prior law enforcement experience was 29 and a half years with a Waterford, Connecticut Police Department. In both cases, both states that I've served law enforcement, both of my agencies have responded to tragedies that have occurred within the recent vicinity of their law enforcement jurisdictions. One of the hats that I wore in Connecticut was the lead active shooter response instructor for Southeastern Connecticut. I actually developed a plan for there. I taught that for 19 years, trained over 6,000 police officers, fire, EMS, first responders, conducted 17 annual exercises, which I oversaw, and actually was contacted by federal agencies to assist them with exercise planning, one being the TSA, and the second one being the Coast Guard, which actually wrote a program for car and passenger ferries, having been on the coast, for active shooter response. But today we're here to talk about improving the dissemination of information. And obviously Connecticut is very close to New York City. We're about 90 minutes, my jurisdiction was 90 minutes away. We responded to that when they had their terrorist event. So I just want to back up to that a little bit so we can put some context on information sharing. The events of 9/11 were the wake-up call for the law enforcement communities across the country. As a result, better and more timely information sharing was a primary goal. The offshoot of this process was the creation of fusion centers across the country where local, state, and federal law enforcement agencies could deposit information, and in turn, this was pushed out to participating members. Even though it's been some 18 years since those events, the information sharing continues today. Our own fusion center here in El Paso sends out daily bulletins to surrounding agencies with important law enforcement information, keeping us all well informed. Even with this system of robust and timely information sharing, when it comes to the active violence or shooter event, the police departments are the last ones to know. This is because the actual act must take place for a response to occur. What history has shown is that the first responders from departments across the country will react in a timely manner, act with compassion and professionalism, contain the scene, treat the wounded and injured, provide timely communication to the public, identify the suspect, and ultimately conduct the required investigation. It is during the investigation phase that the police department will often discover how much they didn't know. This is because the information collected is in the possession of individuals in no way associated with law enforcement professionals. The information must be put together the same way that a puzzle is, that being one piece at a time. And only then does it become obvious to the investigators that the probability of the event occurring was inevitable. One of the most important questions for a member of the public might be, do I have information that should be shared with law enforcement? Examples are the posting of a threatening message, a video, a written manifesto on social media viewed by a friend, a coworker who has a conversation with an individual who states they're going to get even, a family member who reports a relative is causing them concern because they show signs of withdrawal and make comments involving violence, the gun store owner who sells a weapon to an individual who makes small talk that they're going to use it to hurt people, the package delivery person that just delivered tens of thousands of rounds or explosive items to an address, or the teacher who continually mentors a student who relates in confidence that they are frequently bullied at school and can't wait to get even. All of these have been discovered during the different active violence events which have occurred within the country, and most were found after the fact. We must not rely on the police and emergency response to end or contain these events, because if we do that, there will continue to be victims of these crimes, and the number will be determined by the time frame of the event. Instead, a preventative response is required with early intervention so that these tragedies do not occur. If the law enforcement agencies across the country can share information so effectively through the current centers set up for that purpose, then this does need to be done. This does not need to be where the focus is. Instead, we need to look at the community information sharing, as this is where those critical pieces most commonly reside. We must look at what repository systems currently exist or can be created, where information can reside and is delivered in such a way that an agency, not necessarily law enforcement, could perform a follow-up, such as a contact with an individual. At the same time, we must be conscious of the fact that such information may be potentially confidential and so must be shared in such a way as to protect one's privacy. It is then that I offer for discussion the creation of municipal crisis teams. Before, when we were listening to the mental health professionals, they referenced them as risk assessment teams. It's semantics, but they're the same idea. For just this purpose, the teams would be composed of multiple representatives from within a town or city, and the team composition might be one of not only law enforcement, but schools, social services, mental health, religious denominations, business professionals, legal, advocacy group representation, and at-large members. They would operate under the strictest sense of confidentiality and bring information forward that may be acted on with limited focus, that being to determine if a threat exists. In this vein, and if warranted, partnered visitations involving several agencies could be performed at an individual home and conducted with each agency acting in their capacity. As an example of this process, the law enforcement officers assigned may temporarily remove from a residence because of a risk factor, weapons, while social services or mental health professionals conduct evaluations for any required services. In my last jurisdiction within Connecticut, my police department partnered with a service called Mobile Outreach, which is a mental health service. We conducted joint patrols, and we were far more effective in this capacity when we made contact with individuals with mental health issues than we were with the officer acting alone. There is precedence for these types of groups to exist. Across the country, juvenile review boards have been formed by communities to review youthful criminal activity as an alternative to court referrals. Juvenile information is also considered confidential, but is shared amongst the members who sign confidentiality agreements. The group collectively creates and enacts a plan for juveniles, and the result of which is effective prevention, as seen by the reduced recidivism rates when using this process. As an additional measure, more effective public information service announcements are required that encourage people to report suspicious information. Much in the same way as the See Something, Say Something campaign heightened awareness to possible terrorist threats, then this should be delivered in such a way that even if a person is unsure of the importance of the information they possess, it is okay, and indeed not a waste of their time, to provide this to their local law enforcement agency. In turn, the police departments must establish standing operating procedures of what to do when information is received. At minimum, I would suggest that a home visit is required, not only to check on the welfare of the individual in question, but also to look at potential risk factors, such as the access and availability of firearms. Does the department have effective partnerships in place with other professionals so that when there is a question as to the correct course of action, a collaborative approach can be made? This is the second time I've appeared before this type of panel, the first being the Sandy Hook Commission in 2015, when Connecticut suffered its own tragedy. With effective communication and information dissemination, I believe that need for these kind of inquiries can be reduced. Thank you.
Thank you, Sheriff Foilers.
Good afternoon. I want to thank you all for the opportunity to represent the El Paso Sheriff's Office in this capacity. August 3rd was a horrific day in the history of El Paso. I'm a 30-year veteran of my organization. I'm born and raised here in El Paso. I've never left El Paso. I've just been one of those people that's taken up a public duty to do the best in my community. And that day is one of the days that we'll never forget here in El Paso, as everyone has testified to. The El Paso Police Department, although they're not represented here, I do want to stress that they did an outstanding job in spearheading that incident response. The cooperation from outside agencies, the state agencies that showed up, additional local law enforcement agencies, and most importantly, I can't underscore the importance of the citizens who showed up and helped to make this incident, help us deal with this incident. It was just phenomenal. It's nothing short of phenomenal. The healing process has begun, and everybody's moving forward, and we're asking ourselves, especially as public servants, what can we do to prevent this tragedy from ever happening again?
Commander?
Yes, sir.
I started you off on the wrong foot because I called you Sheriff Flores, and for the record, I know you're not the sheriff now.
Oh, no, sir, no, we wouldn't want any rumors.
But certainly I want you to identify your name and the position you hold and who you represent.
Yes, sir, I'm sorry. My name is Robert Flores. I'm a commander with the El Paso Sheriff's Office. I oversee the Criminal Investigations Bureau of the Sheriff's Office. Yes, sir, my bad, I'm sorry. So with respect to some of the panel members that spoke earlier, everyone has really provided a lot of information here. And one of the things that we want to stress in law enforcement, we've recognized the fact that not all evil in our society comes from individuals suffering from mental illness. So we want to avoid that stigma. We just have to understand the fact that there are evil people in our communities, and we have to deal with those. But we view information sharing as extremely critical. In order for law enforcement to do their jobs, we have to be able to share information with respective jurisdictions. There's not criminals, and the criminal mindset doesn't concern itself with jurisdictions, especially in a community like this where you actually have not only different states but you also have different countries involved. So we're very familiar with the fact that you can't just draw jurisdictional lines and hope and pray that criminals lie within these jurisdictions and only act in there. They'll do whatever they're going to do, irrespective of any jurisdictions. But we do rely heavily on the Fusion Center, and as the chief mentioned, it's a very, very important part of our day-to-day activities. We receive officer awareness plans on a daily basis. And those officer awareness plans come from information that is vetted by individuals who are assigned to the Fusion Center, and then they give law enforcement an opportunity to be proactive and go out and prevent crime as quickly as we can. Understanding that one of the issues brought up earlier that I thought was an excellent idea that should be provided to our Fusion Centers was the information of individuals who have failed background investigations. If you have an individual who goes and applies for a firearm and he fails that background investigation, he has other means to go out and purchase a firearm out in the streets. If we would have that information, we could put that information out in our jurisdictions, and we actually have people within the community that can let us know that this individual is out there trying to purchase a firearm. And we can hopefully take some sort of action and prevent this sort of tragedy from happening again. We understand the mental health issues and the HIPAA issues and the privacy issues that go along with that. And that's going to be something that a decision needs to be made on your level. But we also do our best to mine social media and look for indicators of individuals who may be prone to acts of violence, who may be posing on social media with multiple weapon systems and then airing grievances against members of the community or whatever grievances they may have, or maybe their employer. And we do our best to go out there and interview these people. We feel that by going out and speaking to these individuals firsthand, we can prevent tragedies like this from happening again. So in short, we do support the information sharing within multiple jurisdictions. The chief was very, very comprehensive in how he covered everything, so it kind of threw me off a little. But the important thing is that the point got out there. It's going to take members of the community, especially the public, because somebody knows something. These people don't just come out of the woodwork. Somebody knows something. It's going to take members of the community to come forward and let law enforcement know, and then let us do whatever we can. Consequently, we work within the confines of the law. The Health Safety Code allows us to seize weapon systems under certain circumstances if we feel that a person is a danger to themselves or others. And then as we brought up, we're working with the local district and county attorney's office to store weapon systems for people who are not allowed by law to possess weapons. So we feel that we're doing our part, and we're definitely open to anything else that comes our way. But more importantly, we want to stress that it's going to take the actions of everyone involved in the community, not just law enforcement. We don't have the ability to foretell the future, and we're hoping that something comes from this committee.
Thank you for your testimony. Jeff, you're going to have to pull the microphone and hold the button down. I'm sorry.
Thank you, Colonel.
You do a good job of holding the button down, Colonel McCraw. Yeah.
Mr. Chairman, members, my name is Jeff Williams. I'm the Regional Director for Texas Department of Public Safety in North Texas, Dallas, and the surrounding 42 counties. On Sunday, December 29th, at approximately 10 a.m., a man walked into the West Freeway Church of Christ in White Settlement, Texas, and entered a restroom. Shortly after exiting the restroom, he went to the auditorium and sat on the back row. The church security team members were immediately alarmed by his demeanor and his attire. They noticed he was wearing a fake beard and a wig, but more critical than noticing it, they acted on it. They took steps that they had trained to take dozens of times before this particular Sunday. When he walked back into the auditorium, security team members strategically placed themselves in nearby pews before the beginning of the service. During the service, he stood up and spoke to Tony Wallace, who was unarmed and was simply helping with communion. Tony was a nurse and a graduate of Mineral Wells High School. After a brief exchange of words, the gunman brandished a shotgun and fired at security team member Richard White. Richard White was an Eagle Scout and described as everyone's best friend, including the pastor, Britt Farmer. Mr. White was drawing his weapon when he was killed just before the gunman turned and shot Tony. He then turned and moved to the front of the church. When he was from approximately 30 feet away, he was shot by Jack Wilson. As he was going down, he fires another round of buckshot toward the front of the church. The gunman had 4 rounds in his gun and 10 more on his person. Unfortunately, this entire incident was over in 6 seconds. Everyone in this room has heard countless stories about other attacks across the country, which tragically went on for minutes and ended entirely different. After Columbine, it became pretty obvious law enforcement had to change its tactics because it was no longer acceptable to simply set a perimeter and wait for a SWAT team to stop the attack. This case, along with some data I'd like to review with the committee today, should serve as a reminder that immediate responders or citizens have a similar realization. And that realization is that you can do something. After Columbine, an entirely new training world began unfolding for police officers across the country. And in Texas, because of the forward thinking of the legislature, we have been so fortunate to have the ALERT program in partnership with Texas State University leading that effort. The ALERT program, or Advanced Law Enforcement Rapid Response Training Program, was formed in 2000 to train patrol officers on how to respond to an active attack. And the program evolved into what is now the national model of response, in part because of a robust research component, which has provided us with critical data that has been used to develop training and serves to drive the policy of police departments across the country. Data can only be manipulated, or data can be manipulated to say anything, but put it with an anecdotal story, and it becomes pretty powerful. The complete set of data that I'm going to draw from today is available online in an annual report published by the FBI and the ALERT program, but there are some critical pieces of data related to civilian response, and it highlights what happened last week in White Settlement. Several years ago, the ALERT program developed a civilian training model called the Civilian Response to Active Shooter Event Program, or CRACE program. The program came about as a result of studying hundreds of active shooter events. Upon review of 316 events from 2000 to 2018, critical data points emerged to develop the framework of what civilians can do in an attack and why it's vital for them to train to save their own life. As you know, we make policy decisions based on actual data. The anecdotal stories surfacing on social media and in the news are they're not just incomplete or reported out of context, but very often, frankly, they're just simply wrong. It's important to have an understanding of the scope of the phenomenon. So how often do we have them? Since 2000, there's been a noticeable upward trend in the number of attacks. In 2000, there were less than 5. Today, the 5-year average is 22 per day. That's 1 every 16 days. While most of the time we think of these taking place at a school, the majority take place in a business or a public or outdoor setting. Over 200 of the 316 events have occurred in these locations. Schools were next with just under 60, and less than 20 of them were in a house of worship. Since 2013, we've seen an increase in attacks where the attacker used an edge weapon. Since 2015, vehicle-borne attacks have been on the rise. This is in keeping with some of the jihadist material that we see in places like Inspire magazine. 54% were committed by someone who had no relationship to the location. Just over 20% of the attackers were coworkers, and 15% of the attackers were carried out by the attacks were carried out by a student. The national average of duration is 7 minutes. The average law enforcement response to an event is 3 minutes, and in law enforcement, that is lightning fast. It's probably not going to get much faster than that. 50% of the attacks are over before law enforcement arrives. It's a critical point. The fact was key catalyst for the creation of the CRACE program because we realized that these were done before we got there. Over 50% that are over before we arrive, and in 35% of those, the attacker stopped either by committing suicide or merely leaving. The civilian or immediate responders stopped 15% of them. Only 3% of the time did someone use a firearm to stop an attacker. 12% of the time, people simply subdued them. And I want to focus today on the civilian aspect of the issue, but from a law enforcement perspective, statistically speaking, you should know this is one of the most dangerous calls a police officer in America is facing today. I mentioned earlier 50% of them were over before we arrived. That means 50% of them are still going on when we get there. In those cases, when shooting is still taking place, when law enforcement arrives, the shooter gives up or commits suicide only 15% of the time. The police stop the shooter 35% of the time. And 13% of the time, a police officer is shot. 1 out of 4 calls to an active shooter event where there's still gunfire going on when an officer arrives, an officer is involved in shooting someone. So there's no other call in America where we respond daily where we are shot 13% of the time or shoot someone 1 out of 4 times. A solo attacker commits 98.7% of these attacks. Just over 1% have more than one attacker. And when there are 2 attackers, they're operating as a team in the same general area. There's always a concern for a second suspect, but we simply don't see this in the data. So as a result, what we're teaching now is a transition from law enforcement from stopping the killing to stopping the dying. When we do this, this brings an integrated response. Obviously, fire and EMS have a much higher skill set in that area, and so it highlighted the need for us to train together. Since that time, as a result, Texas DPS has partnered with the ALERT program, and we're teaching the Active Attack Integrated Response, or called the AIR program. This program has been responsible for a reduction in the overall response by about 40% of the time. This data, along with some data collected by Army Colonel Dr. John Holcomb from Houston about mortality rates and time associated with peak time to death, indicates we have to do a better job of training our citizens what to do. They need to know not only how to stop the attacks, but also how to medically treat one another. Dr. Holcomb correctly points out that the intensive care unit is a concept, not a place. Life-saving skills like tourniquet application and chest seals have already demonstrated they can save thousands of lives in Afghanistan and Iraq, and it's no different here. Since the adoption of the Tactical Emergency Casualty Care Program at DPS, we have applied 199 tourniquets, saving lives across the state. Training our citizens on what to do should include a medical component, along with an understanding of the correlation between their actions of the immediate responders and the casualty counts. Based on research from the ALERT program, we teach and advocate civilians to follow the avoid, deny, defend model, and we strongly support Stop the Bleed training for every Texan. The bottom line is that when civilians do something, the casualty count is lower. When they don't, the casualty count is higher. There are fewer victims, and when civilians interdict during an attack, of those victims, fewer die as well. When there's a civilian response, the average duration of an event goes down to 1 minute. When we look at the events where civilians did something to prevent the attacker, 81% of the events are over in under 5 minutes and compared to the previously 7 minutes. So there's a reduction in the duration of time as well. Continuous training and research will continue to identify gaps. It identified the gaps for the need for civilian response. It identified the gap for cops to receive some medical training and tactical training for fire and EMS. And thanks to the funding of the legislature and the forward thinking of this body and our department, we continue to teach those to our officers and our citizens, and hopefully that will in the future save more lives. Thank you.
Colonel McCraw?
Mr. Chairman, members, Steve McCraw, Director of Texas Department of Public Safety. I thank you for the opportunity to be here today. I want to underscore what the mayor said. This is not only a great region in Texas, but in the nation, and it's directly related to its people. And I can testify to that personally, being an El Pasoan. Same high school that many is on the dais right now, but also Jaime Esparza was a great district attorney and leader in the law enforcement community. Quickly, because I know you're busy and try to move quickly. I know that this body has been monitoring our progress on the governor's 8 directives and 8 executive orders. To that end, provided you a summary matrix in terms of what the updates are. You'll find on pages 3, 7, and 14 of those, the update tables along those lines. And if you have any questions, I can answer those. I can also, you provided a law enforcement sensitive version of the mass attack assessment on Texas and also the domestic terrorism threat assessment. You might ask, well, why 2? Initially was domestic terrorism threat assessment we were tasked with in the directive. But as you know, the governor and you and this body cares about all attacks that happen regardless of ideation and motivation. And of course, one of the key findings on page 4, and it kind of backs up to what was said earlier by one of your earlier panels, at least on 2 different panels, is that, and the frustrating thing, and of course some of the things that the chief and commander talked about, there's no single profile of a mass attacker. It's one of the key analytical judgments we have in both of the assessments. It is not. There's so many variables that are involved, and it's why it's so important that the public reports in a timely manner when they see suspicious activity. And that when we have that information, that we follow up in a timely manner. You can see that part of the assessments, and obviously you'll need some time to go through them, but we've categorized them in terms of all attacks. And but first, certainly domestic terrorism is one. And as you note, the key finding in that is white racially motivated violence is the predominant and most active, domestic terrorism incidents occurring in the United States. And we're mindful of that here in El Paso because that's exactly what it was. It was a domestic terrorism attack by a white racist who emulated or sought to emulate the attack in New Zealand, which shows that the mass attacks and copycat attacks is another key finding and concern for the Department of Public Safety in this particular assessment. And I say the Department of Public Safety assessment, this is really a collective view of the entire community, as law enforcement community, local, state, and federal, FBI, Secret Service. We incorporate some of their key judgments into it, so it reflects in that regard. One thing I did want to say about, since we don't know there's so many variables, so little time, and we can't tell who that individual is and why reporting is so important. But why having systems in place and fusion centers in place to be able to increase our ability and use of intelligence, is we have one expert in intelligence up here, is that, what does a mass attacker look like? What does a domestic terrorism look like? And what's a homegrown violent extremist looks like? What they look like is an American citizen, is what they look like. And so you focus on behavior, and that's the focus, and I know the frustration of the chairman and other members is, what are those behaviors? What are those indicators so we can see that and know what they are? And some of those things are very common sense, and then we saw it recently. In fact, I want to give an example of why it's so important that the public reports, and we won't get the name the exact school, but in the aftermath of these attacks, and trying to be proactive and recognizing the threats to life, all leads need to be covered and covered quickly and effectively. And that locals need to know about it, school administrators know about it. And I'm going to punt back to our North Texas Regional Director to describe that one incident that just recently occurred.
Yes, sir. In late last year, we had I'll spare you the names. We had a school district in East Texas that became aware of a student who had made some threats to his peers. The students reported that. The student was suspended in school, I guess put in another portion of the school or something to that effect. Communication was made to the principal. The principal said, no, let's go ahead and suspend him, send him home. But there was never a report to law enforcement. Of course, that generated a lot of Facebook posts and Twitter updates about someone got kicked out of school or sent home, and so parents became aware of it through social media. This is now, the life cycle is still running, the clock is still ticking, and so until finally a deputy who was made aware of it through the social media and the talk from parents, he became aware of it, contacted a trooper. Hey, we need to probably get some CID folks from Texas DPS to look into this. By now, we're now moving into the next morning. It turns out that no one ever went and interviewed the young man at all. He's 15 years old. So they sent him home. So after going to the school the next day, some friends of his were talking with their peers, and someone said, hey, what's the deal going on with your buddy that's says he's gonna shoot up the school? And he says, yeah, he's gonna shoot up the school, and I'm gonna help him. And then he pulls a knife, and now there's an aggravated assault. And so all of this is unfolding without anybody notifying law enforcement. So finally, we start making contact with these young men, and sure enough, the interview revealed that this was a real live, no kidding plan. They had certainly put a lot of thought into it, and they had idolized some previous shooters throughout the country. And so no one had shared that information, and had we not known about it or followed up on it through that parent, thank goodness, it might have actually taken place.
Thank you. The, one of the other key analytical judgments I wanted to mention, because this committee has been interested in, is that how do we, with all the data that exists, that's out there, a monstrous amount that's being uploaded by the second, how do we be proactive in terms of identifying these threats? And the chief and commander both talked about that out there, that's out there. And I think you mentioned even using resources to look and to be able to identify those things. Well, there's not enough police officers and analysts in Texas and in the United States, and you got to look at the United States because these threats are cross-jurisdictional. You got to even look at the world because we haven't seen these threats located and identified, in the United Kingdom and other countries that relate directly back to Texas. So what do we do in that regard? When there's so much data, so little time, how can we effectively do that? Well, the answer is, and the committee has noted this in the past, is that, federal and state laws have not kept up with the technology. There's no question about it. But the real experts, the ones that have the capabilities, the expertise, the know-how, and quite frankly, I don't believe the American public wants big government or wants law enforcement co-locating a lot of private data just to have it to look for threat data. But that expertise in these social media companies, there's no question they have it. And if they choose to, they could develop algorithms that would identify and leverage some of the indicators that we have that can result in a reasonable suspicion, because what we operate on in law enforcement is reasonable suspicion, probable cause, and evidence. And of course, there's other categories, suspicious activity reports, which is a post-9/11 environment, and the chief mentioned and alluded to in that regard. How do we capture that? In Texas, thanks to the funding and support and the leadership and the legislature, we have the Texas Suspicious Activity Network, which is one united system that all the fusion centers and all of Texas uses through an enterprise license. So at least we can have it. And that's not just, when we talk about it, I know there's concerns about privacy and civil liberties. It has to be observable behavior. And there are guidelines, and those are strict guidelines that we hold, accountable, those that use the particular system and load data into that system, because I know there's concerns about that. And last thing we can do is afford to lose this type of system because we've been sloppy. And we've become collecting data without a criminal or predicate in terms of observable behavior consistent with DHS and Department of Justice privacy and civil liberty guidelines. With that, Mr. Chairman, any questions? For that.
I think we'll start with Representative Blanco.
Thank you, Mr. Chairman, and to the panel. Thank you all. To the men and women of your departments that keep us safe, we appreciate your service. My question is to Director Williams or Colonel McCraw. There's been testimony in the past, and I think this dovetails to your comment just now about social media. But there's been testimony in the past that some social media platforms haven't been as cooperative with DPS and law enforcement that we might need. And in your report, I saw that there were several mass violence attempts that have been thwarted by your department and other law enforcement agencies. And there's reference to social media within those uh, prevented mass violent events. My question is, has there been any developments or improvements on communication or cooperation on the part of social media platforms and organizations with law enforcement? Or can you elaborate on how we need to strengthen that relationship, especially as it relates to response to threat?
I think testified earlier that most recently, and I noted at the risk of losing my social media accounts, is that, no, we don't see the type of cooperation that we want. And I understand their business model, their focus is on privacy of customer service, and that's their focus. But our concern and focus is certainly public safety. And to the extent that they can help us, develop and report to us those indicators or when there's suspicious activity, we'd be much safer as a country, because law enforcement can't do it, I can tell you that. And you really don't want law enforcement co-locating that amount of data, frankly. So right now, we're we're really optimistic that they will, at some point in time, recognize that their obligation and the importance that they play in terms of protecting people from harm. And we hope that we achieve that.
Representative Capri-Leon.
Thank you. I have a question, and I think probably best for the police chief. You had talked about, collecting data and some ideas of things that could be collected. Or could you help me understand, for instance, let's say what I do is I call 911 and I say, listen, I think this guy has a gun and he wants to kill somebody or whatever. Can you kind of tell me what happens during that process? Who gets that information? Does someone come and follow up? And then how long is that information? I guess I'm concerned a little bit about how it's working now and what you think maybe it needs to change to.
So the present system obviously is you call 911, you get a police response. The officer's going to go there, they're going to look at it. For number one, is it a criminal type activity that's taking place? If it is, we go down one road. If it's not that, if it's an individual that requires an emergency evaluation, either for mental health or welfare, then we can conduct that as well. But where we share that information from right now with the present system is nowhere. Criminal would go to courts, but if it's non-criminal, the only other people that are going to get that are the medical individuals or professionals that we transferred that individual to. And then there's really no follow-up. Speaking from my agency, there's no follow-up between the two. What I was advocating before was, if we do that, then that gets taken to an MDC, a multidisciplinary team, and then maybe we can follow up with that at a later date.
So when you say your agency, are you saying that like outside of your own city police department or county is where it stays? That, I guess I'm trying to understand what multidisciplinary means.
Yeah, so we would share, right now it resides within Socorro Police Department or whoever we would give that to, depending on the venue that we transfer that to, either medical or criminal, and that's it. If we were to create these threat assessment teams, then we would share that with those individuals that were on the team. And they don't have to necessarily be within Socorro. They could be county employees assigned to the major facilities here, legal, health, schools, again, religious denominations, et cetera. And then even have some business in there as well. So because as the director was saying, these events are not occurring in schools. The majority of these events are occurring in business type settings. So it's very important that that aspect of the community get represented as well.
Representative Gonzalez.
Thank you, Chairman. Welcome to Socorro. I live in Clint, so we're neighbors. We were talking earlier to, this is for you, Commander, sorry. We were talking earlier to the county attorneys and how you all have been really supportive in their initiative to do the protective orders. And one of the questions I had or kind of came up that she couldn't answer was y'all's role in that process, and if you feel you need more resources or if you feel you're going to reach capacity, or what do you feel you need to continue the program or the initiative? How do you feel it's working now? What would you think you would need 5 years from now? If you have on?
Well, actually, I was involved in the implementation of that program. Fortunately, we've got plenty of space right now. The way it works is the sheriff's office is the only location that's taking those weapon systems and safeguarding them until such time as that order is vacated. But the way we feel we've got plenty of resources in place right now. Now, assuming that this system becomes mandatory and statewide, and we have more and more people that are affected by it, then we may need to be looking at some sort of outside storage facility. But for the near future, we think we're good to go. We haven't experienced any problems, and like she said, we've taken in about 14 protective orders as of now. So we do have a pretty large storage area. So we've been able to accommodate that, and that program started in about June of last year.
And what happens to the firearms that haven't been claimed?
We'll notify the owner, of course, and give them a specified time to come in and pick them up. And if not, then they're disposed of according to law. They're treated as abandoned property. If they're a firearm that needs to be destroyed, then we'll destroy it. If not, it'll be disposed of according to law.
So when she was giving her briefing, she talked about how 2 years and then 60 days, correct? So the protective orders are usually for 2 years, and then they have, after those 2 years, 60 days to claim the weapon. Is that accurate?
Correct. Yes. We'll give them the adequate time. Some of these people may move away, and then we may have to give them a little bit more time. But as long as we're in communication with them, and they say, hey, we'll be back at a certain date, we'll be happy to hold them. Once we don't hear from them anymore, they've been given an opportunity, then we have to dispose of that weapon. But everything is done according to law.
Thank you very much.
Representative Moody.
Thank you. And actually, on the protective order issue, because I think the county attorney, and that was actually a very good explanation on this side of it, about the protocols and procedures and due process involved in that. There's also another part of protective orders, because violating protective orders is a criminal sanction as well. And so I want to get the bookend of that. And Colonel, I'll kind of point this in your direction, because part of the directives, I think, from the governor's office was, we're doing a decent job at getting those protective orders uploaded into what you'd see it in TCIC, NCIC? Right?
TLETs, yes, sir.
Oh, it's TLETs, sorry. So local jurisdiction enters protective order, and in there, and if you haven't seen one of these, when you do these background search, so roadside, you got trooper, sheriff, officer, stop someone at the roadside, they do search on that individual. If they have a protective order effective against them, it's been in the system effectively, and that the provision that says they can't possess firearms is something the judge checked off, that's going to show up for that officer, that trooper, for that sheriff's deputy, right?
Yes, sir, that's correct.
Okay, and so, does that give, at the roadside, that law enforcement official the authority to search the vehicle for weapons?
It'd be one part of determining if there's probable cause to search for weapons. I don't think it in itself would be a justification for a search.
Okay, so I think that's the other piece of it is that we want that information uploaded as quickly as possible, so that when you have these individuals that have gone through these processes and actually have that entered in against them, and they get stopped for whatever it happens to be, that our law enforcement at the scene understands that this person may actually be in violation of another criminal law, which is violating a protective order. What was the exact standard? I can't remember. I don't have it here. What was the exact standard that the governors kind of dictated that we need to ramp up to in terms of getting that information into the system?
I've got Colonel Hearn here, if you don't mind, if I can bring him up to specifically answer that question, so that he's well versed in this and been working this issue. Is that with the permission of the commission?
Good afternoon, Skylar Hearn, Deputy Director, DPS. We may be mixing two different topics, because we started with protective orders, but the directive I think you're referencing is conviction.
Oh, the
data.
convictions, I'm sorry, yeah. So there was a mandate, I apologize. Yeah, there's a mandate in terms of getting that information.
Information in the first year target, what the order says is 7 days, but in the mechanics of how that's going to work, it's really 37 days. Today, there's a 30-day window when a conviction is final, and then there's 30 days to get a final conviction in the system, so that's a 60-day total.
that we have been working off of. And the 7-day directive is taking 23 days off the back end. So the first year will be a 37-day entry on convictions and all dispositions practically. And then year 2, it'll be down to a 35-day for disposition reporting.
Okay, and I apologize, I didn't mean to conflate the two, because we have obviously protective orders, getting them in the system, and then convictions, adjudications, because there's prohibitions on those individuals as well. And so that's something that we need showing up for the deputy, for the officer, for the trooper at the roadside, to be able to assist them to do their job.
The protective order data is there today. What the other directive we have that we're working on that was part of a bill that was passed that didn't get through at the end, but we are working on bond conditions, because similar to the protective order piece, there can be conditions of bond that prohibit possession of a firearm, and that'll be available roadside as well.
So you've got 3 different lanes where this prohibition can be placed on an individual. Information for law enforcement is key to have to be able to enforce those. If you're in violation of a bond, obviously you can forfeit the bond, arrest someone, violation of protective order. If they're on probation and they've got a weapon, they're prohibited, then you can pick them up for that violation as well. So, or you can have that issue. So that information, that's what we want the committee to understand, is there are lots of things that all the tools that we have at our disposal, but if we're not putting them in the system properly, if we're not making sure that the resources are available for local law enforcement to be able to do that, to be able to do it efficiently, effectively, and then not giving our local jurisdictions the tools to be able to enforce those laws, then it's going to be, then we do a lot of work not being able to get the result that we want, which is what I've heard time and time again, is keeping weapons out of the hands of folks that shouldn't have them. And we've made determinations that these people in these conditions shouldn't have them. And so time and again, I've heard people tell me, enforce the laws we have, enforce the laws we have, enforce the laws we have. These are 3 areas that we can absolutely drill down on. And if we're effective in doing that, and we create a construct, then we can start to, you're never going to collect all these, you're never going to stop all these incidents, but you can start to get your arms around it, and you can start making sure these tools work. Because, we've heard the timelines starting, but the tragic incident started at X o'clock. Really and truly, it's days, months, years before that. Those are the things where we need to do a better job, so that when that clock starts for law enforcement that's stepping into a dangerous situation, those are fewer and further between. That's the reality that we need to start moving towards. And so I'll stop there. I want to thank DPS specifically for helping those of us on the ground on August 3rd, providing some clarity with information, with accurate information. It was a very, very chaotic day for everybody. And there was we were able to get information directly from DPS to make sure that we knew what was going on, because it was hard to tell. It was hard to tell what was up or down that morning. And so I want to thank you all, and I want to thank the folks on the ground who helped take what was a terrible day and help move us from there and bring people to safety to the best of their ability.
I've got a couple of questions. Jeff, could you come back up? Please identify yourself again.
Yes, sir. Jeff Williams, Regional Director for Texas DPS.
Okay. You had described in great detail the event at White Settlement.
Yes, sir.
And you talked about statistics about citizen intervention and how that diminished the time of the occurrence, the effects of the occurrence, that sort of thing. We heard testimony this morning from Mr. Burkett, whose mother was wounded, and he was, in his words, looking around for somebody with a gun.
Sure.
A citizen. Now, and there's going to be witnesses that have registered to testify, and I'm sure we have heard from a lot of witnesses throughout the state as to what they perceive to be the answer to this, and that is allowing more weapons, citizens to have more weapons more freely, more available. from your standpoint, what measures can we take, or you would like to see taken, that would encourage trained citizen involvement that would, in your estimation, improve the situation? I mean, help the response? So I'd like your thoughts on that, because you clearly talk about citizen involvement as being an asset and value. And so how do we as a legislature encourage that?
I think the danger in that line of thinking is that just giving the gun to someone is going to be the solution. The response needs to be from someone who's trained with the gun. In the White Settlement case in particular, that church security team had done an outstanding job. It will become a study for the nation to look at. They did a lot of training leading up to that Sunday, both at the range and inside that church. They had talked about it. They'd invested a lot of mental energy in it. These were serious people that didn't just have a gun. They had invested a lot in the well-being of themselves and their fellow parishioners. And so I think the key to that whole conversation about giving more people guns is that the gun needs to be in the hand of someone who's trained and knows how to handle it.
Give me specific, or do you have specific ideas as to how we can encourage that training, broaden the scope of it, help facilitate it?
Sure. I think the civilian response to an active shooter event course, it's a 2-hour course. It's online in some places. You can get we got troopers that are given all over the state. It's free. That gets people thinking about it. We also explain the psychology behind disaster response, not just a man-made disaster, but maybe a tornado or hurricane. The same kind of psychology takes place. There's a lot of research that went into developing that program, and give people the answers to what to do. Sometimes pre-programming the answer will get someone to move instead of just freezing. The idea of avoid, deny, defend. Defend is where the gun comes in. We view that as just part of defending. There's nowhere in that program where we would advocate for someone who happens to have a gun to go hunting for the person. We're still advocating avoid first, deny them access to you if you can do that, and then if you must, defend yourself. This whole line of training gets people thinking about their involvement. In there, we also point out the police response. It's very important for someone who has a gun to know the police are coming with all the enthusiasm they can muster to look for a man with a gun. Our advice is don't be holding a gun when we get there. And I think that gets lost in the conversation where if it's just simply give someone a gun, there's a lack of understanding on the part of the people. And I think this class is directly related to this issue, and it really helps out.
Yeah, I think you're exactly right. The answer is just not indiscriminately giving guns out.
No.
We have to have the requisite training and experience that if the situation arose, then that person would be capable of responding properly. I can't think of anything has more chaos than a bunch of folks pulling out a weapon and indiscriminately and untrained firing in a closed facility like that church.
And sir, to that point, the evidence of that was in that church. There were several people that were armed in that church.
I identified at least 5 that had
it
come
came out of the
forward.
public domain. Obviously, they had trained, because if you notice, they didn't all just indiscriminately fire. They had put some thought into what they should do. And so that's the evidence that that kind of training, you don't have to spend a whole lifetime doing it, but just that kind of mental investiture, it pays off dividends. And it's got to be well thought out.
Well thought out, trained.
Correct.
Able to respond appropriately.
And a complete understanding of what's taking place, not just a view through the soda straw. You got to understand there's a whole bunch of police officers coming, and for you to be standing there with a gun is going to be, it's going to create further problems.
Okay. Members of, Representative Guerin.
Jeff, Mr. Wilson, the man that took the shooter out, he actually said that he had to wait to shoot to clear some of the other congregations so he wasn't gonna hit them. Didn't he tell you that?
He did, yes, sir. Thank you for bringing that up. I should have pointed that out. Obviously demonstrating that he understood about target discrimination. You don't just randomly shoot. You've got to have a clear shot. He had been a longtime shooter, and so he understood that. And so to that point, he did wait and appropriately take the shot.
And it lasted 6 seconds, but it may have only been, if he shot any sooner, he may have taken out one of the congregation and not just the shooter. Thank you. And thank you all for your response. It was a tough day, and I understand what Chairman Moody I share his thoughts because y'all kept everybody in the know, and there was a lot of law enforcement response to this in a neighborhood in the district I represent. That's some of those people don't like to see that many police around.
Representative Gordon Hawkins.
I would like to add, I'm not a gun owner, but I'm not against guns. I think that there's a lot of training and education that needs to go on. One of the great concerns that I would have in terms of arming folks at the church, I believe, again, whether we like it or not, the real story is when law enforcement come into a black church and someone's got a gun, he's not going to be as friendly as other churches. And so somehow, as we look at possibly arming others, we got to think big picture, not just single picture. And so along with training of civilians, there also has to be training of law enforcement, because I'm greatly concerned about that.
Members in question? Thank you, panelists. Appreciate your input. This time, the chair will call the final panel, which is Scott Calderwood, Amy Swearer, Lee Spiller, and Richard Hayes. We'll start with Amy. I think she has a plane to catch, so. Again, for the record, state your name, who you represent. I apologize, but we're gonna have to have you have a microphone and hold the button down. Amy, you may begin when ready.
Sir, just for the record, we don't have to go out of order. I should be just fine, but more than happy to go first if.
Wait, okay, Scott, do you have a plane to catch, or? You just been here all day? I'm sorry. Well, whoever wants to begin, okay?
I've heard ladies first, so, Mr. Chairman, I will begin. Mr. Chairman, members of the committee, Texans, and fellow Americans, my name is Amy Swearer, and I'm a senior legal policy analyst at the Heritage Foundation's Edmeese Center for Legal and Judicial Studies. My primary areas of research include the Second Amendment and firearms-related policy, including the intersection of mental health and gun-related violence. Too often, it seems to me that policymakers seem to think that when it comes to gun-related violence, we're left with two options. Either we take no or minimal action, or we take the most extreme actions possible, regardless of how effective those are going to be or how many constitutional lines they cross. This is a false choice. The reality is that while we will never be able to perfectly predict future violence or intercept every threat to public safety, especially when it comes to more statistically rare events like mass public shootings, we aren't helpless, we aren't hopeless, and we aren't forced to extremes. There are certain common characteristics about perpetrators of mass public violence that leave us with avenues for meaningful intervention, and many of those have already been discussed here on other panels. Most importantly, they leave us with avenues for meaningful intervention that don't preemptively attack the rights, the constitutional rights of Texans who are not and will never be a danger to themselves or to the public. One of these important characteristics about mass public shooters in particular is that they very often tell people about their plans in advance. The Violence Project, which is a project that I would heavily recommend to all of the committee members, especially in light, ma'am, of your earlier comment about what sort of studies are out there about mass public shooters that have looked at this from a purely statistical, data-focused standpoint. The Violence Project recently analyzed over 50 years of data on mass shooters and concluded that almost half of them exhibited some form of leakage about their plans prior to the shooting. This was, in fact, almost a defining characteristic about school shooters. This analysis is consistent with my own research, especially when it comes to school shootings, mass shootings that have been thwarted. That leakage and taking that leakage seriously was one of probably 3 important links in a chain that led to successful intervention and saved lives. What this also tells us is that there's a tremendous opportunity for intervention if we empower Texans who hear these leaked plans to take action. Of course, very rarely do these would-be shooters leak their plans directly to law enforcement officers. No, it's generally to family members, to friends, to members of the community. And those are the individuals who are there to recognize those signs of dangerousness, hear that dangerous intent, and it's important that they understand how important of a role they can play. In other words, it's not just about cooperation and coordination between government agencies, though that is very important. That is another part of that chain link that gets to intervention. But when you take a step back, it's also about cooperation and coordination between civilians and community members and those in positions of authority who can have the authority to act on those threats. What this looks like can vary depending on local circumstances, but I would certainly point out efforts by Utah to essentially crowdsource information about school threats in particular through a free app called Safe UT, which I've provided more information about in my written testimony. Second important common characteristic is the role of untreated serious mental illness and mental instability in general. It has become increasingly controversial to suggest that mental illness has anything to do whatsoever with gun-related violence, and I suspect this is motivated largely because of very legitimate concerns about unfairly demonizing the mentally ill. So let me be very clear. I very much agree with what has been said, especially at the first panel. The vast majority of mentally ill individuals are not and will never become a danger to themselves or others, especially when they are receiving treatment. There are clearly mass shooters who have nothing whatsoever to do with mental illness. You look at right here in El Paso, that individual was not mentally ill. He was motivated by a dangerous and violent ideology. And that is the case with other, what we would consider more generally terroristic shooters. So it's not the case that all mentally ill people are violent, certainly not the case that all mass shooters are mentally ill. But the statistical reality is that almost 2/3 of mass public shooters have clearly exhibited signs of serious mental instability in the days, weeks, and months leading up to their horrific offenses. In fact, while it's often a confluence of events, as panelists talked about, this confluence of many factors, it's very clear that one of those factors often includes mental crisis. Importantly, almost none of these individuals were receiving mental health treatment at the time they committed the shooting. Adopting a mental health centered approach to gun-related violence, so again, not using it predictively to say, we're predicting this person is violent because they're mentally ill, but using it as a preventative kind of first step measure to intercept some of these main factors that end up being this confluence of events, one of which is mental health crisis. This mental health centered preventative approach can serve not only to protect Texans from rare events like mass public shootings, but is likely to have a broad public health benefit that impacts and protects Texans from much more common and widespread types of gun-related violence, particularly suicide. You've all been provided, I believe, with a law review article I've recently published that looks more deeply into what this mental health centered approach looks like. So I would leave that with you. The third important common characteristic among mass shooters is that very, very few of them have criminal or mental health histories that disqualify them from legally purchasing and possessing firearms. And this is often despite the fact that they often exhibit very serious signs of being a danger to themselves or others. So essentially what we find is this phenomenon where many people around this individual recognize that he or she is dangerous to himself or dangerous to others, but this person hasn't yet either committed a felony that would disarm them, or they haven't yet reached a threshold of mental instability that's going to lead to state action, or they are civilly committed or otherwise placed in a position where they can't legally access firearms. This is a very serious problem, and it brings me to perhaps the most contentious and controversial avenue for intervention, and that's filling this gap. Clearly, there are some mass shooters who could have and should have been prevented from possessing firearms under existing laws, but it's also the case that for a significant percentage of these shooters, there was never going to be an instance in which the public was protected under existing laws or through existing criminal justice practices or norms. Because of this, many states have looked to extreme risk protection orders, also known as red flag laws. And to be clear, one of the reasons that so many people have had so many concerns about these laws is that too many of them have been poorly designed and poorly implemented. I share many of these concerns of Second Amendment advocates when it comes to both these laws as they already exist in states that have implemented them, and when it comes to specific bills that have been introduced in Texas. But those concerns do not erase the underlying constitutional and practical legitimacy of saying, look, there are people who are objectively dangerous, who should be nowhere near firearms at the moment, because right now they're very likely to abuse the Second Amendment and harm other people, harm innocent people. That basic idea of intervening before someone is actively committing an atrocity, before someone has actively reached a mental health crisis, that is a good concept. It is a goal worth pursuing, especially for responsible gun owners. You can call it whatever you like. At the end of the day, you can frame it however you want. But this is exactly, Congressman Moody, as you have suggested, this is exactly what Second Amendment advocates have so long rightly called for, to focus on specifically dangerous individuals and not to broadly go after guns or gun owners who are not and will never be dangerous. Of course, we're talking about restricting fundamental rights, and that is a serious issue. This should only be pursued in a way that affords the highest levels of due process and protects against abuse or misuse. For example, definitions of dangerousness should be very narrow and based on objective criteria. This means not casting lawful gun ownership as inherently suspect or allowing for the loss of civil rights because of disfavored, vulgar, or politically incorrect speech. It also means that ex parte orders should be limited to extraordinary circumstances. It should not be the norm that we take guns first and ask questions later. There should also be clear avenues for the restoration of rights, and the law should be integrated with existing mental health and addiction treatment infrastructures to provide resources to people who have been deemed dangerous. The goal should always be to get people back to a place where they're not dangerous, where they can be trusted to not abuse the Second Amendment right. It's not about disarmament for the sake of disarmament, and we should not accept laws that go about it in that manner. And finally, before my time expires, I want to note something that has stuck out to me as unique about several recent mass shootings in this state. Arguably, there have been some missed opportunities for intervention that could have happened if local, state, or federal authorities had better used existing protocols with respect to dangerous people. I think there's some room to learn from what did not happen in these circumstances. Along with the obvious failure of what happened in Sutherland Springs with the military neglecting to forward records to the FBI through the NICS system, it appears there was at least one opportunity to intervene with the Odessa Midland shooter prior to that tragedy. So that individual was a prohibited person, had already failed one background check in 2014 for attempting to buy guns. Now, setting aside questions that I think were actually raised earlier about why he wasn't prosecuted for attempting that purchase as a prohibited person, I'd also note my understanding of Texas law is that that's not a crime in Texas. That is a federal crime, but Texas does not have a criminal prosecution statute for that. So setting that aside, it appears that no action was taken when a neighbor called local police to report this individual had threatened her with a gun just weeks prior to his mass shooting. that raises a lot of questions. Namely, did local police know that the subject of a firearms-related call was a prohibited person? If they did, why was this not followed up on? If they didn't know that, bridging that information gap, that we have a prohibited person who's the subject of a threatening firearms-related call, is a very important step for combating illegal firearms possession. Following up on that information could have saved 7 lives and prevented up to 20 injuries just weeks later. I also point out very quickly that the White Settlement shooter just several weeks ago should still have been in prison in New Jersey if New Jersey had taken his criminal illegal possession of a firearm seriously. So that individual was charged with criminal possession of a firearm in 2016. This is a man with, at the time, with a long history of violence and stretching many states, a long history of mental instability. He was facing serious prison time, but was allowed to plead to a lesser offense. He ends up serving, I believe being sentenced just to time served. Instead of 3 to 5 years, he's released about a year and a half later. He's here in Texas trying to commit a mass shooting, but for the heroic actions of that church security team, that could have been much worse. We have to take illegal possession of firearms seriously, especially when it comes to dangerous people who we know have access to those firearms. I'd like to end by reminding everyone in this room that we're all here because we care deeply about protecting innocent life. So I've been here all day. I was here when Pastor Brady and Mr. Burgett were up here, and I gotta tell you, there was not a dry eye in the room, nor should there have been, because we are on the same team. We might forget that at times, but we are on the same team, children of the same God. Whose hearts break in the same way when we see the types of violence and devastation that are wrought on cities like El Paso. Too often, again, we think we have this false choice between protecting life and respecting the constitutional rights of citizens. The reality is we can do both. We can empower Texans to take action and to speak up about potential threats when they see them, when they know that something is wrong. We can provide more and better mental health resources more and better mental health resources to keep potentially dangerous individuals from reaching crisis points and having immediate access to treatment when they do reach those crisis points. We can focus on targeted interventions with specific dangerous individuals in a constitutionally appropriate manner. We aren't helpless, we aren't hopeless, and we aren't in need of extreme measures. We're just in need of the right ones. And I'd add, I've sat through quite a number of hearings of this type, and I commend and I applaud what I've seen from this committee. The refusal to turn this into a political three-ring circus has been refreshing, and I applaud you for that. I hope the residents of Texas applaud you for that, for the seriousness, the depth of the questions that have been asked, the depth of research. You appear to be very interested in doing exactly this, in saving lives in a meaningful manner, looking at the data, looking at the research, and I applaud you for that. Thank you.
Thank you, Amy, for your testimony and your comments. Scott, you're up.
Thank you, Chairman Darby and committee members. My name is Scott Calderwood. I'm the director for the El Paso County 911 District. I am a former, or actually retired fire deputy chief, City of El Paso. I did over 25 years there, and I'm also a former emergency management coordinator for the City and County of El Paso. So during our shooting event, as you can imagine, 911 was pretty chaotic in the initial, during the initial event. We often take 911 for granted. We refer to dispatchers and people in 911 as the first responders. And in reality, response starts when somebody makes a call to 911. In El Paso, the district provides support for 38 entities within the county of El Paso. And we also provide a facility. That's the facility where the Emergency Operations Center and the Fusion Center and the Dispatch Center are housed. I am happy to report that during our initial response, our systems didn't fail. Our systems were taxed well beyond their capacity. There were more phone calls than there were lines and technology to take. There were more phone calls than there were people available to answer, but they pushed through as well as they could. We processed more than 3 times the normal call volume on that day, and there were more calls that came in than our systems could even record, so we really don't know how many people were actually trying to call. And that call volume continued for 3 hours following conclusion of the incident. And I've got to commend the 911 community, and when I say community, I'm talking about all of the agencies that control their own 911 centers, but they were able to effectively double the capacity of call takers from, El Paso runs normally about 10 call takers, and that satisfies what we need on a regular basis, but within 45 minutes, they had doubled the capacity to 19 call takers. Our facility performed as designed. So one of the unique things that El Paso has is all of our public safety entities in El Paso use the same systems. We use the same phone systems for all 38 entities. All of the response agencies use the same, all the local agencies use the same computer-aided dispatch systems, and that is unique in Texas. We are the only large county that has that kind of interoperability, and that interoperability was really critical during that incident. It's critical to get as many law enforcement people responding in a mass shooting as possible, and that usually requires mutual aid and multi-jurisdictional response. And our unique systems here in El Paso are kind of maybe a lesson learned for making that response quick. We have a computer-aided dispatch system, and when we want to get other local agencies responding, it doesn't take a phone call. They don't have to repeat information. They can simply push a button and get all of the data transferred. That's where 911 needs to concentrate on going in the future. We need to have more interoperable systems among people, and El Paso is proud to kind of be, pushing the envelope on that. Also unique to El Paso is our facility. Our dispatch center actually houses the Emergency Operations Center, and several of our local representatives here will remember spending days and hours and days in our facility. That's where the EOC is, but we also have the Fusion Center in there. That's also something that's very unique to El Paso, the co-location of all of those intelligence gathering entities, and I believe that's unique to El Paso to have that happening in our jurisdiction. This incident certainly tested that, and I think it justified that sort of thing. That's another kind of a lesson learned that we might share for things that we did well. We did have some issues with location. When people start dialing 911 in a panic situation, they don't always know where they are. There were several people that were at that incident that live in Mexico. They may not be familiar with where they are. And so as a result of that, we ended up getting multiple sites reported for that one particular incident. And each one of those sites.
But if I might impose Would you pull that microphone just a little bit closer to you? You're kind of soft-spoken, but we want to make sure this is picked up for those listening.
Is that better? Okay. So, so what we ended up with was we ended up really with 3 reports of a location for this incident, and each one of those incidents required a major response, and it tasks all of the law enforcement and all of our first responder capability to respond to 3 simultaneous incidents. And at one point we thought we had 3 shooters, but in reality we just had a lack of location. There are some technologies available in that are next generation 911 technologies that may help with that. We are, El Paso as a region is trying to bring in some of the next generation technologies. They are very costly, but they would help us build real-time heat maps for where the calls are coming from, and could potentially help with that. Those next generation 911 technologies are, like I mentioned, they're very costly. There's many smaller jurisdictions in Texas that right now can't afford to bring in next generation 911 technologies. And so they're going to come to you as a legislative body to address funding. In this legislative session, we have some of the lowest wireless rates in the nation at 50 cents per. I think that's the area that they're going to target, perhaps addressing that to allow everybody the funding necessary to bring these technologies into their communities, because regardless of the size of the communities, those technologies would be beneficial. Another thing we're doing as kind of a result of this is we've opened conversations with the police department to talk about suspicious activity reporting at the dispatcher level. If we can capture some of the calls that come in, if we can capture some of the data and at the dispatcher level flag that call and transfer it directly to a police officer or a fusion center, it might catch 1 or 2 of the calls that fall through the cracks right now. As it stands right now in our jurisdiction, it's incumbent upon officers in the field or working these calls to do the reporting, and there is a potential to bring in some sort of indicators that could pick up on certain calls and flag those calls for direct transmission into your state reporting system. But the points that we wanted to make were that our 911 systems actually performed very well. We have a few unique systems here. We have common systems that lend to interoperability, which is something that is a possible model, and we have a facility that lends itself to a model for local control, also with co-location. And we can improve some of our response capabilities by bringing in next generation technologies, and we're taking a look at what we can do at the dispatch level for reporting.
Thank you, Scott. Lee, I think you're next.
Good afternoon. My name is Lee Spiller. I'm the Executive Director of the Citizens Commission on Human Rights, Texas. You guys are doing a great job. I've really been impressed by how well y'all work together, the intelligence of the questions you ask, and the real attention to this, and I really appreciate that. I really appreciate the opportunity to testify. For us, this is not a gun issue. This is a rights issue. And when we start talking about predicting dangerousness, when we start talking about is it the mentally ill or is it not the mentally ill, the hackles on the back of our necks stand up. Existing protocols, when they work extremely well. Right around the time of the El Paso shooting and the Odessa shooting, there was 2 cases, one in the Lubbock area, one in the DFW area, where relatives were concerned about their loved ones' behavior, and 2 potential mass shootings were thwarted, right? So it can work. I think, it works when vigilant people speak up. And I think that's something always to keep in mind. How can we encourage people to speak up? When we get away from that, we're getting into prediction, right? And time after time after time, when we try to predict future dangerousness, we get it wrong. It's not consistent. In preparing for this testimony, I looked at a number of documents and studies. I looked at violence predictions back to about 65, not all of them, but a selection, right? And it was amazing just how bad we do at this sometimes, right? And I'm reminded of a quote from the American Psychiatric Association, and what they said was that for the foreseeable future, no technique will be available to identify those who will act violently that will not simultaneously identify a large number of people who would not. So no matter what we do moving forward, there has got to be a rights component to this, right? We wouldn't dream of arresting somebody to prevent a crime. We don't do that, right? In general. In the mental health world, it's almost always a preventive detention. We think they're going to become dangerous, right? And because of that, we really should have heightened rights, and we should get them out of the system as fast as we can. But here's something ironic. If you were arrested today without a warrant, you would have to be brought in front of a magistrate to be warned as soon as possible, not to exceed 48 hours. If you were detained today, what's today, Thursday? Yeah. So if you were detained today for mental illness, you would have, your potential detention period is 48 hours, but oops, that 48 hours ends over the weekend. So now, you've got to wait the weekend out before they have to decide whether or not to file an order of protective custody. Then another 72 hours before a judge has to decide whether there's probable cause, right? Lately, like the past several years, these are the cases that we get. People who walked into psych hospitals and got held against their will. And on average, this is a guesstimate, but I would say on average, they're kept about 5 days. And I want to think about that. What if you are having trouble? What if you are in crisis? You're coping with it, but you're in crisis. So you walk in to ask about some counseling. The door gets locked behind you. It's the first of the month, your rent's due, but now you're gone for 5 days. You drove down there, now your car's in impound. Boom, that's gone. You've missed work. You could potentially end up jobless, homeless, without transportation, and in real crisis, just for lack of speedy due process. All right? This is a very real possibility. And that's just one aspect of rights that's problematic. We just can't guess. And also in preparing for this testimony, I looked. My attention was initially drawn to the white settlement gunman. It was recent, and the media were doing a really good job of timelining his history. And yeah, I have a question on should this guy have been in prison, right? But what caught my eye was, okay, this is a guy who apparently had some mental health contact. He had been found incompetent to stand trial and committed. But he also had a history of being charged with felonies, and those felonies being charged with misdemeanors. And I worry that sometimes when we look at mentally ill defendants, we go, well, look, we don't want to hurt them. We want to treat them, right? We all want to help people. But in the case of violent crime, the question is, if you shunted somebody to the mental health system, A, would you assume that the mental health system's got it when maybe they don't? Often they don't. B, are you depriving yourself of a future opportunity to be able to prosecute under felon in possession of a firearm should you need to?
right? And in the case of this shooter, yeah, when he got picked up in New Jersey, had he had that previous felony, that could have been done. And I think the average sentence for a felon in possession of firearm in 2018 was around 64 months. You know, we really have to look, okay, how does the existing law apply on that? And what do we do with people who actually are violent? Drug use. One of the earlier witnesses testified to only a few shootings where the person was under the influence of a drug. We collect media, we collect autopsy reports when we can. It's more than a few. But the 4 cases that really struck out, again, both for simultaneous criminal involvement and mental health system involvement, and in 2 cases, specifically drug use and specifically benzodiazepine drugs. These are your Valium, Xanax, that type of drug. Devin Patrick Kelly had quite a history of violence. And on autopsy, it was found that there were indications of Xanax. There was also the presence of another benzodiazepine. If you look at the drug label for Xanax, they point out that as with all benzodiazepines, paradoxical reactions such as stimulation, increased muscle spasticity, sleep disturbances, hallucinations, and other adverse behavioral effects such as agitation, rage, irritability, aggressive behavior, have been reported rarely. Okay, fine, rarely. They've been reported, right? Isolated published reports involving small numbers of patients have suggested that patients who have borderline personality disorder, a history of violence or aggressive behavior or alcohol or substance abuse may be at risk for such events, right? Turn to Nicholas Cruz. Let me turn to Nicholas Cruz. Between the time Cruz was 3 years old and the time he was 19 years old, there were 69 documented incidents where Cruz threatened someone, engaged in violence, or talked about guns or other weapons, or engaged in other concerning behavior. Prior to the February 14th shooting, the Broward County Sheriff's Department had 43 contacts with Cruz's family, 21 involving Nicholas, or both Nicholas and his brother. Over a 9-year period, Cruz regularly received hundreds of hours of therapy sessions from Henderson County Behavioral Health. Moreover, Cruz received additional educational services and behavioral health care from multiple providers, right? We don't get to know the specifics of that. We don't get to know whether he was on meds, but when he was being interrogated, he admitted to using Xanax recreationally. According to that same commission report, in about 5 days prior to the shooting, he searched homicidal ideation treatment for homicidal ideation, right? And I'm not saying this to point the finger at people who use medication. They're doing what they are trying to do to get help. But what I'm saying is this is an issue that needs to be explored. My biggest ask today, right, you guys have done a great job, but the truth is this is a big, complex issue. It's more than can be done in a series of roundtables or interim studies, and y'all are doing a great job, but we need more. What we really need is a task force. And it needs to be very carefully designed, very diverse, so that you've got rights representation, plus industry knowledge, plus, you know, the variety of interests involved in this, right? Frankly, if it was me, the way I would design it, it would have to be consensus-based. That way, no one group is so big that they get to run the show. You either have consensus or you don't do it, right? But a task force could explore, okay, what is the link up? How often are drugs a factor, you know? Not whether we like them or don't like them, but prevalence, presence, absence, or recent discontinuation. And not specializing in psychotropic drugs, but any mind-altering drug, right? All of them, whether it's psychotropic, whether it's prescription, whether it's something that you get high with, If it is a mind-altering drug, it affects mood, cognition, and behavior. Why not study it? Nobody else has done it. The Secret Service reports do a great job of looking at correlations to mass violence, except for one area. They never explore that one. We might as well look at it. We should look at the linkage between law enforcement or the criminal system and the mental health system. Are we dropping the ball? You know, you name it. There's all sorts of factors we could look at. We could also look at, again, back to how to improve rights. I just wanted to give you guys some example. Right now, today, if you're detained for mental health care, that peace officer does not have to read you your Miranda rights. All he has to tell you, he can question you, he can talk to you all day long, but he doesn't have to tell you that what you say can be used against you. He has to tell you that you will be informed at the hospital as to what your rights are. And then at the hospital, you have 12 hours to be assessed by a medical professional. Only at the 24th hour do they have to tell you, oh, guess what? Anything you say, we could use to commit you. That's wrong. That is completely out of order. I've already talked about how long people are kept, right? It just amazes me that we're keeping people accused of being sick, needing help, longer without access to a court than we are criminal defendants. We can do something about that. The right to cross-examine witnesses is not guaranteed, right? The patient or the patient's attorney can waive that right. If it was the patient and the patient's attorney, we'd be going, okay, fine. That's the exercise of a right. But if it can happen independently, then there's always that possibility that your right gets waived. And I know you got to jump through hoops to do that, but there's really not much of a remedy if you're that patient. What are you going to do? File a bar grievance? Who are they going to listen to? The attorney or the guy who's accused of not being in his right mind? You know, it's really sad. I watched the criminal prosecution of a psychiatrist who was accused of molesting his patients a couple of years ago. And a good bit of the defense was simply looking at the patient's diagnoses and then presenting them as a stereotype. Oh, we could expect somebody with bipolar disorder to blah, 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 blah for a while. Then the prosecutor would go, well, did you see evidence of that in the patient's record? And the expert would go, no. And then they would go on to the next case. But the point is, it is easy to accuse, but people who are under mental distress or have a problem are not always the easiest people to get their stories heard and to get their stories believed. So we have an inherent risk that's higher than the risk to you, me, just an average person. And we have got to, no matter what we do, there has got to be some commensurate rights protection that goes along with it. Otherwise, we're going to get people hurt. Because there's no doubt, if we go into predicting violence, we're going to get it wrong. And when we get it wrong, those people deserve protection. Thank you.
Thank you, Lee. Next, Richard Hayes. Richard, welcome.
Thank you, Chairman Darby and honorable representatives. My name is Richard Hayes. I'm testifying on behalf of myself. I'm an attorney and partner with the law firm of Walker & Taylor in Houston, Texas. I'm a former prosecutor and independent program attorney for Texas Law Shield. Texas Law Shield has approximately 200,000 members in the state of Texas, the vast majority of which hold a Texas license to carry a handgun. I have dedicated my practice to firearms law education, protecting the civil right of self-preservation and the Second Amendment. First and foremost, I want to thank you for the invitation and opportunity to speak with you all today. And I want to thank you for having the sober task of working to prevent mass violence. Understandably, the people of our great state grieve when tragedies of mass violence occur, as happened in El Paso and Midland, Odessa in August of 2019. Those should not be ignored. My community of Galveston County, my home county, experienced its own tragedy in May 2018 in Santa Fe High School, where we lost 10 innocent lives. After such an event, people are often left to wonder, were there signs? How did this monster live among us? And what could we have done to prevent this? Another common statement that's usually accompanied by this is there should be a law. As tempting as it may be to apply a legislative salve to each fresh wound, a new law that targets and burdens gun owners is not the answer. Rather, there exists current legislation that could be acted on now, both in the Texas Penal Code and the Health and Safety Code. In the Health and Safety Code, for example, there's already provisions for the seizure of firearms for dangerous persons suspected of having mental illness in the absence of a criminal charge. So the tools exist. As this committee knows, criminals do not follow the law. By contrast, license to carry holders are one of the most law-abiding demographics in our state. Data collected by the DPS shows them committing crime at approximately 1/5 the rate of Texas peace officers, another very law-abiding demographic. As of December 31st, 2018, this is the latest number that we have available, there are 1,362,945 licensed to carry holders. In my practice, I have seen Texans repeatedly save their lives and the lives of others, thanks in part to the concealed handgun, now licensed to carry law, that went into effect January 1st, 1996. Many of these defensive gun uses are not available in any statistical data because a crime was stopped before it was committed. For the year 2019, my firm consulted on over 400 emergencies, typically following a critical incident involving self-defense or defense of others for both civilians and law enforcement. During that same period, we received 7,412 calls from gun owners asking about how to comply with state and federal gun laws, or to report a defensive incident after it had already taken place. But I have to stop and emphasize that these people really want to do the right thing and follow the law. That's not to say there isn't room for improvement, but the imposition of new laws on those who already spend considerable effort to comply is not my recommendation for this committee. Texas law currently contains many provisions in the Code of Criminal Procedure, the Family Code, Health and Safety Code, and Penal Code that can be utilized to prevent and stop destructive behavior. Further, these avenues are protective of due process rights as they are administered through the criminal justice system. Just for way of example, the Texas Penal Code under harassment law prohibits 7 different types of conduct. The terroristic threat law prohibits 6 different types of threats. The disorderly conduct law prohibits 11 different acts. And further, as a catch-all, Texas Penal Code section 38.15, that's interference with public duties, allows a police officer to arrest anyone who, with criminal negligence, that's our lowest level of mental culpability, interrupts, disrupts, impedes, or interferes with a police officer in the discharge of any official duty. In my experience, I've seen this utilized to arrest many individuals who were involved in disruptive but not otherwise criminal activity. To make an arrest, police must meet the standard of probable cause. However, I've heard some say that this threshold is too high, leaving those in law enforcement with insufficient tools. I will quickly review the different legal standards of proof leading up to and including probable cause, just by way of example. At the very bottom, we have no evidence, which is no measurable or trace of evidence whatsoever. Next, we have a scintilla, which is the smallest trace of evidence, including evidence that's contradicted or not credible. After that, we have reasonable suspicion, which is suspicion based on specific or particular facts, not a hunch or a guess. This is the standard that the police officers need to detain someone temporarily. You see that with traffic stops. But it's not enough for them to make an arrest. And that leads us to probable cause, which is suspicion based on reasonable and trustworthy information that a particular person has committed or has taken some action that's more than mere preparation to commit a particular crime. As previously stated, this is the standard the police need to make an arrest. This standard of probable cause is intended to ensure the most basic and fundamental due process rights are preserved, and I would exercise extreme caution when attempting to apply any lower standard. With that said, there are protocols in place that could be used, that are rarely used by law enforcement, that could be implemented today under the standard of reasonable suspicion. These are for situations where the police don't have probable cause to arrest, for individuals who are suspected of being dangerous to themselves or others and have to be restrained immediately. Texas Health and Safety Code, Chapter 573, only requires a law enforcement officer have a reasonable belief that a suspect has a mental illness, and due to that mental illness is a substantial danger to themselves or any other person, unless immediately restrained, and there's not sufficient time to obtain a warrant. So we already have a law in the book. This longstanding law not only provides for the police apprehension of persons who are believed to be a danger to themselves or others, but also provides for the seizure of their firearms. Included under this law is a physician's examination. We've spoken about that briefly. At this examination, they could either be admitted into the facility, in which case they would be rendered not lawfully allowed to possess firearms or ammunition under federal law, or they're released. That's why if new legislation that is not about, if it's not about criminal behavior and it does not address mental health issues, then it defies common sense and should not be supported. Any legislation that would deprive someone of their Second Amendment rights in the absence of being convicted of a crime or being found mentally incompetent should be opposed. As we already have 2 judicially approved processes for these matters that are protective of individual due process rights. My recommendation for this committee is to review existing solutions which may be acted upon immediately. This is accomplished by enforcing criminal laws we have on the books and educating our law enforcement officers about Texas Health and Safety Code, Chapter 573. I'm friends with many prosecutors. I've spoken to many police officers. Many are wholly unaware of that provision of law, and that would be my recommendation. Educate them on Chapter 573. Again, I want to thank this committee for inviting me to come and speak with you today, and I look forward to working for the benefit of all Texans. Thank you.
Thank you, Richard. Members, any questions? Jill. Representative Capriglione.
Okay, thank you, Mr. Chairman. I guess I want to start with a couple of things that Ms. Swearer and Mr. Spellers both spoke about, which is related to whether you want to call it bridging the information gap or multi-assessment or multi-point risk assessment teams or whatever. And for me, that causes quite a bit of concern, right? When we start to, and we being the government, start to collect information on individuals and then try to determine potential risk in an individual and then therefore act before anything has actually happened, right? This obviously sets up a lot of concern. And for me, when we listen to some of the other folks before talk about this, they talked about, well, what if someone buys a gun, then they're not on the list, but what if someone buys 5 guns, then they might be on the list. And I've worked on other legislation in the past, for instance, on things like license plate readers, right? We have license plate readers pretty much everywhere here in Texas now. And so it's relatively easy to see where people are going or where they've been and so on. And so you start to wonder what is going to be considered a risky thing. Is it risky, for instance, for you to drive to the gun range? Is it risky for you to go to a mosque, right? What are going to be the risk profiles that are entered into here? And so for me, there's a few different points. One is how private is this information? We talked about confidentiality agreements. Agreements are probably only as strong as the piece of paper that they're written on, right? And so when law enforcement has this information, who are they allowed to share it with? How do we know that it's secure while they're holding on to it? Is this information even accurate, right? So let's say Cesar, nice guy, but decides he has a problem with me and says something that I was somewhere, I was doing something. Do I, as an individual, have the opportunity to review this information and correct this information? Because if not, what happens when it is used? Okay, what happens when I'm pulled over and there's stuff on there that I didn't know? And by the way, there is, for almost everybody, some information when you're pulled over. And I guess also, I know I'm asking a lot of questions, but I just want to get your opinions, because for me, I'm not even sure this works, right? Other than in China and Russia, where is this being used? And is it effective in either other states or in other places? So I don't know.
Sure.
Yeah, when I first saw that model being brought up, or first saw the executive orders on it, I called our international office to find out if they'd ever heard anything about it. And what they heard, or what they saw, was in the UK, you had the Fixated Threat Assessment Center, which dealt with people who were fixated on the royals or the prime minister, you know, folks like that. And one of the controversies about it was that you basically had a mental health team that decided who went. You know, boom, you're gone. And then nobody could get the name of the hospital. And apparently the term in there, or at least at the time when they wrote this, was indeterminate. And so, you know, as this rolled out, then reporters started asking questions, and there was a lot of controversy because they couldn't get answers. So, yeah, I mean, there's potential for it to be misused. We have a hard enough time in mental health because of not having an open court system. You know, I was reminded of this when we were trying to find data on the Odessa shooter, right? We go up to the Waco area and we're pulling jail records, court records, and I'm standing at the records window. To the left of the records window is a sheaf of documents. Those are arrest cover sheets or affidavits, what do they call them, right? And for the crimes, you've got the name of the alleged perpetrator, names of victims, witnesses, and you look through there's some pretty heinous crimes there, and then you get to a mental health transport, right? And it's got a cause number and mental health transport. You don't know who, you don't know the disposition, we don't know how many times a year. If you have open courts, and that's just one document, what about the court orders themselves? What about the quality of the information that's going on that affidavit that's being used to commit that person? Right? We've been hearing an awful lot about telemedicine, you know, like people going into psych hospitals and basically being okay to be admitted by somebody they've never met. Boom, boom. And that's scary to us, particularly in a system with no open records. I don't know the fix for that because that is, you know, those are embarrassing records. You know, where do you draw that line? I don't know. But the fact that we don't have the protection of open courts, I believe, poses a lot bigger risk than it would otherwise. We can't see if it's being misused. Thanks.
Representative, thank you for your question. There were a couple aspects there that I want to respond to. So first, let me be very clear. When I say information, bridging that gap, I'm in no way insinuating that I think the government should be collecting information on, you know, possible threats. You know, did you go to a mosque? Did you do this thing that we think is sketchy? In that specific instance, what I was referring to was an individual who was legally and absolutely clearly prohibited from possessing firearms under state and federal law. And when we're talking about, you know, a firearms specific related call, that type of information, just as it would be useful to, you know, does this person have an active warrant? You know, knowing whether this person who we're getting a specific firearms related call about is a prohibited person, that's an important aspect to know because it certainly can change the tenor of how law enforcement officers, you know, might take that seriously. We have a dangerous, prohibited individual who's going around threatening people with guns. According to this, we have to take it seriously. So that's what I mean by that. I'm not in favor of some government database of, you know, sketchy things you or I have done this past year, and the government trying to figure it out, you know, from the back. With respect to I want to make sure I answer all parts of that question there. With respect to open court records, I would have to disagree. I think part of the reason we want closed mental health records, and for the same reasons we want, you know, HIPAA to be strong, to have strong protections. Mental illness, mental health issues are not inherently related to violence in the way that being a prohibited person under the laws is related to violence. You know, there is I think a right, and it is right for us to protect privacy in that way with mental health records in a way that, you know, is much less relevant when we're dealing with people who have committed patterns of violence. And so finally, that's what I'd like to focus on when we're talking about sort of indications of violence. So again, in no respect do any of us want the government keeping records of sketchiness or looking at sort of vague, subjective indications of violence. To me, what it really comes down to is that pattern of violent behavior. So, not necessarily saying, okay, this person shot their mouth off one time and, picked up a misdemeanor in college or got into a bar fight. But looking for those patterns of violent behavior, because that's often what we're seeing in these scenarios are people who keep sort of falling under that threshold of not getting convicted of a felony, maybe racking up a bunch of arrests and then, sort of pleading down to them or having them drop for other reasons. But that pattern, regardless of whether mental illness is part of that confluence of that pattern is what is important, because that is an objective thing that we can focus on.
Representative Governor Huckins.
Mr. Hayes, I just wanted to get clear. You were talking about chapter 573 of the
The Health and Safety Code.
Health and Safety Code.
Yes, ma'am.
Is it your belief that right now, because you were saying that law enforcement don't know a lot about it, is an area we should be reviewing, is the training that law enforcement officers currently have so they can be brought up to date with some of the new things that are occurring?
I think that's a perfect categorization of it. I've spoken to police officers and prosecutors all over the state, and it is just shocking how few of them know about that provision.
So you believe reviewing law enforcement training could be one of the strategies?
Absolutely.
Thank you, panel. Appreciate one more question.
I don't have a question. I appreciate it. I just, aside from your testimony, Amy, I just wanted to thank you for your empathy. I think one of the most meaningful ways that those of us here in El Paso were able to move through this was having other people understand how hard it was. Many of those people are on this panel, and I was returning messages all that night, and it felt, while it was hard, it felt good to know that that was something that people felt as well. And so I want to say thank you for that. That means a lot.
And Lee, to your comment, there are quite a few intelligent people up here, with few exceptions. Thank.
Yeah, I just want to say thank y'all again. This is a big thing, and again, I would really, really recommend a task force. Would love to be on one, but why not? We've got a maternal mortality task force. We've got child fatality review committees. Why not?
Thank you again for your testimony. This time, we're going to call Commissioner David Scott. David Stout, I'm sorry. Apologize, we missed you on the direct panels. Then for those gathered, we will begin public testimony after Mr. Stout's testimony.
Hold it down. All right. Thank you, Chair Darby and members of the committee. My name is David Stout. I am the county commissioner that represents the area in which the attack on August 3rd occurred. I'd first like to thank you all very much for taking the time out of your busy schedules to be here in El Paso with us. Especially thanks to our local delegation. I've seen all 5 members of the House and our senator here as well. And I appreciate you all visiting our grieving community. It's been more than 5 months since this atrocious act occurred, but the pain is still very real. We're still trying to pick up the pieces I think that you've heard all throughout the testimonies today to move forward. This was a racially motivated attack and an attack on our people here in El Paso. But I'm here to talk to you this afternoon about how this event is going to affect El Paso County and its taxpayers for years to come, and to ask you all for your assistance. El Paso, you may know, is a tax-poor community. Residential taxpayers bear 65% of the property tax burden, and we have an average home value of $135,000. That means El Paso County only leverages about $4 million for every penny assessed in ad valorem taxes. Since the shooting, we have already spent hundreds of thousands of dollars on emergency costs related to the incident, as well as costs like overtime, travel, and of course, holding the suspect in our jail. We're in a very unique situation, as you all know, because the hateful man who murdered 22 people and injured dozen more is still alive and will go through a judicial process for which El Paso County and its taxpayers are going to be responsible. We expect that the venue for the suspect's trial will not be in El Paso, which will make the process even more costly. Our Council of Judges has estimated that their costs, the costs that they will incur, will be at least $1.5 million for this case. Meanwhile, the district attorney expects that the prosecutorial costs are going to be in the same range, and we have yet to understand how much the defense is going to cost, but we also have to provide the defense for him because he has been deemed indigent. But we expect it to be an equally large sum. And so these costs are going to include travel and accommodation for the judges, attorneys, staff, jurors, witnesses, as well as transportation of evidence that will be presented during the trial. We have continued to take care of victims here in El Paso through the amazing work undertaken by the different foundations and created our One Fund. We've had millions of dollars that have been raised, but that surely is still not going to be enough. We know it's going to cost hundreds of thousands of dollars in county funds to help victims and their families gain access to those funds through our district attorney's office Victim Assistant Coordinators Project. In addition, the community is creating what we call the El Paso United Family Resiliency Center, which is going to be based in a county facility, and where we plan to offer services to those in our community, to the community as a whole, that was affected by what happened here on August 3rd. The healing process after something like this can take many years, and we feel like we need to be able to provide services going many years into the future. And we're looking at a price tag of at least $5 to $6 million probably with that. We want to make sure that we can also take care of our own employees by providing therapy and trauma counseling, our first responders, our sheriff's department. A lot of times we don't hear about our medical examiner, but our medical examiner's office registered the crime scene and did the autopsies on the 22 deceased victims. And we want to be able to take care of them and others affected by the incident. We have and will continue to apply for as many grants as we possibly can to help cover all the costs, but there's no guarantee, first of all, that we receive the grants, and even if we receive them all, it's really not going to be enough. In addition, there are many Mexican nationals who do not reside in Texas. They were here shopping at our Walmart, spending their money in our community, helping our economy, and some of them lost their lives and were victims at the shooting. And those individuals are not eligible for a lot of the state funding, like VOCA funding that is available to the other crime victims. And I really worry about how we are going to be able to provide them with the same level of assistance, because I feel that they are just as deserving as the folks who are residents of Texas. So in addition to changing laws regarding the hateful crimes like this perpetrated with firearms, we really ask that you look at ways that you may be able to provide us financial assistance so that this community can heal and does not continue to be victimized over and over by not receiving services and resources that are necessary or having to pay for increased taxes in order to receive them. So I really appreciate y'all giving me the opportunity to speak today.
Thank you, Commissioner. Members, any questions? Thank you for your testimony. I think you pointed out a very relevant issue. These crimes carry a lot of consequences. There are ripple effects on down the line, far beyond the human toll, but there are financial considerations in the prosecution of those individuals and the care for those that remain. So thank you. Oh, I'm sorry, Representative Gonzalez.
I didn't realize I had a question until you started talking. Commissioner, so you're talking about a lot of costs of the county, some of the things I hadn't even thought about. Obviously, you set your budget ahead of time. How have you been able to fund the resources? Have you had that cut from certain places? What will be the impact to the people of the county?
So this This budget cycle, we set aside $500,000 to start off with, knowing that the trial probably won't start until probably the end of this fiscal year, and it's probably going to last a number of years. And if you add up all the costs that I just mentioned, it's $6 to $8 million at least. And with the ensuing revenue cap that will be applied to counties in the next fiscal year, we're very worried and cognizant about the amount of money that we're going to be spending on this trial, because even if you divide it up into 3 years, if it's $8 million, that eats up close to a half of what that cap would allow us, because we can only generate about $6 million from this year to the next year, getting up to that cap. And we of course have a lot of other resources, a lot of other things we need to spend our resources on.
It is not a cap, it's just a threshold for taxpayer approval, revenue increase.
So, does that answer your question? Yeah, thank you.
Any questions? Thank you, Commissioner.
Thank you very much.
We're going to begin public testimony. I'm going to, as a reminder, House rules require all witnesses to complete a witness affirmation form. If you plan to testify, please complete a form and hand it to committee staff when done. Those who wish to testify on or more than one duty must complete a separate witness affirmation form for each specific duty. In order to make sure everyone has a chance to speak, testimony will be limited to 3 minutes per person, regardless of how many duties on which you register. Let me say this, that according to the witness affirmation forms we have, there are about 16 folks or 18 folks. We normally try to limit the testimony, but if you've got something to say, we want to hear it. And but if you're simply repeating something somebody else has said, spare us that duplication. But having said that, we'll have a timer, but we want you to tell us what you want to tell us. So we will call you up in 2 panels. Please be ready to go when you hear your name called. The first 4 will come up to the panel table, and then the next 4 will sit in the row behind them. And then I will call successive panels. Right now we have 5 panels. Before you begin your testimony, make sure you state your name for the record and let us know if you are representing yourself or anyone else. Lastly, and most importantly, I want to remind everyone to be respectful of the opinion of others and be mindful of the emotional nature of these topics. Again, harassing or aggressive witnesses will not be tolerated. And with that, I will call the first panel. The chair will call Randall French, Catherine Revtek, Laura Lopez, and Marcella Rangel. That would be on the first panel. The second panel will be Chris Yost, Kenneth Kruger, Maria Gordon, and Ruth York. So with that, we'll have Mr. French, Revtek, Lopez, and Rangel. So please be seated. Let's see here. I've got Mr. French, I know, and then, are you Ms. Lopez? Okay. Is there Catherine Revtek? Okay, Marcella Rangel. We're going to show them registering but not testifying. So we'll begin the testimony. Mr. French, you're welcome to proceed. Sorry to repeat it. We're having to press the microphone and keep it on while you testify.
I'm just a half-smart country boy from Iowa, learning the ways. Thank you. Before I begin, I want to call out Representative Mary Gonzalez. I don't know if she recognizes my name, but that's irrelevant. From the bottom, and she does, from the bottom of my heart and from the bottom of Usil and Cynthia Flores and their 4 boys, we want to thank you for your involvement in their tragic fire that happened Wednesday, September 25th this last year. And your contribution to help them rebuild is not unnoticed. And thank you. We appreciate it. I wish every elected representative that we contacted would respond in the manner that you did. So,
Okay, Mr. French, for the record, please state your name and who you represent, okay?
my name is Randall Joseph French, Sergeant First Class, United States Army, Military Police, retired. Today, I'd like to talk to you all a little bit about the safety issues we're facing with violence. I don't want to say gun violence because violence is violence. And I want to talk to you from the perspective of somebody who suffers from post-traumatic stress. And that's listed in DSM-5, as you probably well know. But what's not listed in DSM-5 is hate. And that's the problem we have. It's not guns, it's not knives, it's hate. How do we do anything to prevent that? Well, from a sociologist's point of view, and I have a degree in sociology, so I can say that, it's going to be a problem that has to be dealt with at all levels. Community level, federal level, but most importantly from the family level. And as my experience in law enforcement, 21 years experience in law enforcement, I see the majority of the people, especially juveniles, that we've had to apprehend, 90% of them, give or take, didn't have parental involvement. How do we fix that? I don't have an answer. I'm sure a lot of the psychiatrists that were here today doesn't have an answer. But we need to take a look at it and address it, because these people eventually get their hands on weapons, and not just guns, but weapons, and commit mass violence. I don't know what to do. You guys have an arduous job that, to me, would be virtually impossible. But one of the jobs that we need to look out for is for everybody who follows the law. And that's people like me and a lot of other people who support the Second Amendment and support privacy issues, mental health issues, HIPAA and stuff. It makes it hard because you owe us just as much support as we owe the people who've lost their lives to gun violence and to family violence and to just plain violence in general. As a person who suffers from PTS, I carry a stigma. I'm military, so automatically people think, oh, he's a military man with PTS. He's gone crazy on the combat field, and you know, we can't trust him. Well, I've never been to combat. Came close, not officially. My PTSD results from running into a burning building and saving people and working many traffic accidents with fatalities and watching the horrific child abuse and violence that happened both here in the United States and around the world where I was stationed. Unfortunately, I have to live with that stigma. I have a license to carry a concealed weapon under the Law Enforcement Safety Act. For those of you who don't know what it is, I'm sure you probably do, it's LEOSA. I went ahead and tried to apply here in Texas to get a license to carry, and I was denied. Not because of PTS, but I was denied because I self-admitted on the form that 6,309 days ago, I quit drinking because I considered myself an alcoholic. So I was at that time refused and told that I needed to get a letter from a psychiatrist, and the Veterans Administration don't give letters like that. And I would have to go to a psychiatrist, and I don't know too many psychiatrists that would see me only once and give me a letter and say, yeah, you know, he's cured of drinking. So I just chose not to pursue it because I wasn't going to spend a couple $1,000s just to get a little piece of paper saying I can openly carry in Texas when I can concealed carry in every 50 state and every city in America now. So there is some problems that we need to take a look at that level. Now, the stigmatism of having PTS goes along with the stigmatism of getting in trouble. I heard testimony earlier about law enforcement officials and how they can determine who has a problem. A young man with autism or a young woman with autism, how do you determine if they can carry or not? How do you determine, you know, as a law enforcement official, if they're violent or not when they're nonverbal? As a law enforcement official, they can't read minds. They don't know if they're carrying weapons. And when somebody doesn't follow directions, then the situation escalates. So I'm asking you to look at, and I believe it was this young lady, I can't see her name at all, my glasses on, who mentioned training. As a young law enforcement person, I hated training. But as I went through my career, I realized how much training makes reactive in my mind and allows me and my other law enforcement officials to better understand what's going on. So yes, most definitely, law enforcement training is a big issue, as well as law enforcement funding and more law enforcement people and making sure they have what they need to do the business.
Thank you. Thank you for testifying. Just one question. What is that beautiful animal's name?
The beautiful animal name is Windsor. I got him from Retrieving Freedom Incorporated in Iowa. He went through 2 years of training, and I got him 3 years ago. And he is beautiful because one of us has to be.
Ms. Lopez, you may begin.
Hi, thank you for letting me testify here. My name is Laura Lopez. I'm a therapist here in El Paso. I'm in private practice, but I also contract outside with the prisons in Houston, Austin, Dallas, San Antonio, and all areas, setting up therapeutic communities. I've seen all sides of this problem. I recently retired from my private practice in July of 2019, and unfortunately, I had to reopen in August of 2019 because of the shooting. I was not only affected with family, my cousin's husband, David Johnson, passed away. I'm sorry. I have friends that were involved, and I have clients that were involved. The stigma with mental health is tremendous. In 2016, my daughter was shot in the head by her fiance of 9 years. They were in Arlington. I didn't find out till 4 days later when he finally called me and told me she was no longer with us. Regardless to say, I had feelings of homicide at that time because when I went to Arlington, the police officers there told me, "Get over it, lady. She was just another poor Mexican girl that got killed by someone who was too good for her." Her fiance of 9 years said he didn't know her. He denied knowing her, and until after the fact did I find out there was a lot of family violence calls, and the police did nothing because she was just another poor Mexican girl. Regardless to say, I had to get therapy because I did feel like having a mass shooting in the Arlington Police Department and with this man. I had to go to therapy in Albuquerque because here in El Paso, I either trained or I know all of the therapists. And the stigma of mental illness is so great, I would have lost my license to practice. So when we talk about who's at fault, it's not the gun. I learned a long time ago what malorum en se means and malorum prohibitum. Malorum en se is evil within itself. Prohibitum means the law. So when we go through this type of gun violence, in El Paso, I could say that in every other city I've done work in Texas, there was racism that was so palpable that I would go home every day and cry. But I knew that my guys and my women in prison needed help, and help they weren't getting. Therapy is extremely important to change this type, and it was very discouraging to hear that our district attorney said, once a criminal, always a criminal. You're a bad guy, you'll always be a bad guy. I grew up in the foster care system here from 11 till 17 when I was tossed out with the garbage bag of my clothes and said, "You're an adult now." I had anger and a polysubstance abuse, and now I specialize in alcohol and drug. This isn't a question of morality, because most law-abiding citizens who own guns follow the law. When we put it across the board. Well, if you're crazy, you can't have a gun. If you abuse drugs and alcohol, you can't have a gun. Well, you know what? This is the Second Amendment. You're not going to take away my right to vote as a woman. You're not going to take away my right to free speech. And you're not going to take my gun. This is something that I understand is for protection, not to hurt somebody. When we're talking about mass murderers, there is significant talk about them being mentally ill. But what if they were angry? What if they were abused? What if they're on psychotropic medications that I know personally, because I cut my teeth with dual diagnosis, that I know personally affect people's brains? Brain damage, traumatic brain injury, anything could set off people to do a mass murder, feeling frustrated with the government, feeling frustrated with law enforcement. I do assessments on men for the county attorney. And I've had people in the county attorney's office tell me, Laura, you don't understand. All men are perpetrators and all women are victims. And I saw that today in that Jane Doe, John Doe. There's a lot of women in women's prisons that have gone off and stabbed their boyfriends, husbands, children, whoever was in their way. As policymakers, what do when you don't know what the answer is? We take therapists, we take law enforcement, we take the punitive and the therapeutic, and we work together. I know in here, I've been born and raised in El Paso, and I contract all over Texas, and I don't know who the county attorney is. District attorney doesn't even know who I am. When do we talk? It's all about money, and it's all about who gets the clients, and it's all about favoritism, and it's all about just who knows who. As policymakers, I hope you can write policy that will coordinate all of these agencies to help stop this mass violence. My name is Laura Lopez. My daughter was Olivia Chin. And she was important. David Johnson was my cousin's husband, and now she can't survive without him. Every day she talks about taking herself out because she loved him so much. I love my daughter so much. If you just stop and think, if you got a phone call right now that said, your child is dead, wouldn't you go crazy? Wouldn't you be capable of murder? So let's stop vilifying and crucifying the other guy. And let's start working together. That's all we need to do. It's not the gun's fault. It's the person's fault. There is evil in this world. And we need to do our best instead of fighting each other and blaming each other, to do our best to get this and let no more lives be lost. Let the good guys have guns. And bad guys don't care about red flag laws. Bad guys don't buy guns legally. Every guy in the prison that I've talked to has obtained a gun either by stealing it from somebody's house or buying it off the street illegally. Red flag laws don't work. Thank you.
Thank you. Sincerely, on behalf of this committee and certainly this chairman, we appreciate your testimony. It's very powerful, and we give you our utmost sympathy for your tragedies that you've suffered with your family. So, again, thank you for your testimony. Randall, thank you for your testimony. And at this time, we'll call up the next panel. Chris Yost, Kenneth Kruger, Maria Gordon, and Ruth York. The next panel would be Bethany Hatch, Antonio Okafor, Princess Bevan, Precious Bevan, Jacob Centrone. this panel would be Chris Yost, Kenneth Kruger, Maria Gordon, and Ruth York. And I guess, Chris, you're the first one. Again, for the record, you'll have to hold the button down and tell us your name and who you represent. You might pull that microphone a little closer so that we make sure we record this information, this testimony.
Okay, thank you. My name is Chris Yost. I'm representing and testifying on behalf of Open Carry Texas, El Paso. I'm the Legislative Affairs Director of the local chapter. First off, I'll just say thank you for coming down and speaking with us today. And thank you again, Chairman Darby, for allowing us to go over just a little bit over the allotted time to get our points across. I would also like to, as a veteran and former law enforcement official myself, I'd like to thank and commend Mr. French, who just spoke. As also a veteran with PTSD, it's not easy for us to talk about that. With that being said, I have provided with my testimony some copies of statistics as well as evidence, which would be the last page entitled Attachment for Record. I'm more so going into talking point number 5.
I don't know, Chris, have you already distributed that to the committee staff?
Yes, sir.
Okay, we'll get it distributed then, so go ahead.
Okay, let me begin now, thank you. As I said, my name is Chris Yost. I'm a United States Army infantry and disabled veteran who served in Operation Iraqi Freedom.
Chris, let me interrupt you. If we have your written testimony, I know from my standpoint, I can read that. What I'd like to hear is your thoughts from your heart. Just tell us why you're here, what's your testimony, and tell it from your heart, and we'll be fine.
Thank you, Mr. Chairman. With that being said, I'm basically speaking out against red flag. And I know the talking point number 5 was briefly talking about, I guess, looking at ways to either incorporate or things dealing with red flag. From a law enforcement point of view, it violates due process. With red flag you're operating off of the premonition that a crime may be committed. So by executing such legislature or even implementing red flag laws, you basically are guilty until you're proven innocent. That goes from the point where a person operates off of hearsay, which we know is not legal grounds for a warrant or any type of legal action. We have seen many cases in the U.S. so far in places not too far back as Maryland, where a gentleman was killed by the police for standing his ground because the police came in the middle of the night, no knock and announce, which is the legal precedence, kicked his door in, and he opened fire thinking it was an assailant. They murdered him by riddling him with bullets. And the media put out that he was the bad guy for it. I fear that this is going to be the new wave of government-funded gun violence. Working with ICE, I'm retired. I worked in child sex crimes for 5 years here in El Paso. I'm retired due to part of that is my PTSD from seeing the victims, as well as my military PTSD involving children. With the topic I just brought up about the government-funded gun violence, Operation Fast and the Furious was something that hits home, I'm sure, with all of you being Texas residents and everything that happened along our border. Border Patrol Agent Brian Terry was murdered with weapons that the Obama administration knowingly and willingly allowed to travel to Mexico through straw purchasers or straw buyers. A colleague of mine, Jaime Zapata, ICE agent, was murdered with weapons from this failed operation to do gun control. That was just the beginning. We have seen everything as far as back in, if you can recall, in France in 2015, the terrorist attack that happened then. One of the weapons that were seized was linked to Operation Fast and the Furious. The raid that arrested El Chapo Guzman, one of the 19 weapons was linked to Obama administration, Fast and the Furious, and that is in one of the handouts that I provided you with my testimony. So the red flag is not productive. Basically, what you're doing is you're restricting the rights of the American people to protect ourselves from you, from government. That's what the Second Amendment was for. Shall not be infringed means shall not be infringed. You do not touch it. It is the glue that holds the Constitution together. And as you said, it is a sore subject, but you know, it opens Pandora's box. When you get rid of the guns, what's next? Our First Amendment, our freedom of religion, and I know this doesn't directly revolve to you. It's just a generalization, but that's my big concern, my fear as a veteran, that I traveled 7,000 miles overseas to take one tyrant out, and I'm afraid to come home and face another one. And that's unacceptable. Thank you, Mr. Chairman.
Thank you, Chris. This time, Kenneth Kruger.
My name is Kenneth Kruger, and I'm addressing item number 3, the role of digital media and technology in threat detection, assessment, reporting, and prevention. As a former communications chief in Iraq, we used a machine called the Chameleon. It blasted out a signal spectrum that basically neutralized cell phone initiated IEDs. You know, you see so many people in this technological age, probably the age of 7 on up, with a cell phone in their face most of the day, probably not half the night, but anyway. If they can, if the NSA can reach out there from those satellites and receive a whole lot of intelligence from everybody in this room, everybody in this state when they get on their phones or whatever, computers, there ought to be a lot of information that you can sort through to pinpoint somebody in computer milliseconds that can identify a threat in Socorro. Sorry, the chief ain't here to hear this, but it's so immense. Maybe you guys can't fathom that amount of information. I saw a helmet of a F-35 strike fighter, and it cost $1 million, and I couldn't understand how the pilot could receive this information and process it in a timely manner in order to either get in and get the bad guy and get out, or get the hell out because there's too many bad guys to get in for. Have you guys heard about the Great Hack? Anybody? Well, there was a company called Cambridge Analytica. They were over in England, and they were mining information from Facebook. Whistleblower put out on the internet that they mined 87 million Americans' personal information. How they did that is they created an app and an algorithm, and then they put that app in on me. Once they got to me, then they jumped on all my friends and contacts. Well, that goes for all of us, not just me. You know, Senator Cruz, I think, engaged in their technology. Ambassador Bolton is in the process of doing it right now, and to my knowledge, the president did it in the 2016 election. I don't know how true that is, but maybe it'd be something for you to look out. If this chameleon can blast out a signal spectrum, then why can't you figure out with your IT techs a technology that will allow you to receive NSA, NCIC, TCIC, and any other fusion cells that are here that they can get out not only to you, but local law enforcement, and if the guy skied off to Dallas, we'll catch him in Abilene or something. You know, it's not far-fetched with the technology we have available to us today. The Fusion Center over there on Biggs Field, what are they exactly doing? Are they the local, because I don't know none of them, are they these local bureaucrats that can take that information and say Mr. Kruger has a gun, because I got a gun in Houston at the, what's the sports store, Academy. And I waited about 7 hours. I don't know why it took so long for my background checks to come up. I was given a top secret clearance by the United States Army. Go figure, you know. But with that information that's available to us, could be available to you if you avail yourself to that through your experts down in Austin. I think I'm just about done. One quote I'd like to leave you with. This is AOC's statement in 2018. Owning guns is not a right. If it were a right, it would be in the Constitution. Second Amendment, December the 15th, 1791. I don't want to tell you what Joe Biden said, but I will. No ordinary American cares about constitutional rights. That was in 2015.
Thank you, Mr. Kruger.
Thank you.
Maria Gordon. I think, Maria, we need you to sign your witness affirmation after you testify. You may begin. We'll need you to drag the mic over and hold the button down. Just hold it down.
Hold it. All right. Good afternoon. I got here at 8:30, so I've been here all day. I only took a 5-minute break, so bear with me because I am tired. I heard everything you all said. It is very interesting. What occurred on August 3rd should never have happened. And Walmart needs to be liable for all these wrongful deaths. I think that the laws need to be enforced that are in the books. Absolutely. We're not dealing with bubblegum. We're dealing with guns, and we're dealing with dangerous minds. There's a lot of ideologies out there. Our country is divided, and we are in a state of war. Another thing, I want you to pass Bill 3191. That's the least you can do for domestic violence victims. Another thing, protect your officers. We are a gun-happy society. That's why we have so many mass shootings and so many children being killed by guns. That really upsets me because these are law-abiding citizens that have a license and their children get to those guns. Unacceptable. With that, we should wake up, start thinking about liability, add it to training, education, when someone possesses a gun lawfully, because they're not doing a good job of keeping their children safe in that home. And no child should be anybody's victim, especially a gun owner. Another thing, again, you're going to piss off a lot of people when you come after their guns when you have already given them a license. Because of their doing, they need to take responsibility for the crimes that they are committing. And domestic violence is a crime. So therefore, protect your officers because they're probably going to end up getting killed when they go confiscate. You put it in the law that they have to turn in their guns. Don't put those officers in that jeopardy. We need them. We have few of them. We have one sheriff in Chaparral, New Mexico, and they think that that's cute. 1 or 2 sheriffs coming from Las Cruces with a large population. Now justify that. We're here in the United States-Mexico border. We're in the safest city, really? Next to the deadliest city where these mass shootings happen almost on a daily basis. Another thing, make it a state crime. If they lie on a federal application, we're not dealing with bubblegum. We're dealing with guns and dangerous, negligent people that own guns that actually, if you look at the statistics of the incidents that happen in those homes, it's horrendous. Wake up. Another thing, this domestic terrorist white supremacist that came into El Paso is going to get indigent care at the taxpayer's expense. After all this is said and done, it'll be 10 million or over. Where is our fiduciary requirements here? Who is watching the taxpayer? Who is watching those hardworking blue-collar families that have no time for their children because they're working 2 jobs to be able to put food on that table, insurance, and everything else? Another thing, the governor gave you 5.1 million, and then the DA is going to take 1.5, and then all these administrative costs 1.5, and we're looking at a death penalty where it's on an automatic appeal in Texas. Okay, well, that's more expenses for his appeal, and then he wants a 3rd lawyer? Really? A domestic terrorist is getting all kinds of treatment. What does that tell our youth that are studying law? What does that tell our families about us as Americans? Yes, we have due process, but we do not negotiate with terrorists. Where is the FBI? Why aren't they here today to talk about domestic terrorism? I know we had a judiciary committee. I was here. But it's time to wake up. And we need to not keep them alive so many years. They harm a community. They brutally go in and slaughter innocent people, especially this one. Old ladies, children, getting school supplies. Terrorizing the kids at the school with about 12 lockdowns. An average high school student has already experienced the anxiety of somebody in the insane asylum. How would you like to be that child on a lockdown on a regular basis?
Ms. Gordon, I'm going to have to.
Thank you.
Kind of,
God bless you. Thank you for coming to El Paso.
thank you for being here.
Semper Fi.
Thank you. Ruth York.
I'm Ruth York from Cisco, Texas. And I'm speaking for myself and for Tea Party Patriots of Eastland County, of which I'm vice president. Regarding committee charge number 4, stats vary, but in the last 50 years, Texas lost less than 200 people to mass violence. Now, every such death is an unacceptable tragedy. Still, we must acknowledge that it is a tiny number, shocking, horrifying, and disturbing, but statistically very small. Closing the gap entirely is impossible, but we can narrow it. I thank you for assessing the cost. The cost of hiring additional personnel to prevent future mass violence is not only astronomical. Economically, it would be extravagantly high and unjustifiable. To be really honest, the money would be better spent on reducing drug use or alcohol. The deaths attributed to mass violence. But what is the cost? Besides financial, we must consider the cost to liberty. To reduce these approximately 4 deaths per year on average, your committee has heard a lot of ideas that, quite frankly, have an unacceptably high cost to Texans' liberties. 2 quick examples. Curtailing Second Amendment rights, which the framers said shall not be infringed, and hollowing out the Fourth Amendment protections to be secure in their persons, houses, papers, and effects by monitoring private communications. Happily, there are cost-effective measures we can take to reduce mass violence. Number 1, gun-free zones. Over 90% of mass shootings occur in gun-free zones. Reduce them, and that cost 0. Schools. Encourage concealed carry by classroom teachers who know and love and are with the students when this happens. Texas teachers have protected hundreds of campuses for as long as 15 years with no negative safety incidents. The cost, that's 0 to minimal. Churches. Sadly, Texas has provided a classic demonstration of what works and what doesn't. Sutherland Springs had no defense in place, resulting in the death of 27 people. White Settlement did have a trained security team. Lives lost, 3. Encourage church security teams. The cost to the state, 0. And number 4, John Adams said, the Constitution is suitable only for a moral and religious people. It is wholly unsuited to any other. And there is our best hope. Encourage Texans to become, once again, a moral and religious people who value self-reliance. Because when seconds count, police are minutes away. And the cost for that is 0 to extremely minimal.
Thank you for your testimony. I think Ms. Gordon will need you to sign your witness affirmation form. We'll do it down at the front desk. This time, the chair will call Bethany Hatch, Antonio Okafor, and Parissus Bevan. Jacob Cintron is registered not testifying. The next panel I'll be calling will be Michael Herader, Carol Cassidy, Ann Garcia, and Roberto Ortega. So Bethany Hatch.
Hello. My name is Bethany Hatch. Thank you all for being here today and for hearing our testimony. 19 minutes. That's how long passed between when the El Paso Shooters Manifesto was online and before the first 911 call. According to an FBI study, only 40% of shooters in a study of 160 made threats and confrontations prior to the incident, and only 3 did so via electronic or writing means. From today's testimony, we've heard what a challenge it is to develop a profile of a potential attacker. And there's no way to implement more laws without further violating due process, which is a cornerstone of our great nation. In comparison to the El Paso incident, we recently saw what happened when a citizen was empowered to effectively be the first line of defense against an attack. 6 seconds. That's how long it took Jack Wilson to stop the threat at a church in White Settlement. He prevented an attack that could have been even more devastating. From 2012 to 2018, a study showed that women with carry permits has increased by 111%. What better empowerment for a woman against a perpetrator of domestic violence than the ability to arm themselves? So, instead of implementing fear-based policies, we should fully equip law-abiding citizens with our inalienable right to defend ourselves and to flip the fear onto criminals intending harm. Give good guys the upper hand, so that instead of us wondering when another coward will pull a gun on unarmed citizens, let them wonder. Let them be the ones to fearfully consider if their cowardly attack on innocent parties will be uncontested, or if they will find themselves in a crowd of law-abiding, firearm-carrying Texans who will defend themselves. How can the legislature empower us to face true evil? By following the example of 16 other states and implementing constitutional carry. Because that will be the difference when we're faced with a life and death incident and giving us the right to defend ourselves. Thank you.
Thank you. Antonia?
Hello, I'm Antonia Okafor. I am probably the most important thing is I'm a native Texan from Dallas, Texas, born and raised. And I find it really interesting, first of all, I want to say thank you guys for so much for being here and listening to us. But second of all, I've been hearing a theme, and the theme has been particularly when it comes to women.
Antonia, I don't want to disrupt your train of thought, but are you here representing yourself or Gun Owners of America?
I'm sorry, I am representing Gun Owners of America. I'm the Director of Outreach for Gun Owners of America.
Thank you.
So again, I find it interesting that I find a lot of testimony and a lot of people talking about women. But unfortunately, as a woman, I'm not hearing what I know of women just like me, and that they are empowered, capable individuals. Another part about my history is that I'm a sexual assault survivor. And the reason why I want to tell you guys that is because my whole life has been about trying to not only empower myself, but of course, empower other women like me. I identify as a feminist because I believe that the most important thing that I can do is empower other women to take safety into their own hands. And when it comes down to talking about domestic violence victims, when it comes down to talking about sexual assault survivors, I'm very, very cognizant about talking about them as survivors because we are survivors. And that journey has led me to where I am today, which is a certified firearms instructor. And I am now in Colorado. I got married, so I had to leave. The only reason I would leave Texas. And in Colorado, I have the distinct privilege of giving free concealed carry classes to only women in Colorado. And I've spoken to people who are domestic violence survivors, sexual assault survivors, people who after El Paso actually came up to my class because it's a free class and because concealed carry is so cost prohibitive, to get a free lesson so that they could protect themselves and people that they care about. Single mothers like my mother who have taken care of their children because they had to be the mom and the dad too. So I want to leave you guys with the fact that this rhetoric, this narrative has been about what can happen when a man uses a firearm against a woman. Just like she had just said, I think it's important that we turn around that narrative and remember that yes, now in the US of A, 22% of gun owners are women, and women are taking empowerment into their own hands. And that starts with knowing that gun rights are women's rights. Thank you.
Thank you for your testimony. Next, Chris.
Good afternoon. My name is Percy Bevan. I am a mathematics instructor, a wife, a mother of 3, a disabled veteran, and a volunteer with Moms Demand Action for Gun Sense in America. The reason we're here today is because of a horrific mass shooting that took place here in my hometown. El Pasoans are still suffering and grieving and want you all to do something to make sure this doesn't happen again. We also know that gun violence is a complicated problem and not one policy will solve it. One of the things this committee could do to prevent mass shootings is to make sure domestic abusers aren't able to keep or obtain firearms. A history of domestic abuse and mass shootings more often than not go hand in hand. For example, in the last 50% of mass shootings between 2009 and 2008, the perpetrator shot a current or former intimate partner or family member during the mass rampage. Unlike many states, Texas law does not lay out a process to ensure that abusers who become prohibited from having firearms turn in their guns they already have. Under federal and Texas law, it is generally illegal for domestic abusers, including those convicted of misdemeanor crimes of domestic violence and those subject to final domestic violence restraining orders, to buy or have a gun. However, Texas state law currently provides no uniform process for abusers to relinquish firearms they already have in their possession. Many states, including Louisiana, have enacted their own state laws requiring abusers to turn in firearms when they cannot possess them. States with laws that require prohibited abusers to relinquish their firearms see a 14 to 16% lower rate of intimate partner firearm homicide. Texas should also close the boyfriend loophole in its gun laws. Current Texas and federal law bars certain abusers convicted of misdemeanor crimes of domestic violence from possessing firearms. but the law does not include abusive dating partners who do not live or share a child with the abuser. This gap in this law has become increasingly deadly. The share of homicides committed by dating partners has been growing for 3 decades. And now women are as likely to be killed by dating partners as by spouses. Texas has closed this loophole for abusers subject to domestic violence restraining order. Texas should finish closing this loophole and prohibit abusive dating partners convicted of misdemeanor crimes of domestic violence from possessing firearms. Even the most recent shooting at the West Freeway Church of Christ, the shooter had ties to domestic abuse and was likely prohibited from purchasing an arm. We still don't know how he was able to obtain the weapon, but what we do know is that it is all too easy for people who are prohibited from having guns to obtain them due to the holes in our background system. Additionally, many have focused on Jack Wilson, who shot and killed the shooter that day. Mr. Wilson is a gifted firearms instructor with years of experience training people at his own gun range. He is also a former reserve deputy with a local sheriff's department. He was not an ordinary license to carry holder. He has extensive training, and because of that, he was able to stop a horrible situation from getting worse. His actions should not be used as a reason for putting more guns in more places. It seems like every time there's a hearing, there are new acts of gun violence to talk. Rather than repeating gun lobby talking points about good guys with guns, we should all do something to prevent people with dangerous histories from getting guns. Now is the time to take proven steps to reduce gun violence by requiring a background check on every gun sale, enacting a red flag law, and strengthening our domestic violence laws by requiring domestic abusers prohibited from possessing guns to turn in the guns they own, and closing the boyfriend loophole. Policies like this respect the Second Amendment while keeping our communities, women, and children safe. We can do more to reduce the gun violence that claims the lives of 3,000 Texans every year. Now, if I may, I would like to speak on my behalf and add my personal opinion as a previous public school teacher, as a mom of a special ed student, and as a person with mental health disorders. Teachers and police officers do not have enough training to recognize, to acknowledge, or even work with children, teenagers, and adults who are diagnosed or may need mental health and mental health evaluation. Teachers in Texas are required to take an ESL training if they have students whose first language is not English. If a teacher has only one gifted and talented student in the classroom, he or she is required to take 30 hours on GT training and a 6-hour update per year.
I'm gonna have to interrupt you here. It seems like we've gotten off topic. And we've got members that have another committee to get to, and we're trying to conclude this for everybody. But thank you for your testimony. At this time, thank you, panel. This time, the chair will call Michael Prater, Carol Cassidy, Ann Garcia, and Roberto Ortega. And the final panel, Antonio Aguero, Ronaldo Rivera, Greg Vera, Bertha Benavides, and Jacqueline Luna. Okay, so Michael Rader.
Sir, I'd like to thank all of you for coming. I usually do, I'm a substitute. My name is Michael Hrag. I'm representing myself. I'm addressing the following duties. Number 4, ongoing mental health, and a little bit of number 5. And I'll keep it short, my comments. Thank you all for coming. On my classes, I always say stretch a little. You all have been here a long time, so at least the students do that when I ask them. A couple of things that I do, and I noticed in my history of when they noticed an at-risk student, They got all the teachers in the campus together. It's very difficult on the secondary level. But they got them all together and they said, what is happening with this student that's falling through the cracks? So that took some time from all the teachers to do that. And so they addressed, at least started the procedure. Also, I'd like to read one thing. Title IX was passed by Nixon. He was a former president. No person in the U.S. shall, on the basis of sex, be excluded from participation in, be denied the benefits of, or be subjected to discrimination under the education program and activity receiving federal financial assistance. Those are the exact words. I'm taking that from Wikipedia. And there was, it got, a lot of the monies went for girls and stuff, maybe because some of the perpetrators on the mass, on these are young adolescent males, maybe some of that money needs to be distributed to find out psychologically like that. And I'll end with this one thought, and this is strange, it's not all about money. In Finland and in some of the Eastern countries, guess who the highest paid professionals are on the education spectrum? Can you all guess? Well, the primary school teachers, which is really strange to me. You would think the professors and all that, but they do it so the building blocks would go up. That's it. Thank you for your time, y'all.
Yeah, I want to recognize Chairman or Speaker Moody. I think he's going to have to leave and he wants to give us an alibi.
No, I appreciate it. We're trying to be efficient. We have the redistricting committee also here on the campus of UTEP today that's going to pick up their hearing in just a few minutes. I am fortunate to serve on both of these committees, as well as Representative Wally and Chairman Price. And so I respect very much the time people have spent here waiting to testify. And I just want to say it is in no disrespect, but serving on both committees, I'm going to have to get over there for the beginning of that one. And so I just wanted to say that before. So if you see me leaving, it's certainly not to disrespect your time or your testimony, but to go over there. And if you have something to say about redistricting, I will invite you to go to the McGoffin Auditorium starting at 4 o'clock. Another very non-controversial issue as well. Thanks.
Well, and before they get away, I just want to thank each and every member of the committee. It's been a long day, and I think this is your presence and your attention to this matter indicates the seriousness that we all view this subject matter, and thank you again for your service, and thank you all for coming. With that, Carol, you're next.
Oh, yeah. Gotcha. Thank you. Sorry to see you leave, Representative Moody. I brought some more constitutions, but I think I left you one when I last visited your office. Yes, I know. Great. Fantastic. Anyway, I'm Carol Cassidy. I'm representing myself. I am a member of a lot of different wonderful organizations here in El Paso. And anyway, I'm just curious, how many, do any of you know how many American schools experienced violence, gun violence, before 1990? Because I think, it compels us to do some homework in regards to this. I've left you a sheet there, but I do want to go through it because a lot of people present here, maybe still in this chambers, are not aware of these facts. And it was in 1990 that the 101st United States Congress decided to come up with this Gun-Free School Zone Act. So they set it in motion. Well, actually, SCOTUS ruled upon it in 1995 that they could not use the Commerce Clause. And that's what they used to pass a law prohibiting gun possession in local school zones. Well, as we all know, maybe, or maybe we don't, Colorado didn't erupt till 1999. And from then, all these other outrageous vitriolic assaults to our children. plus other areas, because gun-free zones have been posted on different businesses, et cetera, which you guys know. And then President Clinton decided by executive order to require no guns allowed on military bases, which President Obama reinforced. So we had the atrocious Fort Hood incident here in 2013. In any case, I'm here to suggest that the main solution is, of course, to go back to what we once had, abolish all gun-free zones. We have the right under our great Bill of Rights, which I think someone referenced earlier, that was enacted before our founding fathers would pass this Constitution in 1791. They required that great Bill of Rights and the First Amendment right, you all should know, which of course is you're allowing us here in the great state of Texas. And I want to compliment you all. That's one of the reasons I moved to Texas out of Washington State, where I came from. They would not allow us as citizens to stand up and voice our opinions we're entitled to under the First Amendment. But anyway, you know this, so it's the Second Amendment I'm standing with firmly. And of course, we should all have the right to carry across our, and that would end any of this stuff. Thank you so much. I appreciate it. Thank you. And the Lord bless you all. And I brought 10 constitutions. I passed these out. I've given out around 6,000, starting in my former home city of Seattle. But let me tell you, no matter what anybody says here, this city of El Paso, which I do love, my father was born in this city, and but Texas, I love firmly. This city is safer, probably 100% safer. Seattle, Washington, the city that sadly left in 2006. So thank you, gentlemen and ladies.
Thank you. Yes. Okay, Ann, I think you're next on my list.
Okay. Well, let's see. I feel more comfortable standing. I'm sorry. It's been sitting all day. I have a little energy to burn off here. I'm sure you guys feel the same way. I want to thank you, first of all, for being here, and also for listening to everybody.
Your name?
My name is Annie Garcia. It will appear on the Texas Democratic primary ballot for U.S. Senate as Annie Mama Garcia. I am a candidate for U.S. Senate. I've never been involved in politics. I've never run for politics, but I decided to run because I'm frankly fed up. I am a mother. I have 3 small children. I'm here speaking on my own behalf. I'm a mother. I have 3 small children, and I hear a lot of things going on here, and frankly, I'm kind of turned all around about what the reality is. So I have to go and touch my milestones to figure out what's going on. But let me tell you what I know. What I know is that in the United States, we are outliers. Across the world, no other country has the gun violence issue that we have, period. We lose more people in our country in 1 week, than most countries lose in an entire year. Now, those countries have video games, they have mental health issues, they have a lot of other things, so they all have it. But we are exceptional in this respect, and I just don't get it. I just don't get it. We're not that different. We're not that different from all these other countries. Iceland, in the time that we've lost 40,175 lives to gun violence, they've lost 0. The UK, 155 lives. Canada, 767. Mexico, less than 10,000. India, a much bigger country than ours, and they're less than a quarter of what we are. So what is going on here? I hear the Second Amendment. Yes, let's talk about the Second Amendment. There's something that precedes the Second Amendment, and it's called the right of life, liberty, and the pursuit of happiness. Now, I am all in favor of upholding our Constitution, our legal framework. But we are at such an imbalance right now that we need to talk about what is going on here, because there is a cost being paid. And it's not just for the obvious cost of lives lost. It's the 100,000 people that end up in the hospital because they've been gunshot. What happens to those people if they don't have insurance? Who's paying those bills? Are they going to get a bill from the hospital? Are tax dollars paying for it? Are hospitals paying for it? We have externalized the cost of this, and I want it to go back on the people who want to keep their guns. Keep your guns, that's great. Now I want insurance companies involved. I want insurance companies to assess risk. Why is it that I have to go and get liability insurance for my car, but a gun owner doesn't have to go and get liability insurance for his or her gun? Credit card companies, they're financing the guns. You can't buy Bitcoins on credit cards, but you can buy guns. These guns are financed by credit card companies. I want to ask you guys something. You all are in the business, or rather, you are in the service of public service. You've made a choice to be here, and I applaud you for that. I thank you for that, because this is not easy. It's not easy sitting here. It's not easy coming to a community that just so recently suffered, and to listen about all the people that are suffering who have lost lives. This is hard, hard work, and I respect you and I applaud you for that. Are you okay with this? Are you really okay with this? Please tell me. Are you okay with this? 40,000 American lives every year? Is that an equation you're okay with? Is it? I really want to know about this, or are we not? And if we're not, then why are we not doing it? Because from my perspective, I think it's very simple, and please correct me if I'm wrong. But what I see going on is that there's a party that wants to keep political power, and they've traded their duty to represent people, because people want safe societies. People want to live in a place where they don't have to fear that going into Walmart the other day, and I saw a guy who was strapped up with ammo. What's my right? Do I call the police? Can I call the police? Am I allowed to call the police? What are the police going to do? Do I warn that other mother with her 3 kids not to go in because I don't know what the hell he's going to do? This is our American society, and I really want to know, are you okay with that? Is that okay? Do we accept this as Americans? Because if we do, then I need to know that. But if we don't, then we need to figure this out, because people are literally dying here for this.
Please no outbursts. Please, please. No clapping. Thank you for your testimony. This time, Roberto Ortega.
Yeah, good afternoon. My name is Roberto Ortega, and I am here on my behalf. And I'm going to summarize my 2-hour speech into 2 minutes. And first, I want to start with an assumption. I'm assuming that if each person in this room could foresee the future 10 years from now, and you were to foresee that your spouse, your children, or your grandchildren were going to be murdered, you would do everything on your behalf to make sure that guns were banned. Okay? Now, hopefully that's not going to happen to any of us. But unfortunately, it is going to happen to thousands and thousands of people for the next coming years. It's going to happen. That's a guarantee. Now, I'm going to identify 5 countries: Canada, Italy, Finway, Norway, and the US. And what do these 5 countries have in common regarding guns? They have the easiest gun laws in the world. And unfortunately, who's number 1? The USA. Now, let me mention for other countries: UK, the United Kingdom, Japan, Australia, and Scotland. And what do these 4 countries have in common? Among others, what do they have in common? Guns are banned and they're illegal. Now, are things working in those countries as far as murders? Definitely. For example, Japan has a population of approximately 170 million people. In 2014, how many people were gunned down with guns in Japan? 6 people, in comparison to the thousands in the US. Scotland, in 2014, how many homicides occurred? 3. So are the gun bans working in those countries? And I can also mention Australia. Back in 1996 in Australia, a gunman killed 35 people. And what did Australia decide to do? Ban guns. So they're not having problems today like we are. In the United Kingdom, what's going to happen to a person that gets caught with a gun? They're going to end up 5 jails in prison. And that's much better than having thousands and thousands of people here killed like we do in the US. Now, guns basically are used for two reasons. And I think you know them. They're used to kill people and they're used to kill animals. And some people love hunting. And again, if they were hunted, well, to me, it doesn't make any sense. Why is it we want to go out and shoot birds? Why is it we want to shoot deers? Would you like it if your dog, that's also an animal, somebody came and shot it? So there's no reason for killing animals. People that love hunting got to pick up other hobbies. Try golf. I love golf. And it's fun. Get away from hunting. The second reason guns are used, besides killing animals, killing people. Okay? If we get rid of guns, these things are going to stop. Now, the Second Amendment. The Second Amendment was appropriate back in the 1700s. It made sense. And even the 1800s. But the 1900s, the Second Amendment does not make any sense. It does not make any sense today. Why? Because people have guns, and those guns are used to murder people. We got to get rid of the Second Amendment. Thank you.
Thank you for your testimony. Thank you, panel. At this time, the chair will call Anthony Aguero, Ronaldo Rivera, Greg Vera, Bertha Benavides, and Jacqueline Luna. And I'm going to go ahead and call up to the front row Alexandra Hernandez and James Pianato. We'll show that Bertha Benavides is not going to testify and Jacqueline Luna is not going to testify. Anthony Aguero. Is there an Anthony Aguero? Okay, we'll show him as not testifying. So I guess Ronaldo Rivera, that's you? Okay. Greg Vera, okay. Alexandra, that's you. And James, that's you. You're our last panel, so anybody in the audience wishing to testify before this committee, would you please fill out a witness affirmation form with the staff? And with that, we'll begin the final panel. Please begin. Ronaldo.
Good afternoon. My name is Ronaldo Rivera. I'm a retired U.S. military, retired federal service employee, a veterans lobbyist, and a full-time nonpartisan thorn with politicians. Now, what I'm here about is to have you consider two things before you enact any new laws. One is, how are you going to identify the shooter or any other shooter here in El Paso? If you identify him as a terrorist, there's definitely some pitfalls in that. If you're identifying him as someone and saying that's got pitfalls too. Now, what I'll explain is, okay, the object or goal of terrorism is to create friction between the government and the public by oppression through laws. So if you identify him as a terrorist and then you come up with new laws, you just fed into terrorism. If he's insane, then you have to consider this. We can all pass a background check today, but that doesn't mean that you won't lose your mind tomorrow. And when you get to the point that you want to take human life, you've lost your insanity right there, regardless if it's one person or several persons. What really concerns me is that in a rush to judgment here, we're going to trample on due process. You know, I've heard mentioned that the shooter should not have 2 or 3 lawyers. Regardless of what he's done, He's still entitled to due process. That's what we're about. The other thing is the red flags. You're denying due process there. And if you start denying due process in those two areas, what's to stop some government official from coming to your house and just grabbing you without due process and put you in jail forever? I mean, that's what the Soviets and the Chinese do. Do we want to go that route? I don't think so. But anyway, think about those two things before you identify the shooter and decide to enact any laws. If you change the laws or enact new laws, you fed into terrorism. If you declare him insane, every one of us could fall in that category tomorrow. Thank you.
Thank you for your testimony. Greg?
Thank you. My name is Greg Vera, retired military, also retired federal law enforcement officer. My experience is very simple, and the idea that I believe in a strong government and with less and less regulations. By instituting more regulations, you infringe on the individual rights. Remember, we have rights over the rights of the individual, over the rights of the state. And I'm a firm believer of the Second Amendment, simply because when governments do fail, which let's hope they won't, we're the last final form of defense. You saw it on the situation where it was in White Settlement, Texas, where one individual, a 71-year-old gentleman, I'm not going to get into his details, you can find it online. He stopped a perpetrator only with one single shot. That's a perfect example of a bad guy being beaten by a good guy. Yes, it only took 6 minutes here in El Paso for El Paso PD to reply. However, if you listen to a tweet that President Trump stated, that individual, it really took 6 seconds for that single perpetrator to be brought down. We should simply learn what President Trump tweeted. And then we're in Texas, that we have not only the Second Amendment, but we also have the right to conceal carry. And last time we talked, we were here, you mentioned about what's simply called gun-free zones. And you also covered small amount of time on what's called school marshals. That's an excellent topic, simply because you can have retired officers like myself and other military personnel that be willing to do this thing voluntarily in civilian attire, within the school grounds, during the opening schools, and any major facility, and prevent situations like the one that happened that we've seen here in El Paso, to have us in school zones, have us in synagogues and churches, and even supermarkets. I assure you, don't get me wrong, as an officer and helping out the law enforcement, it takes a long time. It took the El Paso PD 6 minutes, while to really take a perpetrator to stop, it has to be right that instant. That's the only way to stop it. In addition to that, we should follow the example that if we lead the country, if concealed carry licensed carriers legally, that's the only way we can stop other perpetrators. Thank you.
Let's see. Oh, next page. Alexandra Hernandez, go ahead.
Thank you. My name is Alexandra Hernandez. I am a student here at UTEP and a mother. I am here representing myself. Thank you. I gave birth to a beautiful girl this past summer. Thankfully, I have family members who on occasion can help me take care of her when I go to school. But due to that, I had to take night classes. As a student here at UTEP, at the end of class, I had to walk to my car alone through the neighborhoods where I park since I can't afford a parking permit on campus. As the year ended, the walk to my car seemed longer because the day got darker. God forbid something were to happen to me during that walk. I wanted to be able to protect myself and bring a quick end to any bad situation by defending myself. In a serious situation, I do not want to have to defend my life on a police officer that is 10 minutes away or probably even longer. The mayor of El Paso testified at the El Paso hearing of the shooting that our officers arrived very quickly. I'm sure they did, but sadly enough, they arrived after the event was over. I'm sorry, but I will not take the chance that someone might or might not hear me call out for help and possibly come to help me. I have the right to defend myself and my family in a dangerous situation. No one else is going to have the same urgency or concern for my safety or the safety of my family. I want to go home to my husband and daughter every night. On August 3rd, 22 people died and 24 were injured. My question is, if someone had open carried their firearm on that day, would the number have been the same? I have the right to defend myself and my family. Thank you.
Thank you for your testimony. James?
Folks, thank you very much for coming to El Paso. It's really hard to get to Austin, so this is much appreciated. My name is James Paynago. I'm a private citizen, and I'm also a director for Open Carry Texas in El Paso and much of West Texas. My community, El Paso, came together in the aftermath of the shooting, and we all came together to be there for each other as best we could and present to the country a strong community. It's an awkward position to be in with the eyes of the nation on your hometown, and some of your representatives, not all, just want to fling hatred for partisan politics. Thankfully, most of our priorities were on taking care of the victims and try to make sense of what happened and seek out what must be done, if anything. I observe in communities after a tragedy that at minimum, phrases like El Paso Strong become hashtags and get printed on stickers and t-shirts to raise money for victims. But what I wish to convey to you all is that so much more is possible, which defines a strong community. Examples which I believe communities across Texas should take heed of as exemplary. In the aftermath of Hurricane Harvey, everyone across the nation was in awe with what Texas Strong looked like. While government bureaucracies did indeed play their role and cities such as our own lent resources to help, it was the organic arrival of monster trucks and the Cajun Navy that had everyone sincerely inspired. A tech innovation by a local app developer created the most efficient system for identifying who needs rescue and the status of their environment and where they are. Such examples of individual empowerment and community ability to respond and lend aid has become, for me, the standard of a strong community, what a strong community looks like. As state legislators, I wish to impress upon you your ability to either empower individuals and communities with that strength or make serfs of Texans dependent upon government for things which I believe, honestly, it'll never be equipped to provide adequately. The sheer amount and variety of ways private citizens and civic groups were able to effectively mobilize aid, all derived from a prosperous and free citizenry whose rights are protected vigilantly by our state government rather than threatened. Imagine if in Texas after the Civil War, lawful gun owners' rights to carry was never infringed upon because they were afraid of freed slaves being empowered with their rights. Imagine rather than Firearm Prevention Month, we had families and educators holding Firearm Training Month. An educated society is more empowered to exercise freedom morally and responsibly. Such is why I oppose red flag law legislation HB 1391 by any means where the defense is not given the opportunity to defend themselves before confiscation. That is not due process, and the likely for false positives degrade our community's bonds with one another. Your job rather should be to pass constitutional carry in order to empower citizens such as the victims, male and female, mentioned this morning. As to mental health, I wish for you to take from my testimony that the more decisions you take away from citizens via increased spending, taxation, and regulation, the more the state legislature lessens Texans' ability to build upon ourselves and our communities. You don't get the Cajun Navy. You don't get Stephen Williford in Sutherland Springs or Jack Wilson in White Settlement. Responsibility and morality both become more scarce in a society that sacrifices our rights and liberties out of fear and ignorance. What you get are these mass shooters writing pages of what I view as mental and emotional anxiety over issues they feel helpless to address more constructively. They don't have the tools because the individual, the family, the community has become less empowered as Austin and DC make more of these decisions for us. Last point, as I look upon the state of Virginia, or better yet, Hong Kong, literally threatening its own citizens, we cannot allow Texas to veer close to such dystopian nightmares. A gentleman cited mass shootings this morning as the biggest mass shootings in American history. He left out Wounded Knee, where the U.S. Cavalry gunned down 290 men, women, and children. Another siege outside of Waco, Texas resulted in 76 women and children, and men, women, and children slain needlessly by the FBI and the ATF. We have a Second Amendment not as a constitutional right, but as an inalienable right to protect citizens against tyranny. Sic semper tyrannis.
Thank you for your testimony. We do have two other folks that want to testify, Megan Ariola and Jaime Ariola. And again, we show that those are the last two witnesses. So come on down, Megan and Jaime. Okay, identify yourself, Megan, and your dog.
Hi, my name is Megan, and my dog's name is Clark. He's a Cardigan Welsh Corgi.
Your last name, too.
Ariola. My name is Megan Ariola, and my full-time job is being a YouTuber. I have over 200,000 followers, and that is more people than vote in El Paso, with over 24 million views. I've been in Texas my entire life and raised with strong Texas values. Being a worldwide influencer, I've been able to see the endearment that the rest of the world holds for Texas. We are a place like no other. The values we hold since the days of come and take it are what has allowed for us to prosper so much as a state and has brought so many people here. Jack Wilson just recently proved that when citizens are given their full rights to organize and defend themselves, evil is stopped in its tracks. Jack Wilson represents average Texans who have been training to shoot their entire lives. People with carry license, like me, have been trained to carry a weapon. More legislation is not the answer. We need to work at enforcing current gun laws. Those caught breaking gun laws are not prosecuted to the fullest extent of the law. We are giving more punishment to nonviolent crimes. Guns are not the problem. The problem is letting violent offenses turn into smaller misdemeanor charges. The best thing Texas has done in the last year is let churches arm themselves. There you have prevented countless lives from being lost. There's a reason that across the border is one of the most dangerous places in the world and a city with one of the highest rates of crimes against women. And the reason for this evil is that guns are not allowed to law-abiding citizens. It is our duty as Texans to make sure we represent the rest of the nation by showing the value of the Second Amendment and do not take away rights like in Virginia. Don't California my Texas. Thank you.
Thank you. Jaime?
Thank you so much. My name is Jaime Riola. I'm representing my campaign for Texas U.S. Congressional 16th District. I have decided to speak on item 1, 2, and 5. I'll divide them up that way. Item number 1, I feel the attention that the current mentality is to concentrate the law enforcement officer to create new laws. But the issue with it is that the laws are currently there but are not being able to be enforced appropriately. A lot of law enforcement officers do not receive the actual backing that is necessary through legislation and the justice system, and many times they have their hands tied to be able to perform and follow through with the laws that are already in place. Legislation needs to focus on giving them that control back and being able to get more ability to follow through with the laws that you all have made. Item number 2, I have worked myself in the federal government. One of the biggest issues that I found was the bureaucracy has become so mundane that sometimes when applying a report to one thing, you have to repeat yourself 2-3 times. The current system is that way. You have to apply it to one, then you have to repeat the same thing you wrote into another system. We need to utilize technology more efficiently, create integrations between the current systems, and be allowed to be able to have these systems to work more effectively for the community to ensure that we prevent these things and facilitate the process of communication between the organizations that have been set to enforce these legislations. And finally, item number 3, I have actually been a nurse for the last 10 years. I've done home health, I've done trauma health, and I've done behavioral health as well. And one of the things that I noticed is that many times we had violent patients who come in for violent crimes, and the crime was either decreased down to a misdemeanor or seen as a non-violent crime, but yet we have people who are non-violent, such as anxiety, depression, or other concerns of mental health, and they were being bundled up in the same situation. We should not be removing guns from people who do not have violent crimes and mental health. And when we say mental health needs to be part of it, we need to encompass that it is mental health with violent tendencies, not just mental health in general. Many of the, and then on the last part, biggest concern is that currently federal funding is not allowing research to be done as to how we can deal with these individuals. What we need to do as a state is be able to do that funding and do that research and fund the research that's necessary. As a nurse, I would never treat a patient without research, so why are legislations being done without that research? Thank you so much for your time.
Thank you, panelists. Is there anyone else wishing to testify? If not, registration is now closed. Do we have any further business, committee? Come before the select committee today? Okay, well, hearing none, the committee stands adjourned, subject to the call of the chair. Thank you again.